afternoon, ladies and gentlemen. And on behalf of Times Network, I, Pooja Jain, extend a very warm welcome to each and every one of you in the room to the India Health Summit and Awards 2025. It's truly an honor to have such an esteemed gathering of healthcare leaders, policymakers, innovators, and changemakers all under a single roof, and all united by a common vision. That vision, of course, is to reimagine the future of healthcare in this country. Now, as we step into the second edition of this prestigious summit, it's important to take a moment to look back. So last year, as many of you know, at the very first edition of the India Health Summit, we introduced a bold new initiative, healthandme.com, your trusted health expert. That's right, it was a platform designed to answer your questions, to simplify conditions from A to Z, and most importantly, to bridge the gap between you and your well-being. And today we're extremely proud to share that this initiative has already touched millions of lives, building trust, awareness, and empowerment in healthcare. And Times Network India Health Summit and Awards 2025 is essentially a platform to recognize that very effort and to salute trailblazers across the healthcare ecosystem. It's also critical that we mention that this summit and awards stems from a collaborative effort supported by an ecosystem of partners. And I'd simply like to take a moment to acknowledge them. That's right. The India Health Summit and Awards 2025 is powered by Intas. We're co-powered by Novartis and All Out. Our knowledge partner is Dr. MGR Educational and Research Institute. Our supporting partner is Fit India. Our strategic alliance partner is OneXtel Communications. Our wealth partner is Nuvama Wealth, and our outdoor partner is Heights. So a deep sense of gratitude from the Times Network to all of our partners in this effort, but we'd especially like to thank all of you. There's many ways to spend a Saturday afternoon, and you chose to be here with us. So a huge round of applause, please. I believe it's deeply deserved. A huge round of applause. Thank you for being here. So before we move ahead with the day, I'd like to offer you a quick look at the journey so far, and also a sneak preview of the vision that drives us forward. Ladies and gentlemen, I invite you to turn your attention towards the screen. Let's have a look.
Health is the foundation of every happy, fulfilling life. At Times Network, we believe that empowering people with the right information is the first step towards transforming healthcare. Last year, at the very first edition of the India Health Summit, we introduced a bold new initiative, healthandme.com, your trusted health expert, a platform that answers questions, simplifies conditions from A to Z, and bridges the gap between you and your well-being. In just 1 year, the response has been inspiring, with over 10 million active users turning to Times Network health platforms for credible insights and trusted guidance. And today, we take this journey forward, from last year's beginning to this year's transformation, from awareness to innovation, from access to action. Welcome to the Times Network India Health Summit and Awards 2025, a platform where innovation meets compassion, where technology transforms lives, where pioneers of healthcare are recognized and celebrated. One platform, one vision, one future.
Ladies and gentlemen, it's been an inspiring journey, to say the least, and it's really been a reflection of our commitment at the Times Network to drive meaningful change in healthcare. But now, to officially set the tone for this year's edition, it's my privilege and honor to invite to the stage a visionary leader whose work has been pivotal in shaping the future of media and digital transformation across India. Ladies and gentlemen, please join me in welcoming to the dais Mr. Rohit Chadda, Chief Operating Officer and President of Times Network, to kindly deliver the opening address. Huge round of applause once more. Rohit will shed more light on making healthcare sustainable with the optimal use of technology and the adoption of technology for improved accessibility and affordability. Rohit, the stage is yours.
Thank you. Thank you for the kind words. Good afternoon, everyone. It's an honor to welcome you all to the India Health Summit 2025. Respected Anupria ji, a gathering that reminds us of the tremendous responsibility and opportunity we have in shaping the future of healthcare in our country. Healthcare is no longer just a service. It's the backbone of national progress, a reflection of the values we hold as a society and a critical area where innovation can change lives on a massive scale. Over the past decade, the Indian healthcare sector has grown at an impressive pace. From being valued at around $110 billion in 2016, it is now projected to reach an astounding $638 billion this year. This growth is not just about numbers. It represents millions of lives touched, countless interventions, and a healthcare ecosystem that is expanding to meet the rising needs of our population. The government has recognized this urgency, allocating nearly 100,000 crore rupees in the union budget this year and introducing initiatives like the 50,000 crore credit incentive program to strengthen our healthcare infrastructure. But the question we must ask ourselves is, how do we ensure that this growth translates into better health outcomes for every Indian, regardless of where they live or what resources they have? The answer lies in how we leverage technology, how we integrate innovation with empathy, and how we create systems that are both advanced and accessible. At Times Network, we embrace our role in contributing to this mission. As a digital pioneer, through our platforms timesnow.in, etnow.in, Times Now Bharat, Digit, Times Drive, Zoom, and more, we have cultivated a vibrant digital ecosystem, reaching 150 million monthly users across 20 brands in 8 languages, with over 3 billion video views. Last year, we launched our health platform, healthandme.com, at this very forum. And I'm proud to tell you that in less than a year, it has helped us reach over 10 million health enthusiasts all across the country. Thanks to everyone here and a great team back at home. Technology is not a distant concept anymore. It is already changing the way we care for patients. Artificial intelligence can now detect subtle patterns that human eyes would miss, helping identify risks early. Genomics allows us to understand who is predisposed to certain diseases. Together, these tools have the potential to shift healthcare from reactive to proactive, from treating disease after it occurs to predicting and preventing it even before the first signs appear. And this is not hypothetical. Evidence from our own networks shows that AI and genomics are already improving outcomes today, demonstrating the transformative power of combining human expertise with technology. What makes India uniquely poised for this transformation is the energy and adaptability of our clinicians. According to the Clinician of the Future 2025 report, 41% of Indian clinicians are already using AI in their work, a 3-fold increase from last year. This is a clear signal that Indian doctors are not only willing but eager to embrace innovation, to learn, to adapt, and to deliver care in ways that were unimaginable a few years ago. At the same time, we must acknowledge the challenges. Advanced genomic testing and AI-enabled monitoring are still out of reach for many families. About 60% of hospitals and 80% of doctors are concentrated in urban areas, leaving vast rural districts underserved. And while technology offers tremendous promise, it also requires training. Thousands of clinicians need hands-on exposure to AI tools and continuous updates to ensure these systems are used safely and effectively. These challenges are real, but they are not insurmountable. With focus, intent, and coordinated action, they can be addressed. Today, we will celebrate the visionaries who have led this journey, people whose dedication, insight, and relentless effort have pushed the boundaries of what is possible in Indian healthcare. Their work reminds us that innovation, courage, and compassion can come together to create lasting impact. Beyond facilitation, we have curated panel discussions with thought leaders from across the healthcare ecosystem. These conversations are designed to be more than just discussions. They are meant to spark ideas, inspire collaboration, and generate action points that could evolve into initiatives far greater than any one of us could accomplish alone. Imagine a future where a child in a small village can access the same predictive cardiac care as someone in a major metropolitan city. Imagine nurses and frontline workers equipped with AI tools that guide critical decisions, saving lives even when a specialist is not immediately available. Imagine genomic insights becoming as routine as a blood test, allowing prevention rather than cure. This is not science fiction. It is within our reach if we act with purpose. Healthcare is not just about infrastructure or technology, it is about people. It is about empowering doctors, nurses, and caregivers with the tools that they need to make informed decisions. It is about enabling patients to access timely, high-quality care regardless of geography or economic status. Sustainability in healthcare does not come from cutting costs or expanding facilities alone. It comes from creating a system where innovation, equity, and human touch work hand in hand. The path ahead will require courage, collaboration, and clarity of purpose. But if we embrace technology with responsibility, if we invest in people as much in systems, and if we commit to accessibility and affordability, India can set a global example of healthcare done right. We have the talent, the ambition, and the momentum. Now we must match it with intent. Thank you, and have a great evening.
Thank you, Rohit, for sharing those insights, and I believe that your words will truly set the stage for the discussions that lie ahead today, that are all around shaping the future of healthcare in this country as we know it. So as it's customary at events of this caliber and this significance, we're now going to move on to the ceremonial lamp lighting, which of course symbolizes knowledge, hope, and the bright future of healthcare. And we're honored to have with us today Srimati Anupria Patel, Honorable Minister of State for Health and Family Welfare and Chemicals and Fertilizers, Government of India, who's gracing this occasion as our chief guest. I'd request that Srimati Anupria Patel kindly please do join us on stage for the auspicious ceremonial lighting of the lamp. Ma'am, it's an honor to have you with us. It's such a pleasure. We're truly honored, deeply humbled. And Rohit, if you could kindly join us as well. Huge round of applause, please, ladies and gentlemen. It's deeply deserved. All right. Thank you. Thank you. Thank you, Rohit. And to the Honourable Minister, I request that you please remain on stage, ma'am. You can take the podium that is to your left, to the podium to your left. And I simply once again want to thank the Honourable Minister and Rohit for lighting the lamp. This marks the official commencement of today's summit, and we, of course, look forward to a very inspiring day that lies ahead. All right. And with that, To the Honourable Minister, I'd like to offer you the floor to share your insights as to how you're shaping the future of healthcare in this country. We're very much looking forward to your remarks, ma'am, and with that, we hand it over to you.
Thank you very much. A very good afternoon. Shri Rohit Chadda ji, CEO and President Times Network, distinguished members of the medical fraternity, all the eminent guests, participants, speakers, ladies and gentlemen, it's my immense privilege to join you all for the Times Network India Health Summit and Awards 2025, a platform that unites policymakers, healthcare practitioners, industry leaders, innovators, media, and everybody together around one shared goal, which is health for all. And I truly value this opportunity to share my government's roadmap for building a healthier and a stronger India by 2047 as India completes 100 years of its independence. Friends, the aim of my government is to provide universal health coverage, ensuring affordable, accessible, and quality health care to all our citizens. And in the past 11 years, our government has actively pursued this goal to attain it by 2030 as part of UN SDGs. In the past 11 years, healthcare in India under the leadership of our Prime Minister, Shri Narendra Modi ji, has undergone a profound transformation. We have made a transformative shift in our approach towards healthcare. So today, healthcare is not just curative healthcare, but today, healthcare is comprehensive healthcare, and that's the shift we've brought about by rolling out the new National Health Policy in 2017. So we take care of every aspect of healthcare, from preventive to curative to promotive to palliative to rehabilitative and geriatric. That's how we look at healthcare today. And even the expenditure on healthcare has constantly been going up. So if I talk 11 years back, we were spending only 1.1% of the GDP on healthcare. But in all these years, that 1.1% of GDP has gone up to approximately 2% of the GDP. So we are steadily moving towards the goal of spending 2.5% of the GDP on healthcare as outlined by the new National Health Policy, which was rolled out in our government's regime. Friends, we have also tried to encourage the state governments, because public health is a state subject, so it's important that states also come together, join hands, and we've been encouraging them to enhance their budgets which they spend on healthcare. And that should go up to around 8%. And when states and center, everybody works together, we will be able to bring down the out-of-pocket expenses in India, which still remains to be a cause of worry. In 11 years, right from scaling up the medical education infrastructure, healthcare infrastructure, to providing financial protection to a large population, and to leveraging technology and digital innovations, we've been doing everything together. Just few days back, you read about the completion of 7 years of our flagship scheme, which is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Ayushman Bharat PMJ is not just a scheme. In 7 years, it has emerged as a social revolution. And why I say this is because Ayushman Bharat PMJ is today giving hope, today giving dignity to 62 crore vulnerable citizens of this country, which includes not just the poor, not just the elderly, but also the frontline healthcare workers and also the gig workers. So everybody is benefiting with a free of cost treatment worth 5 lakh rupees. So compared to the days when people would delay their treatment for lack of money, today Ayushman Bharat PMJ has given them a big hope, and that's why we call it not a scheme but a social revolution. And this Ayushman PMJ, coupled with initiatives like the Pradhan Mantri Jan Aushadhi Pariyojana, Amrit Pharmacy, Pradhan Mantri National Dialysis Program, the Free Drugs and Diagnostics Initiative, which is executed right from a sub-center or an Ayushman Arogya Mandir to a PHC, to a CHC, to a district hospital, which means all the primary and secondary government health facilities. And most recently, the GST 2.0, which brings a tax relief on 33 life-saving drugs, along with the health insurance premium. So all these efforts together have helped in bringing down the out-of-pocket expenses from 63% to 39.4% today. My dear friends, we have made a record expansion of medical education infrastructure in the country. Because shortage of doctors and specialist doctors and medical staff, that has remained a concern for long. So when our government took over 11 years back, we made a plan to scale up that infrastructure, and today, in 11 years, we have been able to increase the number of medical colleges from 387 to 809 today. The All India Institute of Medical Sciences have gone up from mere 7 to 23 today. And not just this, we are also establishing nursing colleges in co-location with all the new medical colleges which have come up. So when I talk about these efforts, it is just to indicate that in times to come, we will not face the shortage of doctors, specialist doctors, or nursing staff. We have made arrangements to take care of their availability in every nook and corner of the country, especially the areas which are remote and far-reaching. That's the kind of spirit we are working with. And we know that over all these years, in the healthcare infrastructure which already exists, there are critical gaps, and those gaps were highlighted during the pandemic. And India wants to prepare itself today to face any future health emergency, any pandemic, any disaster. That is why we came up with another mission, the Health Infrastructure Mission. It's a huge initiative to fill up all those critical gaps and prepare our health system, give them the capability to be able to respond to any pandemic or any emergency in next few years. That's how we are preparing our healthcare systems today. And one must not also forget the massive impact of other initiatives which we have taken through different departments of Government of India. Constructing millions of toilets throughout the country under Swachh Bharat Abhiyan, or providing clean drinking water to our citizens who still don't have access to clean drinking water. Providing clean cooking fuel instead of the smoke-emitting chulas through Ujjwala scheme, or the National Nutrition Mission, which is fulfilling the needs of balanced nutrition for women and children. Initiatives like reducing the carbon emission, investing in renewable energy, are campaigns to promote the Fit India movement, Eat Right India movement, promotion of yoga, which is being adopted by so many countries around the world. All these are efforts which are also intended to take us closer towards preventive health. Because I said earlier that our approach towards healthcare has transformed completely. So health does not mean just curing diseases. It means the first step is to prevent a disease. And these are steps because we believe in a whole of government approach. So all the ministries under Government of India are today working together to make sure that we see a healthier and a stronger India by 2047. My dear friends, we know that India accounts for 17% of the world's population. And we have 20% of the global disease burden. We just don't have huge population, we also have huge diversity. So how to bridge that gap and how to address the health inequities that persist in our society? And one powerful instrument to achieve that could be the new technologies. It has the potential to cater to our diverse needs, and India has been one of the preeminent nations in adopting technological solutions and digital innovations to promote the well-being of all its citizens. So one after the other, several initiatives have been taken. Ayushman Bharat Digital Mission is one such laudable effort. So today we are trying to create a digital health ecosystem, creating a unique ID for every citizen of this country. And you would be happy to know that so far, after the launch of Ayushman Bharat Digital Mission, we've been able to generate 81 crore unique Abha IDs. And of that 81, 73 crore citizens have linked their medical histories or medical data with the accounts that have been created over Abha. Abha, along with the other digital innovations like the National Telemedicine Service, which is called eSanjeevani, and which you know played a very crucial role during COVID. The Telemanas, which is our telemental health service, that kind of support system. We have created 53 Telemanas cells across our medical colleges and tertiary health facilities today. The COVID app and the UWIN portal, which is helping us track every vaccination session of a pregnant woman or a child in this country. These are technological interventions, these are innovations which are helping us shape the healthcare of this country and address the unique challenges of our nation. And you may also be reading about how we have now introduced medical drones. Prime Minister of India, Narendra Modi ji, himself started the medical drone service in 11 All India Institute of Medical Sciences. And we all know the utility of these medical drones in carrying the medical supplies in the hard-to-reach areas. How it is affecting the healthcare delivery. And artificial intelligence, which is also something that Government of India, Ministry of Health and Family Welfare has been trying to adopt in its spirit. Today we have created 3 centers of excellence. One at All India Institute of Medical Sciences, Delhi, the other at All India Institute of Medical Sciences, Rishikesh, and also at PGI, Chandigarh. And we are working on how we can develop, use these AI solutions for making healthcare delivery better and more patient-centric. So a lot of work is going on in that direction as well. I would also like to mention about how we are moving ahead in research and innovation, where the leadership of the Department of Health Research and ICMR needs to be acknowledged. Through their extramural program and intramural program, ICMR DHR has been able to come up with many such solutions which are able to address, not just address the critical health challenges of this country, but also position India as a leader in biomedical research and innovation. And I'm happy to mention to you that ICMR and DHR, they are also playing a very important role today in developing indigenous and affordable health technologies through various programs. They are running programs like the First in the World Challenge. So any new technology which has not been attempted so far globally, that kind of challenge we've started. Frontier Tech, setting up centers of excellence at IITs and MedTech Mitra, wherein we handhold these startups and innovators in coming up with new health technologies and introducing them, taking them to the markets. So we prevent them from all those different valleys of death through this MedTech Mitra. So these are various initiatives of the DHR and ICMR, which are helping us take research from lab to the society. And my dear friends, the pandemic has also taught us that it is extremely important to remain self-reliant when it comes to drugs and also medical devices. So after facing the pandemic, we are compelled to think that we can no longer be dependent on any other country when it comes to our supply of drugs or vaccines or medical devices. And especially medical devices, where we have been dependent on other countries. So Government of India came up with this PLI scheme, which is specifically meant for the medical devices. And today I'm happy to say that many such medical devices, which earlier we used to import from the other countries, the CT scans, the MRI machines, the mammography machines, all that is being produced in our own country today. That is what we have done in these 11 years. There are schemes to strengthen the medical devices sector. There are schemes to grow medical devices parks in India. And also PLI schemes for drugs, for APIs, especially the bulk drugs and APIs. We want to domestically produce all those APIs and bulk drugs for which we are heavily import dependent. And many of such projects have already commissioned. We also have another PLI scheme to domestically manufacture other drugs, the high-value medicines and other bulk drugs which are required, the in vitro diagnostics. There are bulk drug parks also which are coming up in the country today. So there is everything that Government of India is trying to take care of under the leadership of Prime Minister Narendra Modi ji. So we are able to attain our goal of universal health coverage, which is the core principle guiding the national health policy. But in conclusion, I would only say that health is a shared mission. And government's efforts alone are never sufficient. We're trying to do everything. But what we need everyone here to understand is that it becomes a collective responsibility. And what we need is stronger partnerships. We need great networking, collaborations. We need everybody's effort. Because it is the power of synergy which will help us realize the big dream, the big vision that we have for creating a Swasth Bharat, a Viksit Bharat by 2047. So with this, I once again thank you all for your audience, and I thank Times Network for having me here and giving me this opportunity to share some of our achievements and our roadmap, of course, for building a healthier nation when we envision a developed India as we complete 100 years of our freedom. Thank you very much.
What inspiring words from the Honourable Minister. And to the Honourable Minister, we ask that you please kindly remain with us on stage for a few moments longer. We at the Times Network would like to felicitate you with a small token of our appreciation. Rohit, I ask that you please do the honours, and a huge round of applause once more for the Honourable Minister for sharing that inspiring vision and mission. A token of our appreciation from the Times Network, ma'am. Thank you for being here and for gracing the occasion. Here at the second edition of the India Health Summit and Awards 2025, ladies and gentlemen. Thank you once again. All right, and with that, ladies and gentlemen, we now move on to our first panel discussion of the day, which is focusing on a topic that is absolutely critical to shaping India's healthcare landscape. From policy to practice, making health equity a reality in India. That's right, that's the theme. And to set the discussion in motion, if I would like to please invite on stage my colleague and principal correspondent with the Times Network, Mr. Ashish Parikh. Let's please have you spearhead the discussion and navigate our way through the discussion. A huge round of applause for Ashish, please. And joining him on stage are our panelists who are going to bring a wealth of expertise and experience in healthcare policy, research, and clinical practice. So, first up, if I could please invite Dr. Randeep Guleria, Chairman of the Institute of Internal Medicine and Respiratory and Sleep Medicine at Medanta, Gurugram. It's a pleasure to have you amongst us, sir. We look forward to the discussion. Huge welcome once again. Huge round of applause for Dr. Guleria. And also please welcome Dr. Narinder Mehra, Honorable Emeritus Scientist of ICMR, former Dean and National Chair of AIIMS, New Delhi. All right, huge round of applause for Dr. Narinder as well. With that, I believe we are ready to begin this crucial conversation around turning healthcare policy into real-world impact. And with that, Ashish, the floor is yours.
All right, it's the first panel discussion of the evening. I want everyone, once again, to give a big round of applause here for our guests, our panel of experts. It's a very, very important conversation that we are having. First up, we are cutting straight to the chase here. We are talking about India's healthcare, the equity in India's healthcare. There's a lot of conversation. The Honorable Minister just now spoke about India's roadmap, the development story, Viksit Bharat 2047. But the bigger question that comes to our mind when we talk about Viksit Bharat or the development of India is it equal for every single community? Is it equal for every single Indian? Is every single Indian feeling that development, India being the fastest growing economy, and particularly in terms of healthcare, that becomes an even more crucial conversation. We saw during healthcare crises like COVID, how important it was. The lack of equal opportunity when it comes to healthcare was glaringly visible. And India's government, of course, has tried its best to fix those gaps. Dr. Guleria, let me first start with you. You've been the face of India's response during these healthcare crises. Help us understand where are these gaps. We see India having very good policies on paper. We talk about India's, the Indian government doing a lot to ensure that every single marginalized community is touched, to ensure they get a good healthcare system. But there still is a lot of gap when it comes to policy and practice on ground. In your experience, what are the biggest gaps, and in the next few years, what does India need to do?
Thank you very much. I'd like to first thank Times Now for inviting me and congratulate them on the second Health Summit. You're very right. We have a lot of challenges. The Government of India has made a lot of steps. Like you said, policy decisions. Implementation is one of the big challenges. And as was mentioned by the Honorable Minister, that India is a very diverse country. We have an urban-rural divide. Majority of specialist doctors are more in the urban areas compared to the rural area. There's also a big issue of healthcare being both in the government sector and in the private sector, and the cost of healthcare in the private sector is very high as compared to the government sector. But in the government sector, it's very difficult because good hospitals, you have to, the crowd is huge, waiting is huge. So challenges are of increasing the infrastructure, implementing policies, and understanding how the health scenario in our country is changing. There is also a paradigm shift in the health scenario that is happening in our country, and also there is technology which is coming in, which we need to harness to see how we can really use it. I think, as was mentioned, we need to look at frugal innovation. How can we innovate in a way which is cost effective and be able to provide universal health care to all? The mission is to do that. Challenge is the implementation part as far as health is concerned. And I totally believe that health should be a social responsibility. Healthcare for all is something that should be provided irrespective of where you are, what is your socio-economic status. And if we can do that for 2047, it will be a huge achievement that every citizen, no matter where he is, gets high quality health care. That would be something that needs to be implemented. There are policies in place. Implementation is the challenge.
Absolutely, very rightly said. Implementation is a challenge, and I think everyone present here has had that experience where you look at certain districts, certain states in the country which are left far, far behind when it comes to healthcare. Professor Mehra, a similar question to you as well. We talk a lot about how there's a lot of progress that India is making when it comes to research, when it comes to policy. Very big policies are announced as well, but when it comes to on-ground implementation, we still lack in terms of that. In your experience, where are we missing the bus?
Well, first of all, thanks to the Times Network to give me this opportunity to come over here. I think the theme of this discussion is very apt, that there are disparities and gaps in the healthcare. And I think there are three things that are very important here. One is the data, research, and of course the policy of the government. Now, these are very important issues, and these can address India's persistent health disparities that we see by creating evidence-based, need-oriented, accountable health systems over there. And I want to talk to you each of these three. Number one, of course, how can data help? Today's word is data science. You know, data has come up as a very big issue. Everybody's talking about data science there. I'm a member of the International Core Data. So we need robust data, robust information for identifying and addressing the inequalities through enhancing policy design, maternal mortality, nutrition, vaccination gaps and all that, mapping disparities, and here data from the Ayushman Bharat, the digital mission as we heard, or the National Family Health Service is very, very important. It will help us and improve our services there. The second issue is the research. How does research help? We need research, of course, focused on analyzing the complex causes of health inequalities. We need research to find effective interventions there. The need is to develop deep understanding of social determinants. The social determinants like education, housing, sanitation, and of course, discrimination practices. And number two would be fostering innovation towards affordable and accessible healthcare technologies. And you mentioned about the AI and all that. Develop AI tools that can help us bridge the urban-rural divide there. And develop evidence-based interventions by involving community. I think this is a very important issue, and we'll talk about it even more, because I have had the experience of really on this issue that involving community members in finding solutions is really very, very important. You see that in rural India, even now, people use their own sort of systems of cure. You know, they don't go to the hospitals and all that. And there is this foundation called the National Innovation Foundation, started by the Department of Science and Technology, Government of India, and I chair their health issue over there. And they really have their scouting system. They have their scouts which go from one part of the country to the other and try to look at those claims, you know, the claims made by those people in the rural side that they can cure those diseases, and those can be also brought forward. And the third issue, as I talked about, how can government policy help? Of course, we heard a lot from the Honorable Minister. Actually, it was very, very comforting to note that there are the number of medical colleges have grown from 382 to 809. AIMS-like institutions have really grown, and the allocation of funds to the health sector has grown. But we still need to develop a robust institutional and regulatory framework to ensure that the health systems are designed and implemented to promote equity rather than disparities. We need to focus on resource allocation, prioritize primary health care, and address the last mile gaps in rural India. Expand the universal health coverage there. And of course, Ayushman Bharat and other schemes are doing an excellent job. And I think we have seen that within the last one decade, the coverage has been remarkable there. So these are my initial remarks on all of those three issues that we talked about.
Well, those were some very detailed initial remarks that you made there. And one of the interesting things you spoke about is how it's comforting to know what the Honorable Minister had to say. And one of the important things, Dr. Guleria, she said was universal health coverage is the core of the national health policy. The reality in India right now, while we talk about a lot of advances when it comes to medicine, when it comes to hospital technology, the reality is that a majority of the population in this country do not get medical facilities beyond primary healthcare center. Now, when you talk about issues, chronic illnesses such as diabetes, asthma, hypertension, it affects the marginalized community the most. And these are people who do not go beyond primary healthcare centers because they can't afford it. That's the reality. How do we make sure that these primary healthcare centers, which have become our first line of defense in a way, how do we make them more robust in the coming years?
So I think this is very important, and like I had mentioned, there is an important issue to understand that in India there is a paradigm shift as far as the burden of disease is concerned. If you look at data from 1990 to 2016, there has been a huge shift in the burden of disease from communicable diseases, maternal mortality, infant mortality, to non-communicable diseases. And currently, the bulk of the burden of disease, almost 60% of the burden of disease is non-communicable diseases. Cancers, hypertension, diabetes, chronic respiratory diseases, chronic kidney diseases, heart diseases. And unlike the communicable diseases where you had, let's say you had dengue or you had malaria, you took treatment, you became all right, the health system treated you and you were all okay. But if you're looking at non-communicable diseases, these are diseases which are going to be there for life. So the issue is being able to catch these patients even in rural area and being able to provide equitable health care to them throughout their life. And that is why I think the focus has to be more on preventive health. Early diagnosis of hypertension, diabetes. In rural India, many people don't get their blood pressure checked. They don't even know they have hypertension or diabetes for that matter. Unless they get end organ damage, they start having hypertensive heart disease or have chronic kidney disease because of diabetes. So I think the focus in the government also has to be what has already been started in terms of wellness centers. How can you do a good screening for all of these non-communicable diseases and catch them early, especially in rural India? And it's not difficult to do. You just need to have a simple set of diagnostic tests which can be done to diagnose early cancers. If you look at cancers in India, 60% of cancers are preventable. So you can actually prevent majority of cancers by good screening, by good hygiene, by decreasing tobacco use. A lot of those such things can be done. So I think there has to be a focus at primary level on preventive health rather than focusing only on curative health, that we build more hospitals or we build more centers. We will not be able to afford that if we start looking at that end of the tunnel, that we're going to cure all our patients who have hypertension, diabetes. We should see what we can do to prevent them from reaching that stage, especially at an early, let's say at a rural India where these things are not picked up early. And secondly, use technology to reach out to these people. COVID was one very good example. You could have teleconsultations with people who are in remote areas also and provide them care. Everyone learned how to monitor their oxygen saturation, how to look at their symptoms. So it's possible by using teleconsultation, e-Sanjeevani, as the Honorable Minister mentioned, to be able to provide healthcare even in rural India and use technology. We have a lot of wearable devices coming in, a lot of innovations by Indian companies where you can diagnose all of these diseases in a very cost-effective manner and be able to intervene early rather than late. So I think the focus has to shift more and more towards preventive health, early diagnosis, accepting the fact that we are shifting, the paradigm shift is occurring towards non-communicable diseases. And also, of course, as was mentioned, this century, the last 25 years, has been a century of outbreaks. If you look at the number of outbreaks we've had in the last 25 years, starting with SARS, MERS, Zika virus, 2 pandemics, the H1N1 pandemic, the COVID-19 pandemic. Every year you hear of a new outbreak, monkeypox and other things. So we have to have a good surveillance system for any outbreak and have a plan in place so that we can contain it and prevent it from spreading, because that really causes a huge strain on the health system, which is already actually overburdened. So I think that is the second challenge that we have as far as the Indian health system is concerned.
Absolutely. I think the bigger problem is not the spread of the flu or the disease that you're talking about. The bigger problem is the spread of the rumors that happens. And I think that really creates a panic and also puts a lot of pressure on these first line of defenses like the primary healthcare centers. And Professor Mehra, we are talking about equity here. And the journalist in me needs to ask you this question. Every time we hear someone in power speak about the success of a health program, they talk about how many patients have registered. The reality is, equity is not about input, it's about outcomes. It's about how many people have been treated successfully, how many people have actually availed that facility. Do you think there needs to be a system put in place in India wherein every single district we're able to monitor the number of patients that come in and also the way we have been able to treat them, to just ensure that there is some sort of an equity when it comes to healthcare?
Oh, sure. This is a very, very important issue. By the way, we have excellent centers of research and diagnosis. We have excellent scientists as well. But these are all concentrated in the big cities. And I'll give you one example over here. I have been the chair of the scientific advisory board of this very important institute in Mumbai called the National Institute of Immunohematology. And the scientists were wonderful. They're doing a great job. But they were all taking samples only from the Mumbai area. Whereas the problem of hemoglobinopathies lies elsewhere. I mean, I used to go to this city called Chandrapur, where the local MP was a friend of mine, and this place is full of sickle cell disease and thalassemia. And why were these guys only taking samples from Mumbai area and got some study or the other? So, we sort of made a plan that we want to establish a satellite center of the NIIH of Mumbai over there in Chandrapur, and lo and behold, it was done. And now today, this is a very functional center. And I think this model of having a satellite center attached to a big sort of research institute or a diagnostic institute elsewhere would be very, very useful. And also, today is the time when we have to talk about implementation research, the operational research and all. This is also relevant from the larger context of global public health. We need to have the implementation research. Implementation research, I have seen over the years, acts as a driver. It acts as a driver to close the gap between knowledge generated and its use, reaching the masses without too much of time lag. And you need a real-world evidence. You get the real-world evidence when you work over there where the disease is so very common. Another of my experience, and I want to share my experience of early 70s. My scientific career started in early 70s and mid-70s, and we used to work on leprosy. Leprosy used to be prevalent in India, very high. Out of the 10 to 12 million cases of leprosy around the world, about 5 to 7 million were in India. And we were studying the immunological aspects of leprosy. And I used to walk over to the Safdarjung Hospital or the AIMS Hospital. You will not get the right kind of samples until I went to this city, Wardha, Sevagram, Wardha. Oh, where, my God, the leprosy was so prevalent that every household. But what struck me was that these were large families, about at least 5 to 7 children, all living under the same one-roof hut, and our belief that leprosy, spreads through close contact and all that, but that was not there. We saw out of the 5 to 7 children, 2 were affected with leprosy, others were not. So what happened? 1973 was also a golden time when one of the guys, Benasraf, showed for the first time the existence of what we call immune response genes. There are genes which control your immune responsiveness. So we wanted to understand if that works in leprosy as well. But we needed families. We needed families with at least 2 children with leprosy. So you couldn't get over there. So that's the point that I'm trying to make, that we need to go to the rural side, to the side where the action is. The action is right over there. I'm very happy that the ICMR, under the dynamic leadership of the DGs, earlier Balram Bhargav and now Rajiv Bell, they have already created an institution called the National Institute of Implementation Research in Jodhpur. It used to be earlier called as DMRC, Desert Medical Research Center. I was the chairman of the Scientific Advisory Board, and I said, what name is this? Desert Medical Research Center? And now they have created that into an implementation research center. So I think these are the kind of things, this is very, very useful, very important sort of move on the part of the ICMR as well.
Absolutely. A lot of things have changed since you started your career, and it's very interesting to hear that anecdote coming in from you as well. It gives us an idea about how far we've come, but also we need to remember, Dr. Guleria, how far we need to go as well. He was talking about one of the things, that he said, he mentioned, in fact, was about hospitals getting a lot of technology and technology making sure that there is equity when it comes to healthcare. But the reality is, the other thing that he also mentioned is that, these set of doctors only collected samples from Mumbai. Probably they were saving on transportation costs. But the reality is, these technological advances might come to India, but there is a risk that these might be limited to cities as well. How do we push this deeper? Because again, I have a lot of friends who are doctors, and a lot of people do not want to settle in rural parts for obvious reasons. They want to stay closer to their family, closer to cities which have better connectivity, better facilities as well. So how do we convince the entire ecosystem to ensure that healthcare is pushed even closer to the marginalized community than it was ever done before?
So I think the 2 important issues here. One is, whenever technology comes in, it has to be relevant to that milieu or that area that you're looking at. If you get technology which is coming from outside and it is not going to be relevant to the Indian context or to rural India, then the technology will not work. You may get something new and you may feel that this is going to really revolutionize things, but if it is not practical and the ground reality doesn't work, then getting any great technology will not work. So the first thing I think is to understand what is happening in rural parts of India, and there's a diverse part as far as India has a lot of diversity. If you look at the health sector, let's say in the southern states, they are doing much better as far as rural parts are concerned in providing technology and being able to look at ways of implementing health as compared to, let's say, central or north India. So there is a diversity also, which is evident even if you look at various health reports also. But I think that also brings out the point that we need to be able to understand how each area functions, what are the social implications, and interacting with the people there and understanding their issues and then finding solution is more important than trying to get something straight from outside and trying to look at technology being sort of pushed out there. Second issue is how do we get doctors to come to rural part of India. That is a big challenge. As was mentioned, 80% of doctors still continue to be in rural India. I think we need to develop a connect. We need to be able to develop infrastructures which is there in rural India which will attract doctors to go there. It's being done that various district hospitals are being converted into medical colleges to provide those type of facilities. Primary health centers are being upgraded, but it's a slow process. And I personally feel that there is a need to develop partnership here. How can the private sector come into rural India and look at a model where there is profit also, at the same time it delivers in terms of providing healthcare. That is going to be the solution that is going to really take it forward. Otherwise, just saying that it has to be done only by the government sector is going to take very long, and we need to develop a public-private partnerships sort of a solution where we can develop facilities which are there using technology and using various other methods in rural India to provide healthcare which is of high quality and is able to and is affordable for citizens out there. But this has to be done as some sort of a partnership rather than relying on it. And I think there also has to be a lot of public involvement. Like I said, you have to understand the local situation out there before one goes in. And as was mentioned by Professor Mehra, that, for example, in Wardha you had a lot of leprosy. You hardly had it in other parts. So you have to understand what is the local issue, and this could be different in tribal areas. It could be different in northern parts as compared to the northeast part of India. So each area has to have its own problems and and you have to develop its own solutions.
Absolutely. It's interesting that you talk about it being a real issue, because I've spoken to a lot of doctors across the nation. There was a friend of mine as well, not taking any names here. He's a doctor. He was being posted towards the rural side, and one of the things he said is, well, I can't even order burger online when I want to. That's the problem. And why should I move to a rural place when I can sit in a fancy hospital in a city like Delhi or in Bangalore, order whatever I want, work during the hours that I see fit? Professor Mehra, what's the incentive that we can give, not just to the doctors, but also the entire ecosystem in terms of policy to ensure that all of these technological advances that come in, they don't be limited to fancy hospitals in cities like Delhi or Mumbai? How do we push it deeper?
I'm of the view, the example that I gave it of Mumbai, and I think that has been a very successful model. Actually, large research institutions of ICMR, of the DBT and all, I think these have to have satellite centers, not just one or maybe more. You have to look for. The country is too big. The diversity that we have in the Indian population is very, very high. And the needs and requirements vary from one area to the other. So I think we need to have that kind of a model. Actually, I can give you my own example of starting this whole subject of transplant immunology. Transplant immunology and HLA, and Randeep knows, is a rather new field, and we were struggling in the early 70s of organ transplantation there because there's nothing in India. I don't know how I developed that kind of an interest. Maybe through this leprosy studies, it took me to the immune response genes and wanting to see. And, the transplant activity in India was very, very low. And there was only one lab. I had the only lab in India, which eventually aims actually, establish it into a first the first very department, the full-fledged department of transplant immunology and immunogenetics. And now, and you know, our job was not only to test for everybody around the country. I used to feel pained when people from South India, from Chennai or way down Kerala, used to travel all the way to Delhi to get their testing done, you know. Because those were the days then we could not even ship samples from one part of the country to the other, because the DNA samples were not there at that time. And now, of course, things have changed. And one of my goals was to train people. You know, I have trained hundreds of people in the field of transplant immunology. I'm very happy to say now that there are more than 100 hospitals in India who actually are engaged in the field of organ or bone marrow transplantation there. And each one of them want to have a full-fledged lab, if not a full-fledged department of transplant immunology. So I think these are the things that we need to do. We need to really get together and focus on areas that are lagging behind in India.
Absolutely. Like our experts here very clearly pointed out, when it comes to growth in healthcare in India, we need to stop looking beyond fancy hospitals or more doctors. That's not the definition of growth in healthcare. I think the real definition is when every single person, every single community across the nation feels a similar advancement when it comes to technology in terms of healthcare and actually feels the effect on ground as well. Dr. Guleria and Professor Mehra, it's been an absolute pleasure speaking to you. And again, once again, a big round of applause here for our experts. Thank you.
Thank you, Ashish, and thank you to our panelists. A fascinating back and forth, and I ask that Rohit Chadda please kindly do join us on stage to felicitate our panelists with a small token of our appreciation, a symbol of our gratitude. Thank you for being here at the India Health Summit and Awards 2025. All right. Pooja Sethi will kindly have you on stage to do the honors and present each of our panelists with a token of our appreciation, please. Thank you, Ashish, for doing the honors. For Dr. Randeep Guleria and Dr. Narinder Mehra, huge round of applause once again. And thank you for being here at the second edition of the India Health Summit and Awards 2025. Excellent. A lovely back and forth on making health equity in India a reality. Thank you, gentlemen, once again, and thank you, Pooja, for doing the honors. So we'll now switch gears and move on to a topic of urgent public health importance: dengue. Dengue in India, its control, and perhaps the promise of a vaccine. But before we begin, ladies and gentlemen, we'd like to acknowledge our session partner, All Out. And All Out is, of course, a leading Indian mosquito repellent brand all the way since the 1990s. And All Out was the one that, of course, introduced the liquid vaporizer to Indian households and has since been beyond committed to protecting families across the country against mosquito-borne diseases like dengue, malaria, chikungunya, and the list goes on. But beyond liquid vaporizers alone, their range now includes, of course, mosquito kill rackets, coils, cards, and aerosols, as many of you know. And as India's only mosquito repellent brand recommended by the Indian Medical Association, or the IMA, All Out continues to stand by mothers and families, ensuring that households have adequate protection against all mosquito-borne diseases. So with that, at this time, I'd like to play a short AV that highlights All Out's commitment to public health. Let's have a look.
आंटी, मुझे को गिफ्ट मिला।
विक्की का रिपोर्ट कार्ड अच्छा है।
क्या वो राहुल के लैब रिपोर्ट्स डेंगू है?
परिवार के हेल्थ के साथ हम चांस नहीं ले सकते।
इंडियन मेडिकल एसोसिएशन द्वारा प्रमाणित नया ऑल आउट मारे डेंगू मलेरिया चिकनगुनिया के मच्छरों को 30% फास्टर। तो अब आप चांस लेंगे या ऑल आउट।
All right, so to do a deep dive on the topic and to moderate our next discussion on dengue, if I could please invite Ms. Kalpana Sharma, Health and Lifestyle Editor, Times Network, to the dais to spearhead us through the discussion. Thank you, Kalpana, for being here. It's a pleasure to have you with us. And joining Kalpana on this eminent panel are experts who include Dr. Sanjeev Bagai, who's the chairman of the Nephron Clinic, senior consultant, pediatrician and nephrologist, and a Padma Shri awardee. Huge round of applause, please, for Dr. Bagai. Let's kindly have you on stage, sir. And joining him, Dr. K. Madan Gopal, advisor and health, Public Health Administration, National Health Systems Resource Center. Dr. Gopal, it's a pleasure to have you amongst us. And Dr. Atul Kakkar, the chairperson of medicine at Sir Gangaram Hospital. Dr. Kakkar, pleasure to have you as well. We have a highly distinguished panel here that'll certainly do the topic justice. And with that, Kalpana, I hand it over to you.
Thank you so much, Pooja. Can you hear me? Yes. So today we have a very interesting topic, something that's kind of become more like a epidemic, something that was linked to monsoon or was very season specific earlier, but now has become a problem that's there year round. And we have a distinguished panel where we'll be discussing about dengue and all the risk factors and whether the vaccine that is getting talked about will even help us. My first question would be to Dr. Bagai. I would like to understand that, dengue cases rise year on year. Today, even today, if you Google, in Bombay, Pune, Delhi, there are so many cases, live cases right now. How do you see this, panning out in the coming years?
Am I audible? Okay, so the unsung hero, so to say, of vector-borne diseases is dengue. For the last 4 or 5 or 6 decades, we've highlighted malaria every other day or every day. But I think dengue has not got the center stage importance which it deserves. The dengue cases, what has been predicted in 2025 is nearing about 3 lakhs in India. But I dare say this is a gross underreporting, not because of the system, but because of the disease itself. They say there will be a few hundred deaths in India, but we all know that it will be a lot more. That's a fact, that's a reality. Now, the issues really in terms of numbers are that most of India is still not digitalized. Most of the cases are subclinical. More than 75% of the cases of dengue are subclinical. So the active infection count always is much lower than what really is seen or depicted. With regards to the testing, we must remember that we have this test which is of 2 types. One is an antigen test, which is called as NS1, and then we have an antibody test, which is IgG, IgM. Now, the antigen test, which is NS1, does not come positive till the end of day 1. So if you do not time the test appropriately, you will invariably get a false negative. So therefore, the underreporting. But apart from that, the number of cases, especially in rural India, where most of them are termed as viral fever without a test or without a diagnosis. So therefore, the numbers are a lot more. I think we need a huge amount on a daily basis of some sort of public awareness. Of course, we need government, civic, and community surveillance to prevent waterlogging and stagnation and so on. But I think we need a very, very active focus on dengue right above malaria.
Thank you. And just something that I'd sent, I'd said during my introduction that monsoon it was assumed that, dengue is a monsoon-based disease. Dr. Madan, what are your thoughts on it now?
It's quite misconception now because as you have seen how the dengue has evolved. That means if you go back historically, in the 70s, we used to have only 7 to 9 countries reporting dengue. Now we are having more than 100 countries. Similarly, 20 years down the line when malaria was rampant, I think malaria has been replaced by dengue. And I've been asking my team to look at what is the reason, why change is happening, why the competition between Anopheles and the Aedes is happening. Wherever the Anopheles are going down, the ADs are taking the upper edge. That means, is there some understanding on the lighter side? But if you have seen that, how the things have evolved in the country, it has become a perennial problem. It's not only post-monsoon related things. Because if you look at side by side, the urbanization is happening. Some of the states, they have reached up to a tune of 50%. With urbanization, you see a lot of challenges to the civic sanitation and the water supply. Wherever there are challenges of water scarcity, sanitation challenges, the storage is bound to be there, and that's the practice which people are following. Right. And if you are not able to avoid that thing, then how the civic sense? Because in the previous session also, Honorable Minister also has pointed out that government can do whatever it is supposed to do. But it has to be a whole society approach. That means when the sanitation challenges are there, water containers problems are there, then how you are going to? That's why it has become a perennial problem, not a post-monsoon related thing. So this is my opening thing. I think our problem is humongous now. Now we are, as mentioned by my previous speaker, that means is under-reporting. That means detection is one of the important area, as well as misclassification and dengue as other cause of other febrile illness. So that's another area. That means last year we had 2.4 lakh dengue reported cases. This year it was mentioned that around 3 lakh cases would be there. But during the parliament session in July, they have reported there is no increase of dengue cases. But conversely, the ground report says something else.
You both spoke about dengue cases being underreported. Dr. Atul, my question would be to you that, it's very interesting that, like many other diseases, dengue also kind of have symptoms that people confuse with flu, influenza. So what are some of the symptoms that people should really take note of and reach out to a health specialist, because testing doesn't happen like we discussed, because people tend to assume that, it's just flu, it'll go with symptomatic treatment, we don't need to really reach out to for proper dengue testing. What are your thoughts on this?
So the symptoms which help us to know whether it could be dengue or something else is very difficult to say, but there are two definite symptoms. One is retroorbital pain behind the eye, that's the thing, which is quite severe. It may be associated with headache. And the other is the pain in the back, which is an important symptom which will help us to know whether this is dengue or not. Rest of the symptoms are totally not very common, like you can have pain in the muscles, nausea, high-grade fever, which is seen in almost any kind of viral illness which is there. But these two symptoms are specific to dengue, which should be asked from the history.
Dr. Bagai, normally how long does a typical dengue episode last? And when does it become worrying?
So dengue, you have a very short prodromal phase, about 1 or 2 days. A child or a young adult or an elderly may feel slightly restless, not feeling himself or herself. Then it goes through, apart from the prodrome, it goes through 4 phases. So one is the acute febrile phase. The second is what we call as the critical, means important phase. The third is the plateau phase. And the last is the convalescent, or what we call as the recovery phase. Now, during the febrile phase, what we call as the acute phase, you'll typically have very high-grade fever, which is 101, 102, 103, 104. It is always biphasic. So you may have fever which comes once every 2 days, or you may have multiple spikes in a day. It's typically called as camelback fever. So you will have 2 humps. So if the first spike of fever goes down, do not feel confident or happy, because the fever may come back. So it's not a sign of recovery if the first phase of fever goes away. With or without any rash, but you will have classical headache. What patients describe is aankhon ke piche, sir ke samne, acute pulsating pain. And that's almost classical. And then, of course, back pain and muscle pain. During the critical phase, there are a couple of important points, if I can highlight. I think clinically and for public awareness, it's extremely important. The fever will gradually wane off, but once the fever breaks, platelets play Bharatnatyam. Please be careful with the platelets when the fever goes away. The ultimate going away of fever is not a sign of recovery. That's when your platelets start playing havoc. Coming to platelets, don't concentrate on platelets. Platelets are eaten away because of hemoconcentration. That means watch your hemoglobin going up. So your blood count and peripheral smear and test is equally important. Apart from that, of course, you'll have little derangement of your kidney function and liver function and so on. Classical abdominal pain in smaller children, gallbladder gets contracted. And then comes a plateau phase and then the recovery. So your entire recovery period is another 4 to 5 days. So if a patient comes to me with dengue positive in the first initial phase with a NS1 antigen positive, timing of that test is very important. Do not rely on diagnosis of dengue as a first episode with your antibody IgG, IgM. Your full phase will be about 15 to 18 days. After the child is in the recovery phase or an adult is in the recovery phase, you have a lot of muscle pain and malaise. Fluids will keep the patient home. Lack of fluids, you land up in the hospital.
I'll connect to what you said, and my next question, Dr. Madan, would be that, how do we handle the burden? I mean, there is a certain phase when we see a lot of dengue cases, and, how do you really manage, the hospitals from getting overwhelmed with patients admitting and, everyone wants to be tested, everyone wants to be admitted. What is the balance how do we create that balance?
One of the important things which Sir has mentioned, that means fluids. Yeah. See that you are not dehydrated. The moment you are dehydrated, if you are having symptoms, you will end up in a hospital. That means essentially you have to focus on home management. That means the symptoms can be managed, 70-80% of the cases can be managed at home if the hydration and other things is maintained. The moment these warning signs are there, suppose the acute pain in abdomen, the vomiting, and as well as the some bleeding spots are available, that immediately the person has to be shifted to the hospital. But to avoid that situation, it is better to keep yourself hydrated. Besides that, if you talk about the rural areas, because one needs to understand how our system works. Private sector is there, public sector is there. I will be more focusing on the public sector. Public sector, we have around 2,18,000 hospitals. And in the peripheral most level, we are having the million ASHA workers who are the volunteers. They have been capacitated for triaging this early symptom because dengue is not limited now to only urban areas. Rural areas are also not untouched with dengue. It can happen across the country. So we have to, it was an urban phenomenon earlier, now it's a rural phenomenon. That means you have to take care of all the people. Building capacity so that they can identify the early warning signs and see that how the patient can be rehydrated. Oral rehydration solutions are there, how to prepare that, what are the locally available fluids which can be given to the patient. That's one thing. Second thing, beside that, we do have a network of e-Sanjeevani program, that teleconsultations which are there. In case of any danger and warning signs, I think immediately the spoke can be connected to a hub and the treatment can be instituted like that. That kind of measures are there so that the overloading on the hospitals can be avoided.
What is your take on these home remedies that keep going viral on social media for dengue management?
So you have asked very interesting question because we all talk about science. We have to produce evidence for these home remedies and other things. Right now, we don't have evidence to say that this is effective, that is effective. Till the time science comes forward and generates some evidence surrounding home remedies, we have to focus on, see that how the hydration is maintained. If in the home remedies also, if they are focusing on maintaining the hydration of the patient, that is adding to the line of symptom management which we are already propagating.
Mm-hmm. So, Dr. Atul, something that both the doctors mentioned, about hydration, how that is very important. What does it exactly do, just for the audience?
Hydration keeps your, the hemoglobin concentration enough so that, there is enough, there's all, in fact, the phases which you talk about, in the later phase, there is also leaking of, the blood products from the third space. So with the hydration, you can maintain the level of nutrition which is going on and the electrolytes to the entire body. That's important. And coming back to what you said was the home remedy. So if you take rounds in the morning for the dengue ward, everyone will have that kiwi in their bedside, and they'll have those things which are going. But yeah, as we say, that there is no trial on that. But people are taking this, and I think we need to educate those things also. They are basically things which need to go off from our social media.
And also something, Dr. Bagai, I'll come back to you. We've heard, for the post-COVID, this long COVID was the buzzword for a very long time. But off stage, we were discussing how dengue, there should be a term coined, long dengue. Would you like to throw light on that?
This is something which I have researched very extensively, so I'll share some information. It's of huge importance to everyone. But before I touch that, just to add on to both my esteemed panelists, the carry-home message is yoga does not work for dengue. That's loud and clear. Karela ras, lauki ras, papita leaves do not work in dengue. They may cause more harm than good. Do not experiment with yourself or your relatives at home. Only paracetamol. Do not take aspirin. Do not take nimesulide. Do not take ibuprofen. It's a guaranteed sure shot one-way ticket to the hospital. It will destroy your platelets, cause gastritis, vomiting, and dehydrate you further. We've seen fatal bleeds with these medicines because your platelets are already vulnerable. So this is the take-home message, and do not take antibiotics. Dengue has no role with antibiotics, and vice versa. Coming to your point of something which dengue does. So dengue has 4 serotypes, dengue 1, 2, 3, 4, and at different times of the year in different parts of the world, different serotypes have predominance. Once you have been exposed to dengue, theoretically you can get 3 further attacks. So with dengue 1 or 2 and any one of the combinations does not give you immunity to the other 3. So therefore, if you have dengue infection, your body is sensitized to produce antibodies, what we call as IgG, and your body is ready to fight the next insult. But unfortunately, those antibodies wane and your immunity is partial. So whenever you get the second attack, you get something which is called as antibody-dependent enhancement. Remember ADE. ADE kills people with dengue. We'll touch the vaccines because it's based on ADE. But with regards dengue itself, it's not just a 15 to 18 day. So all recent research in the last 24 months, that means last 2 years, and more so in the last 6 months, and I've read very actively for this show, is there is something which we call as a dengue post-sequelae, and it can last to 300 days or more. That means close to 9 to 10 months and beyond. So I've got these statistics, and I'll take your permission to read this out.
Sure, please.
46% of cardiac risk, 43% of thromboembolic phenomena, major cardiac episodes, 31% increased risk, MIs, that means heart attacks, 30%, tachycardias, 46%, neurological and cognitive effects, 66% increased risk, autoimmune diseases coming in because of ADE, increases by 37%, gastritis, hepatitis 36%, 230 times increased risk of damaging your kidneys with severe dengue, 22% overall risk of increased hospitalization, and a 208% chance of excess mortality. Now please understand what clinical medicine is. A patient has dengue, let's say a year back or a year and a half back, there is practically no history because it may be a subclinical. And a patient has a MI. Everyone has spoken in the last 5 years, 4 years or so of long COVID. There has to be a terminology and more work done on long dengue syndrome. This damages more than 10 different body organs with significant impact. It leaves behind traces in which very often it leaves no footprints. So we have to be careful. You have to prevent dengue. Make sure that the mosquito is not close to you.
That's very, very interesting, and I'm sure very useful as well. Dr. Madan, just extending that to you, Dr. Bagai mentioned that there are 4 serotypes and cases of reinfection as well. So how does this pose a challenge for the, public health planning per se?
For public health planning, we are focusing on 2 things. Because irrespective of the serotypes, we have to see that with a patient who is having dengue episode, how is managed. Second thing, occurrence of the dengue, so that we have to break the transmission chain. So whole effort is made on the surveillance aspect. It's a clinical surveillance for fever surveillance network is there across the country. That means any fever coming to the system institutions. So we have to see that how that fever is labeled and categorized as for this. One of the problem of missing the reporting of dengue is the misclassification of these cases. So fever surveillance network is there across the country, and that reporting is there. The second aspect for public health planning is here entomological surveillance. So the entomology which you used to see since 50s to early 2000s, now the older generation of entomologists is now gone. We are having a vacuum of entomologists in the country, across the country. Because entomological studies are very important when we are doing a public planning. Because integrated vector control program is there. That means all the vectors are there. So you have to see that if you are able to control the vectors, then you are able to address the issue and the prevention can happen. For controlling that vector, you do need to have an entomological surveillance and entomological surveillance in place. That means why it becomes important, because in Delhi it has become perennial. Even the colder months, the dengue mosquito is able to adapt and it can survive. The extensive incubation period of the mosquito, it has reduced. That means after laying of the egg till becoming of the adult, used to be 5 to 7 days, now it has reduced to 3 to 5 days. That means it is also adapting for transmission and other things. That means we are having dual challenges, how to control the vectors and managing the patient. Managing the patient, that aspect is well taken care. But managing the vector, where the vector is there, that's why 7 days are there. You say every week you have to clean your houses so that the larva doesn't become pupa and the adult. That is to be chain is to be broken. Har hafta, ek din, aap saaf kariye. That kind of thing, that's based on the evidence which is there for the entomological surveillance. Second is about the mosquito control measures and other things. The dynamics have changed. Wherever the Anopheles population has reduced, the Aedes mosquito has taken this. And that we are not having any evidence or any insights on why this is happening. If we are able to answer that why only will come when we can invest into the entomological studies. Not that entomology means only machhar pakad liya kaam kare. No. They have to do some studies, how the strain is happening, whether it's reacting to the insecticidal things or not. Or any biological methods are there which can be controlling these mosquitoes. We have to address the vector issues. That's a challenge which we are facing.
Yeah.
Managing another thing is not a difficult thing. Serological typing, I think once a person is having, he can have 3 more episodes, as Sir has mentioned. But the bigger challenge is the entomological surveillance, and for planning purpose, we are focusing on that.
And for lack of time and something that we cannot skip discussing are the vaccines. WHO is recommending it. India is in the middle of developing one. Dr. Atul, Dr. Bagai and Dr. Madan, I would love to hear your thoughts. Little we are running out of time, but however brief we can keep it.
So briefly, there are 2 vaccines which are being under trial in India. So one of them is the ICMR, which is with Panisha Biotech, and the other one is Serum Institute vaccine, which is a tetra. And the phase 3 trials are going on. It's indicated between 6 and 16 years, and soon the results will be available to tell us whether they are helpful or not. So that's the
okay.
Okay. To cut a very long story, quick and short and a little funny, we have 2 vaccines which have been approved by WHO. One is known as Dengue Vac, and the second one is known as Q-Denga. The vaccines are as absurd as the names sound. So the first vaccine, Dengue Vac, does not work for the first episode. So you have to have had a previous episode so it can prevent reinfection. So the initial results were so bad that the vaccine efficacy was, in a multiple-centric trial, was termed as minus 18%. That means it did no good it did more harm. Then subsequent trials have shown that it has a very poor waning over a period of 4 to 5 years, and the efficacy goes down. The second one is Q-Dengue. The Q-Dengue is to be used for all purposes across the age groups, but there again, it only works very well for Dengue 1 and Dengue 2, not for 3 and 4. ICMR has started a third phase trial with Panacea Biotech, in which 10,000 volunteers have been enrolled in phase 3 trial. Now, just 2 minutes with I hope your audience are not getting bored. Okay.
I'm sure not.
The vaccine per se for dengue is a slippery little guy, because all recent studies have shown that the body reacts like dengue exposure. 1, if you've had influenza. 2, if you've had SARS-CoV-2, which is COVID, or in southern India, you've had Zika. I'll rephrase this in layman term. If you have been exposed to any of the miscellaneous viruses, it's like taking a hit in your body immunologically wise, as if you've been exposed to dengue. Now, how the body reacts, whether it's dengue type 1 immune response, 2, 3, or 4, is completely unpredictable. So the vaccines, according to me, are a far cry away. Just to, in one line, to mention what this dengue virus is, it contains 275 shared protein interactions with influenza and SARS-CoV-2. It's almost impossible to say which body is going to open up what kind of channels. These are called as activated channels in the proteins of how the body is going to respond. The worst thing which you can do with a dengue vaccine is to give a dengue vaccine and cause with the vaccine a severe reaction. So worldwide studies with the WHO recommended vaccines have shown a 58% increased risk of severe infection. So I would rather keep mosquitoes all out, no pun intended, but keep all out, all in, right, just to keep your home safe. Prevent mosquito bites. Don't bank on a vaccine too soon, too fast.
Thank you.
I agree with sir. One of the important things, vaccines we see as an adjuvant. It's not as the mainstay for this. Mainstay is your surveillance, the clinical management. So we look forward to seeing that how we can improve our surveillance, especially the entomological surveillance, and improve our clinical detection, and the misclassification of the cases is avoided.
Thank you so much, Dr. Madan, for summing up the whole session, and thank you so much for joining us.
Thank you.
What a fascinating back and forth, ladies and gentlemen. And Kalpana, I ask that you please remain on stage to help felicitate our highly distinguished doctor panel with a token of our appreciation. Thank you for being here at the India Health Summit and Awards 2025. Very insightful back and forth on battling and combating dengue, really, through prevention, awareness, and potentially a vaccine. All right, and Pooja Sethi is also on stage to help felicitate our panelists. Dr. Kakkar, Dr. Bagai, and Dr. Gopal. Thank you so much. Thank you, Pooja, and thank you to our panelists. A huge round of applause for them. Thank you so much once again. And now for Dr. Bagai. Thank you for sharing such a rich range of insights. And I wanted to just essentially take a moment more to thank our sponsors for their support in this effort. We are supported by an ecosystem of partners here today. And to acknowledge them once again, The Times Network India Health Summit and Awards 2025 could not have been possible without our partners, who include our Powered by partner Intas. We're co-powered by Novartis and All Out. Our knowledge partner is Dr. MGR, Educational and Research Institute. Our supporting partner is Fit India, of course. Our strategic alliance partner is Onyx Telecommunications, our wealth partner Nuvama Wealth, and our outdoor partner for the India Health Summit and Awards 2025 is Heights. So with that, here at the India Health Summit and Awards 2025, we're essentially providing our audiences with not just thought leadership sessions, but we're also here to celebrate excellence in the field of health. And with that, we're going to move on to the next part of the afternoon, which marks a felicitation of medical professionals whose commitment to the field is dramatically improving healthcare outcomes. So with that, I ask that you kindly join me in celebrating your industry peers. And I'd love to kick off the afternoon with our first round of felicitations. I'll mention the award category, the professional who's receiving it and their designation, and I ask that you please share your support for their efforts, for their contributions, and their future success. All right, with that, we will move on to the first felicitation of the evening, ladies and gentlemen, and this is in the category Pioneer. All right, and to do the honors, actually, if I could please have Pooja Sethi back on stage, that would be of great help. If we could please have Pooja Sethi back on stage, who's, of course, the managing editor with Times Network Digital. And now we'll officially begin our felicitations, ladies and gentlemen, and the first award title is Pioneer in Pulmonary and Critical Care Excellence. And it goes to Dr. G.C. Khilnani. Huge round of applause. The chairman and PSRI Institute of Pulmonary, Critical and Sleep Medicine, Dr. G.C. Khilnani, ladies and gentlemen. Pioneer in Pulmonary and Critical Care Excellence. If we can please have the doctor on stage to kindly accept this felicitation from the Times Network. Congratulations once again, sir. We salute your efforts. We celebrate your contributions. Keep the applause coming, ladies and gentlemen. All right, a photo op to celebrate the moment. Thank you. All right, and with that, we move on to our next category, which is Excellence in Cardiac Leadership. And the award goes to Dr. Balbir Singh, Director of Cardiology, Pan Max Hospitals. If we could please have Dr. Singh on stage to accept the honor. Congratulations, sir. Excellence in Cardiac Leadership. Congratulations once again. A special moment and a celebration of your accomplishments and achievements, sir. With that, we move on to Surgical Excellence and Innovation. And the award goes to Dr. Mohib Hamidi, who is the General Minimally Invasive and Laparoscopic Surgery, Yatharth Hospital. Congratulations, sir, Dr. Mohib Hamidi, Surgical Excellence and Innovation. It's an honor and a privilege. All right. And with that, we move on to our next category, which is Excellence in Surgical, Gastroenterology and Liver Transplant. Dr. Soumitra Rawat, Chairman, Institute of Surgical Gastroenterology, Oncosurgery and Liver Transplant at Sir Gangaram Hospital. Congratulations, sir. Congratulations to Dr. Rawat, Excellence in Surgical, Gastroenterology and Liver Transplant. And with that, we move on to our next category, ladies and gentlemen, which is Excellence in Medical Leadership and Innovation. And in the category Excellence in Medical Leadership and Innovation, the award goes to Dr. Shiv Kumar Sareen. Dr. Shiv Kumar Sareen is the director at the Institute of Liver and Biliary Sciences. Can we please have Dr. Serene on stage? All right, we'll move on. The next category is Excellence in Nephrology. And it goes to Dr. Prateek Das, who's Medical Director and Chief at Kolkata Kidney Institute. All right, and can we also have Dr. Dinesh Kullar also for Excellence in Nephrology, who's the Chairman, Nephrology and Renal Transplant Medicine at Max Saket Complex. If we could also have Dr. Dinesh Kullar. Sir, if you could kindly please join us on stage. And we have a long list of awardees in Excellence in Nephrology, and I'll announce them one by one. If Dr. Dinesh Kullar could also kindly please join us. And as I announce them one by one, I ask that you all join us on stage. Dr. D.S. Bhatauria, Director of Department of Nephrology and Renal Transplantation at Medanta Super Specialty Hospital, Lucknow. Congratulations, sir. Kindly do join us on stage. All right. With that, Dr. Pratim Gupta, Director at Nephrocare India Limited. And Dr. Sonal Dalal, Head of Department Nephrology at Sterling Hospital. Let's kindly have... Congratulations, gentlemen. Congratulations once again. All right. All right, we have several other distinguished winners in the Excellence in Nephrology category, and I'd like to invite them all on stage, starting with Dr. Anil Kumar BT, who's the Chief Consultant Nephrologist and Transplant at Glen Eagles Hospital, Bengaluru. Sir, congratulations, and we ask that you please do join us on stage, Dr. Anil Kumar BT. And joining him in the same category, Excellence in Nephrology, is Dr. Shri Ganesh Barnela, who's the Chief Nephrologist and Kidney Transplant, who joins us from Dr. Barnela Kidney Care and Orion Super Specialty Hospital. Congratulations, sir. We ask that you please do join us on stage. Also, in Excellence in Nephrology, Dr. Shyam Bihari Bansal, Senior Director in HOD, Nephrology and Kidney TX Medicine from Medanta Kidney and Urology Institute. Can we also have Dr. G. Sridhar, Director, Department of Nephrology, Star Hospitals, Hyderabad, also for the same category, Excellence in Nephrology. And Dr. P.S. Wali, Head and Senior Nephrologist at the Asian Institute of Nephrology and Urology. Congratulations once again, sir. All highly distinguished winners in the Excellence in Nephrology category. All right. Can we also have Dr. Piyush Mathur? Again, for the same honor, Excellence in Nephrology. He's a Senior Consultant Nephrologist in HOD, Department of Nephrology at Santogba Durlabji Memorial Hospital, Jaipur. Also in Excellence in Nephrology, we have Dr. Prashant Bendre, who's the Consultant Nephrologist in HOD at Jaswant Rai Hospitals. Congratulations, sir, Dr. Piyush Mathur and Dr. Prashant Bendre. Also for Excellence in Nephrology, Dr. Alok Kumar, who's the Professor and Head of Department of Nephrology at Sri Guru Ram Rai Medical College, Dehradun. Congratulations, sir. Also in Excellence in Nephrology, Dr. Abhideep Chaudhary, Vice Chairman and HOD of Department of HPB Surgery and Liver Transplantation at BLK Max Super Specialty Hospital. Thank you, sir. And congratulations once again to all of our distinguished medical professionals. More to come. Also in the category Excellence in Nephrology, our winner is Dr. L. Shashidhar Reddy, Senior Consultant and Head Department of Liver Transplant and HPV Surgery from Continental Hospitals, Hyderabad. Also Excellence in Nephrology, Dr. Ajitabh Shrivastava, Director, HPB Surgery and Liver Transplant from Max Healthcare. And we also have Dr. Naveen Ganju, Lead Hepatologist and Liver Transplant Physician. Astra Hospitals, Bangalore. Dr. Naveen Ganju, sir. And ladies and gentlemen, we also have Dr. Amit Rastogi, who's the Chairman, Liver Transplant and HPB Surgery at PSRI Hospital. Also in the same category, Excellence in Nephrology. All very highly distinguished winners in the category Excellence in Nephrology. Huge round of applause for all of them, please. All right, and now we move on to our next category, which is Emerging Star in Nephrology, ladies and gentlemen. And in this highly coveted category, our first winner is Dr. Kamlesh N. Parekh, who's the Director of Renal Sciences and Transplant Services at Sterling Hospital, Vadodara. Huge round of applause, please. Congratulations, sir. And in the same category, which is Emerging Star in Nephrology, we have a few other winners, our next of which is Dr. Ashish Mishra, who's the head and chairperson of Chandan Institute of Liver Transplant and HPB Surgery, Chandan Hospitals, Lucknow. Let's kindly have Dr. Ashish Mehra on stage. Congratulations on this honor, sir. Emerging Star in Nephrology. And also in the same category, Emerging Star in Nephrology, we have Dr. Chandan Kumar, who's the Director, Hepatology and Transplant Hepatology at the Krishna Institute of Medical Sciences, Hyderabad. Let's please have Dr. Chandan Kumar on stage to accept the honor, Emerging Star in Nephrology. Another winner in this same category. Okay, and let's move on. Let's move on, ladies and gentlemen. And with that, let's have Dr. Alan Kumar K, who's the head of Liver Diseases and Transplantation Institute, Senior Consultant and Liver Transplant and HPB Surgery, Apollo Hospitals, Chennai. Ladies and gentlemen, huge round of applause, please. All right, and our next category is Emerging Star in Renal Transplant Excellence, and that goes to Dr. Neeraj Goyal, who's the Associate Director, Kidney Transplant Surgeon and Senior Consultant in Urology, Alchemist Hospital, Panchkula. Huge round of applause and congratulations, Dr. Neeraj Goyal. Huge congratulations once again, ladies and gentlemen. Okay, and now Hall of Famers. This is Hall of Fame in Nephrology, ladies and gentlemen. All right, we've got Dr. Ritesh Sharma, who's the Chairman, Nephrology and Transplant Medicine, Yatharth Super Specialty. Huge round of applause, ladies and gentlemen. All right, and the next Hall of Famer, also in nephrology, is Dr. Manoj Arora, Senior Director and Head, Department of Nephrology and Renal Transplant Medicine, Max Super Specialty Hospital, Shalimar Bagh. And the Hall of Fame Nephrology, also another winner, is Dr. Jitendra Kumar, CMD, Accord Super Specialty Hospital. All right, let's move on, ladies and gentlemen, to Excellence in Comprehensive Eye Care Services. And the winner in this category, Excellence in Comprehensive Eye Care Services, is Dr. Ritika Sachdev Gupta from the Center for Sight Group of Eye Hospitals. Can we please have Dr. Ritika Sachdev Gupta on stage and kindly accept this honor? All right, and for pioneering work in the field of IVF, can we please have Dr. Neha Gupta on stage to kindly accept this honor? Please join me in welcoming Dr. Neha Gupta, Senior Consultant and IVF Specialist at MediWorld Fertility Center in Delhi, NCR. Huge round of applause once again. Congratulations on this highly esteemed honor, Dr. Neha. All right. Up next, Dr. Pallavi Tippal, Senior Fertility Consultant and Medical Director from FemCare Fertility. And this is for Excellence in IVF Care, ladies and gentlemen. Congratulations, Dr. Pallavi, on this incredible honor and this special moment, a token of our recognition. We salute your efforts and contributions to the field. And now, as a pioneer in IVF care and innovation, if we could please invite on stage Dr. Abha Majumdar, Head of IVF Department at Sir Gangaram Hospital. Huge round of applause, please. Dr. Abha, we congratulate you, we salute your efforts, and we ask that you please kindly claim this symbol of recognition on stage. All right. And from 49 Fertility Center, if we please have Ms. Prashanti Gandhi kindly accept a token of our appreciation, our recognition. Thank you so much. If we could please have Ms. Gandhi on stage to accept the award. And we'd also like to felicitate our next winner. And our next winner is Radiant Dental Care, Dr. Shrikant Kandepu. Congratulations, sir. We ask that you kindly please take the stage and accept the honor. And our next winner, ladies and gentlemen, is Masina Hospital Trust, Mumbai. Let's kindly please have the team from Masina Hospital Trust, Mumbai on stage to claim this honor. And the next and the last felicitation for this segment anyways, before we move on to our thought leadership sessions, is Mark N Health Tech Limited. If we could kindly have the Mark N Health Tech Limited team on stage to accept this very special and highly coveted honor. Thank you. Thank you once again. Huge congratulations to all our winners so far. Many more to come. And thank you, Pooja, for doing the honors. With that, we're going to move on to our next thought leadership session, as promised, ladies and gentlemen. And our next panel discussion is going to explore a sector that is shaping the future of health, wellness, and economic growth in this country. That's right. This next session is titled India's $100 billion nutraceutical future, leading wellness with wealth. And this conversation will focus on how India can essentially harness the potential of nutraceuticals, wellness innovation, and scientific research to drive both health outcomes and economic opportunity. So to guide us through this discussion, if I could please invite back on stage my colleague and principal correspondent with the Times Network, Ashish Parikh. Ashish, let's kindly have you back on stage. And it's my pleasure to now welcome our distinguished panelists. And our distinguished panelists this afternoon include, up first, Dr. Ananya Awasthi, who's the founder and director of Anuvad Solutions, who brings deep expertise in health innovation and wellness solutions. And joining her, Dr. Meenakshi Singh, who's the chief scientist at the Council of Scientific and Industrial Research, whose research insights are truly shaping the nutraceutical and wellness sector in India as we know it. With that, let's have both of our doctors, Dr. Awasthi and Dr. Singh, on stage so that we can dive right in and kick off our next session, which is, as mentioned, ladies and gentlemen, India's $100 billion nutraceutical future, leading wellness with wealth. All right, are Dr. Awasthi and Dr. Singh with us? All right, they've now joined the stage. All right. Thank you so much, doctors, for joining us to do the discussion justice. And with that, Ashish, it's over to you.
Thank you, Pooja. We've been talking about health, a lot of serious topics, a lot of serious discussions. Economically as well, there's a lot more to explore when it comes to health in India. And in this session, we'll be talking about nutraceuticals. It's now become a serious industry. It's no more a fad. Anyone you talk to, from probiotic capsules to even turmeric lattes, everybody is talking about nutraceuticals. And of course, our panel of experts here will be able to guide us more about what's happening in this industry, the latest innovation, and also the opportunity that lies for India, which boasts of having one of the most ancient wisdom in the form of Ayurveda, with cutting-edge technology happening right under our noses. Let me start with Dr. Awasthi. First of all, we were having this conversation about nutraceuticals as well backstage, and I need to ask you, this $100 billion industry that is being raved about across the world, how serious an opportunity is this for India? And also help us understand what's behind the rise of this industry.
Thank you very much for the invite. So, as you said, shifting gears from health to nutrition. So, I think this rise of the nutraceutical industry, I see it more as a reflection of the increased awareness that people have across the Indian market and across the world about the importance of nutrition and about the importance of preventive health, promotive health. I think COVID-19 served as a very, very important reminder to people across the world that beyond treating illness in a hospital, you really, really need to work towards holistic health. You need to invest in, I remember that before 2019, anybody who would be talking about immunity was considered to be unscientific. People used to be like, "Arey, immunity, it's not even scientific." And, so many things are given to, eat capsules and all sorts of juices to drink. And they said, this is all meaningless. It has no science. And your ghar ka haldi wala doodh means nothing because, it's all about allopathy and allopathic medicines, which of course serve a very, very important role in the entire public health scenario. But in the last couple of years, people have become very, very aware that micronutrient deficiencies is something that needs to be looked into. So when we talk about nutrition, we talk about undernutrition, we talk about these days obesity, overnutrition. There's a big problem in India, it's called hidden hunger, wherein India is facing the triple burden of malnutrition, and one of these being micronutrient deficiencies. So when I think of nutraceuticals, I think of it from the lens of, I mean, people don't even realize that almost 60% of Indian women are, say, anemic, right? Or more than 50% children, are deficient in iron and folic acid. From there to a large urban audience in this country, which is looking for supplements for that can work towards improving their immunity and wellness. So this rise in nutraceutical industry is really a rise in the awareness in the general population, which understands that yes, allopathic medicines are important, yes, treatment is important, but they are becoming smarter in terms of understanding that they need to make informed choices to improve and, improve their health from a more upstream way, wherein, whether it's antioxidants, whether it's, wellness supplements, there are a lot of Ayurvedic supplements which are there in the market. But I think that is really a reflection of how aware the market has become in terms of investing. And I mean investing even in terms of investing money into, their own nutrition and wellness. So that's really a reflection of changing times.
Well, on the surface, when you look at it, the opportunity seems endless as well. Dr. Singh, that brings me to the point. Very aptly, she mentioned how a lot of our traditional practices are dismissed as pseudoscience. Whenever you try to suggest something to someone, they say कि ये सब पुरानी बात है, ये काम नहीं करता, focus on allopathy. But Ayurveda, a lot of people, experts say, even allopathic experts say that it is a treasure. How do we exactly validate this ancient wisdom that India has with modern science so that at least on the consumer end, there is some sort of a credibility that is established so that at least the products, continue to go into the market?
Thank you giving me opportunity by times. Today this nutraceutical is very, very important, and in 2021 actually, group of industries leaders, they have approached to the Principal Scientific Advisor Office as they were facing some of the challenges in this industry. One of the challenge was that, how they are exporting, they don't have any codes for that industry. So to have the codes, and another thing is harmonization, another point, and maybe some of the government schemes, because we know that nutraceutical neither it comes under, pharma or not under, nutrition products. So it is in between, and no direct ministry dealing with this subject. So with these challenges, what nutraceutical industries was facing, they have approached to the Principal Scientific Advisor to sort out or to have some solutions in this area particular. So for that actually then request came to CSIR, and I have been given this responsibility to take this challenge forward. So with the chairmanship, under the chairmanship of Principal Scientific Advisor to Government of India, we have constituted the task force and wherein we have taken the members from different ministries, relevant ministries, including FSSAI, Ministry of Food Processing, and many industry leaders were the part of this task force. So in this actually, during the 3 years time, we have come out, some of the, points, and we have also given the, to relevant ministry, to create some of the HSN code, because under different codes, these products are being exported. And under that, one remission of the, export product also under the Ministry of Commerce, that scheme also has been, used by nutraceutical industries. So with this actually, some of the, and now this has been now given to the Ministry of Food Processing, wherein now nutraceutical industry can get the help from the Ministry of Food Processing to use the certain schemes like maybe PLI, how to develop this sector, so that in future some of the challenges can be, taken care.
Absolutely. Dr. Singh, one of the interesting points that you mentioned is that there needs to be a collaboration across ministries, across different sectors as well. And that's what I want Dr. Awasthi to come in as well. We were talking about the fact that, there is a lot of focus on nutrition, but in reality, this industry sits right in between food and medicine. You know, so in terms of regulatory compliances, in terms of earning the consumer trust and also validating it globally as well, what are the sort of focuses that needs to be brought in, not just from the industry perspective, but also from the government perspective?
Right. So you've asked me two questions. One is winning consumer trust and sort of really positioning and framing the nutraceuticals in a way that it is scientific and also consumers understand what nutraceuticals mean. So number one, and then the second is the role of the government in terms of, how do you promote science-based products. I think the first thing that one of the challenges that nutraceutical industry is not just faced in India, but across the world has been that it needs to be understood. When a consumer is buying a nutraceutical, they need to understand it's not a magic bullet. They need to, when you're consuming your omega capsule or your probiotic, yes, I consume a probiotic besides having dahi, but you need to understand that nutraceuticals are not magic bullets, they are supplements. So I think correct, honest messaging has to be done on the product, not just because I'm saying that as a food first advocate, because I belong to the group of people who say that food is your first medicine. And why we are facing all sorts of vitamin and mineral deficiencies is because as a nation we are, eating a lot of calories from refined cereals and we are not eating diverse diets. But also from an industry, economical perspective, what happens is the consumer goes to buy a nutraceutical, and if it has very exaggerated claims, इसको खाओगे weight loss हो जाएगा, इसको खाओगे तो एकदम ही brain वो हो जाएगा, your memory will improve. What happens is it creates a certain expectation, it creates a hype, and obviously because it is a supplement, it acts in a more sustained manner, and then the consumer feels कि अरे ये तो weight loss तो हुआ नहीं मेरा, So and then it comes crashing down, and then the trust is broken. So hence it is equally important from a market perspective also to in a scientifically correct manner brand what nutraceuticals are. They are not medicines, they are not replacement for your healthy diet, but yes, they are supplements and they need to be consumed by that population which has those deficiencies. And then the second thing in terms of how does government promote it, I think one of the major things that government really needs to do is invest in a lot of R&D. Ayurveda is one area where I feel that the consumer demand is more than the amount of investment that the public investment that has been there in terms of scientifically validating a lot of these products. Because once that is done, it will not only benefit domestic consumer market, but also export market, because it is all driven by how scientifically back these claims are.
Now you speak a lot about tall claims that are made. The problem is that besides the government regulating something, there has to be some sort of a self-regulation as well by these companies. At the end of the day, that's the real solution we're looking at. And interestingly, you mentioned about how India is now transitioning, becoming more aware about nutrition. I try to focus on my fitness, and the maximum knowledge that I had for the longest time was carbs kitna lena hai, protein, and all your other fiber, etc., etc. But now you have people focusing on gene level diets as well. They're getting data from their genes, and they're looking at what's the best as per their genes as well. So how important is technology becoming in all these issues?
So, about 7-8 years ago when I was working for the Harvard School of Public Health India Research Center, I was young, and one of the first meetings that we had with the faculty was with this group that was into, microbiome, precision medicine, and microbiota. And I was like, guys, we are here to do public health. I don't even know how relevant, how scalable it is in the Indian context. But times have really changed, and personalized nutrition, I'm sure everybody sitting in this hall and whoever is listening to this summit, if given a chance, would want personalized nutrition advice. Who won't want, for their genes to be tested and for their, nutrition counseling to be very, very personalized basis the gut microbiome that I have. But we have to understand the perspective that it is, of course, very, very expensive. It is when we are, and I'm an advocate of public health nutrition. So it is very, very limited to the urban paying class, very, very limited to niche categories, and this science is evolving. But when we talk about personalized and customized nutrition advice, I think the role of AI and technology is something that can be leveraged to really scale up personalized nutrition advice. Like one of the things we've been trying to work on as a group of researchers has been how to use AI to really give personalized advice based on scientific evidence on what is nutritious.
Now, it's interesting that you're working so hard for it. All that people do these days is they just look for a prompt on the internet and they put that in ChatGPT and, try to get the best diet advice as possible. How good is it going to be? That's, of course, a larger question, a larger context, calls for a larger debate as well.
And what scientific evidence is feeding these algorithms? I think
Absolutely.
as consumers and as a nation, we should be very careful of, because tomorrow your ChatGPT is going to tell you what to eat and what not to eat. So we need to be very careful of what we are training our algorithms with, and that it is trained and informed with science that is, scientifically valid and also very contextual to the country.
Absolutely. It's an interesting point that you're making. The kind of information that is being fed, the source of it, the information on that is very scant. So I think we need to take it with a pinch of salt as well. Before we wrap, Dr. Singh, we talk about how yoga has become the soft power that India has exported to the world. Can this industry be the next soft power that India can export to the world?
Of course, why not? Because as per the Viksit Bharat, that document, now by 2047, we say that it can become the 100 billion, industry, US dollars. So actually for that, India is very rich in, we know that Ayurvedic knowledge, traditional knowledge, we are very much rich. Only where we are lacking actually the scientific validation. And we have all the ecosystem available in India. So, basically like CSIR, where traditional knowledge, this digital library also exists. We can leverage and use that databases where all the, our traditional, knowledge has been text. And we, with the, evolving the partnership with the industry, where we can use industry for the industry, can invest in this money, in this industry, in this area, and we can come up with a lot of data, and already we have knowledge ecosystem with the all expertise available, with lot of safety data and quality assurance, with CSIR labs, we can actually, use these raw materials and preclinical studies, clinical validation, regulatory studies, all data, all actually protocols have been standardized. Only thing is that we have to create systematic data for export of this kind of products. And where raw material is available in India, we should take advantage of this. Already industry is taking advantage of this raw material. And one example we can see of ashwagandha. How ashwagandha, lot of actually we get advisory from the European Food Safety Authority also, that we should, again quality issues come. So if we actually maintain the quality of our products, then definitely we can actually reach to the target of this industry.
Absolutely. I think that's the biggest takeaway of this panel discussion. The fact that it's, the growth of this industry is not only in terms of building more fancy products or creating catchy labels and hashtags, it's also ensuring that you first validate India's ancient wisdom with modern science and then eventually earn consumer trust as well. I think it's a long way to go, but the future is bright and there's a large opportunity as well, and especially with the kind of research that Dr. Awasthi and Dr. Singh are doing as well. Really appreciate you for joining us. A big round of applause there for our panel of experts here.
All right, thank you, Ashish, for asking all the right questions. And to both of our doctor panelists, I ask that you please remain on stage. Can we please have Pooja Sethi back on stage, Managing Editor of Times Network Digital, to present each of our doctors, Dr. Awasthi and Dr. Singh, with the token of our appreciation. Thank you for being here. Thank you, Ashish. This is our gesture of gratitude for sharing your rich range of insights here at the India Health Summit and Awards 2025. Thank you. Thank you, ladies. Thank you once again. All right. So, ladies and gentlemen, we now move on to a very special initiative, one that's close to our hearts at the Times Network. And it's called Take Charge. Take Charge was born out of deep engagement with breast cancer patients and advocacy groups. And this initiative essentially recognizes the power of information and the power of empowerment, so to speak, developed to equip patients and their families with the knowledge to advocate for themselves, to ask the right questions, and to make informed choices. Because, ladies and gentlemen, it's not just about survival. It's about empowered living ultimately. So through real stories, through expert insights, easy to understand resources, Take Charge reframes survivorship entirely as a bold, ongoing commitment to self-care, awareness, and advocacy. But most importantly, Take Charge stands as a message of hope that a diagnosis is not the end of life, but it's the beginning of a new journey, one where patients and caregivers have the power to shape their own stories. So to share his perspective on this transformative initiative, it is my honor and privilege to please invite on stage Mr. Amitabh Dubey, the country president and managing director for Novartis in India, to deliver a keynote address. Huge round of applause once again, sir. All right, sir, we'll kindly have you on this podium, please. Sir, we'll have you here, right in front of the camera, sir. Thank you so much. Huge round of applause once again for Mr. Dubey from Novartis. Sir, it's an honor to have you with us.
Good evening, ladies and gentlemen. It's truly an honor to welcome you all here this evening as we unveil a campaign that's close to our heart, the Take Charge campaign, in partnership with Times Network. At Novartis, we believe that healthcare is not just about medicines. It's about people, their stories, their journey, and the power of hope, empowerment, and resilience. Breast cancer today stands as a leading cause of cancer and cancer-related deaths in India. Every year, close to 190,000 women are diagnosed with breast cancer. That's one woman every 4 minutes. And heartbreakingly, every 8 minutes, we also lose a woman to this disease. What makes the Indian scenario even more concerning is that nearly 48% of these women are under the age of 45 years, much younger compared to the Western world, where this ratio is around 28%. This not only impacts individuals, but families, children, community, and truly the soul of our society. However, there is always a silver lining. Advances in medicines are giving us new hope. The 5-year survival rate for breast cancer in India has increased significantly, from around 40% quite a few years back to 60%. This is not just a number. It's a reflection of science, investment in innovation, collaboration, and most importantly, human resilience. One needs to remember that breast cancer does not have to mean the end of life. Many women today continue to live with dignity, purpose, and positivity, redefining what it means to be a survivor. And survivorship is not a clinical outcome. It comes with emotional weight, societal perceptions, and visual stereotypes. Too often, all treatments are painted with the same brush, without acknowledging that every patient journey is unique, and the outcomes can vary based on individual patients. That is why personalized care, tailored by their oncologist is key to improving both survival and quality of life. And let's not forget, even after early detection and treatment, recurrence remains a real fear, in some cases as high as 50%. This underlines the need for ongoing care, advanced therapies, and most importantly, patient empowerment. There is a saying, knowledge is the antidote to fear. And we believe that empowered patients and caregivers are the cornerstone for better health and better patient outcomes. At Novartis, as a patient-centric organization, our mission goes beyond treatment. It's about creating a future where patients have the courage and clarity to take charge of their lives. We must support them, not just at the time of diagnosis, but through every phase of their journey. This includes giving them confidence to have honest, informed conversations with their doctors and care teams. With this vision, we at Novartis are very proud to launch the Take Charge campaign, a movement built on the pillar of hope, positivity, and empowerment. This campaign is being launched for the first time in collaboration with the Times Network Group. It aims to reach patients and caregivers across the country, helping them to understand that they are not alone, that their lives don't stop at diagnosis, and they have the power to shape their own story. Whether it's making informed choices, seeking the right treatment, or simply finding strength in their everyday lives, Take Charge is here to be their companion on this journey. As we unveil this campaign today, I want to extend my heartfelt thanks to all the oncologists, patient groups, survivors, caregivers, nurses, partners, and every single individual who is a part of this mission. To all the women who are fighting breast cancer and to their families, I want to say, you are not alone. We see you and we stand with you. Together, let's build a future where survivorship is not about living longer, but also about living better. Let's take charge of health, of hope, and of life itself. Thank you, and I wish you a very inspiring evening ahead.
What inspiring words from Mr. Dubey. Huge round of applause. A very powerful message there once again. And we'd now like to officially launch the Take Charge campaign that you've been hearing so much about. And to help do the honors, if I could please have Rohit Chadda back on stage, please. The CEO and President of Times Network, ladies and gentlemen, to join Mr. Amitabh Dubey for this incredibly special moment. Ladies and gentlemen, please put your hands together as we're about to unveil Take Charge, a step towards reimagining life after breast cancer.
Every year, 190,000 women in India are diagnosed with breast cancer. That's one woman every 4 minutes. Nearly 48% of these women are under the age of 50, much younger compared to the West. Breast cancer doesn't just impact individuals, it impacts families, communities, and the very soul of our society. However,
How moving was that message? All right. With that, thank you so much. And Mr. Dubey, we ask that you please remain on stage for just a moment longer. Thank you so much, Rohit. And let's see. Now, we're going to take this conversation forward. All right? And to do just that, if I could please invite on stage Ms. Amita Vadva, who's the senior news anchor with Times Network, to the stage as she engages in a special one-on-one session with Mr. Amitabh Dubey. And this session is aptly titled Taking Charge, Reimagining Life After Breast Cancer. It promises to be a particularly moving session, and we're very much looking forward to it. All right. Okay. Thank you so much. Looks like we're about ready to begin. And just by way of reminder, I think you're all familiar with our partners in this effort. We're powered by Intas, we're co-powered by Novartis and All Out. Our knowledge partner is Dr. MGR Educational and Research Institute. Our supporting partner, Fit India, our strategic alliance partner, Onextel Communications, our wealth partner, Nuvama Wealth, and our outdoor partner, Heights. And with that, we'll now hear from our co-powered partner, Novartis. Mr. Amitabh Dubey, I give you the floor. And Amita, it's over to you.
Thank you, Pooja. Good evening, ladies and gentlemen. It's great to have you with us. And Mr. Dubey, thank you very much for taking out your time. It's been quite moving as far as your message is concerned. And when we speak of take charge, breast cancer, every woman's concern, and we've seen the statistics, however, they're not looking bright. But when we take a look as far as how to avoid early diagnosis, that seems to be, when it comes to center of this initiative that has now begun on part of Novartis, which is called Take Charge. And as this initiative talks of, Mr. Dubey, how does it actually align when we speak to Novartis? Taking it forward as you spoke in your keynote address, but can you elaborate a little more on it?
Thank you, Amita. It's really a privilege and honor for me to be here. This campaign is extremely personal and professional to me. I've been 30 years in the oncology space, and I've seen science evolve and move the outcomes based on patient individuality. Let me give two scientific examples onto this. The first one is in an area which is known as chronic myeloid leukemia. When I started almost 30 years back, we had hardly two treatments available for patients with chronic myeloid leukemia. It was hydroxyurea and interferon, with survival rates less than 5%. And we used to hear about talks of innovative treatment coming out, which will change patient outcomes. And then we had tyrosine kinase inhibitors, imatinib hitting the market, which changed the way CML was treated from being a deadly disease to a chronic treatment. And then came the second generations of TKI, and then the STAMP inhibitors today. Today, when we look at this disease, patients continue to stay years and years with chronic myeloid leukemia. And there's a talk happening around treatment-free remission, where we believe that patients with few years of treatment can go undergo remission, and they stop the treatment, then disease doesn't come back. That's the advancement of science. Looking at breast cancer, quite a few years back, all patients were painted with the same brush. One type of treatment, chemotherapy, not individualized. Over the years, the science has really taken innovation to the next level. We have each patient, there have been different surgical advancements, there have been imaging advancements, there have been diagnostic advancements today with genomics coming into play, and then there's been therapeutic advancements. And we at Novartis truly believe that this is one of our mission, to make treatments go personalized to every individual for cancer. And that correlates to the mission of Take Charge, because taking charge doesn't mean that just taking charge of your disease. It also means to have that informed consent and conversation with the doctor, which talks about your personalized care, personalized outcome, personalized benefit, personalized well-being. So it's all about taking charge of your disease to have your own outcomes of your disease.
So when you say personalized treatment, Mr. Dubey, how would you highlight when it comes to greater access and affordability that this message reaches all, especially to women, their families? As I said, early diagnosis is the key, but preventive measures, what can be undertaken, especially when you spoke of the age? less than 50 years of age. That is a number which is staggering, and it is also a concern. How do you, focus on wider outreach?
Again, a excellent question, Amita, and thank you so much for asking it. Access is about two things. Correct. One is ensuring that everybody is aware about the diseases and their outcomes. And the second is access about treatments. We together in the society and everybody have to play part so that we are making more people aware by having those conversations where people are comfortable to have conversations about cancer. Generally, it's believed that cancer will strike everybody except a particular individual. And that's why people are not ready to have the conversation. When it comes to regards to medicine, I must highlight that access to medicine is a multifaceted challenge. And we require every stakeholder to come together to play a part on it. It cannot be a government's responsibility or a pharma company's responsibility or an NGO responsibility or an individual responsibility. But if we come all together as stakeholders, we can build a strong ecosystem where access is the center and the patient is the center of it. I must want to compliment the government here and congratulate them to a lot of initiatives as they have taken. Cancer is a central part in a lot of central government initiatives. Ayushman Bharat is one of them. A lot of state governments have specific cancer-driven programs to drive access for medicines. But in spite of these initiatives, Amita, only 38% of population today is insured. And in spite of all the advances which is being made, the innovative treatments are less accessible to patients through all the government's channels that are available. We need to work together how we can make these channels available. From our side at Novartis, we do play a very important part, and we try to see that we have patient support programs. We have been working with the UP government in 2 districts to work on a continuum of care, basically, and that is basically not to go right down to the individual level. We have trained ASHA workers in that 2 districts where these ASHA workers go house to house, talking to females in their local language, educating them about breast cancer, helping them to understand self-breast examination, and if any person is found with a lump or an early signs, they are referred to district hospitals, and then they are referred to a cancer treatment center or center of excellences for cancer treatment. That referral pathway and ecosystem has been created in 2 districts, and we are partnering with the government to do that. So access becomes a multifaceted challenge which we need to address, but my belief is that every stakeholder needs to take charge for access to be provided to patients in India.
What about affordability?
Affordability is always going to be a mixed challenge, Mita. There's a price of innovation that is always going to be there, but affordability should not be the reason why a patient shouldn't be able to get medicines. And to answer an affordability challenge, again, all stakeholders need to come together, because affordability cannot be only the answer of government, or affordability cannot be only the answer of a pharma industry. We partners have to come together, find out a sustainable solution which makes new innovative treatments more accessible to patients across the country. It could be through insurances program, could be through better packages in Ayushman Bharat, and could be through companies looking at innovative funding mechanism.
In the long run, how are you looking at your campaign, sir? Because when we speak of future care, does it only limit itself to breast cancer, or other cancers in general? Does it cover them too?
So when you talk about take charge, as we know that in India, breast cancer is one of the leading cancers today. We want every woman in India at least to be aware and should have the power to take charge of her own health with regards to breast cancer. We are continuously focusing currently on breast cancer as an area where we want to go deeper and ask every woman to take charge for their own health. If it goes well, then we look forward to making this campaign a more wider campaign.
So do you foresee any challenges or opportunities in this campaign?
I see only opportunities. I see that there is a huge segment in India which, if takes charge, can be early diagnosed, and we can have potentially better outcomes for patients.
So any message that you want to give across, as you said in your keynote address, that the women should know that they are not alone, that they have a family, that they have you, that they have Novartis and that they can take forward as far as the Take Charge campaign is concerned? Any message for those women?
I have a message for every stakeholder. I want to request the government that let's together take the collective responsibility and take charge for better patient outcomes. I have a message for the doctors. I want to say thank you for taking charge for having better patient outcomes. I want to thank the researchers, and I want to tell them thank you for innovating new treatments that have better outcomes for patients, and thank you for taking charge to change and bend the curve of life for cancer patients. I want to thank the media partners too here, and I want to tell them that, guys, we together need to have the collective responsibility and take charge to make this campaign reach out to every segment in the society and across the country. And finally, I want to say to patients and caregivers, you are not alone. There's a huge amount of hope. There are better treatment outcomes coming. So take charge of your own patient outcomes for better and brighter quality of life and outcomes.
Well, that sets in motion as far as Novartis' campaign is concerned. Take charge, reimagining life after breast cancer. Thank you very much, Mr. Dubey. It's been enlightening speaking to you. And of course, this campaign, much success to you and to Novartis. Thank you very much. Big round of applause, ladies and gentlemen. Mr. Dubey, request you to be on stage with us. Yes. Thank you very much, ladies and gentlemen, for joining in.
All right.
Over to you.
Can we please have Pooja Sethi back on stage to felicitate Mr. Amitabh Dubey with a token of our appreciation. And thank you, Amita, for guiding us through that discussion. Mr. Dubey, we want to acknowledge you, we want to felicitate you for your valuable contributions. Our heartfelt thanks to Novartis India, led by Mr. Amitabh Dubey. All right. And with that, ladies and gentlemen, we're going to continue on this journey of dialogue and this journey of discovery with our next panel discussion. And this one brings together both the voice of science and the voice of lived experience. That's right, ladies and gentlemen, the theme is breast cancer and beyond. Stories of strength, science, and survival. So this next session will essentially shine a light on the personal journeys of a survivor and the scientific advancement that give patients all over renewed health. And it's actually my privilege and honor to moderate this next discussion. And I'd like to preemptively invite my panelists on stage, who include Ms. Chavi Mittal, actress and breast cancer survivor, whose courage and candor have really inspired countless women across the country. Huge round of applause, Ms. Mittal. It's such a pleasure to have you with us. And joining her, Dr. Sumant Gupta, MBBS, MD, DM Medical Oncology, Senior Consultant and Head of Medical Oncology, Hematology, BMT, and Director of Metro Cancer Institute. He's a leading expert who's been at the forefront of cancer care and treatment innovation. So I have the honor of moderating this next discussion, and together we'll explore not just the challenges, but also the incredible stories of resilience, science, and survival. All right. All right, it's a pleasure to have you with us. And this is indeed a pleasure because we have a medical perspective and yet the very human perspective. We've got survival and we've got science, all right? And beyond that, we have a doctor and a patient. So I think it's incredibly special for all of those reasons. And Chavi, I want to kick off the conversation with you. What we keep hearing and what we've heard time and time again this afternoon is that every 4th minute, a woman is diagnosed with breast cancer. And we just witnessed Take Charge, essentially the unveiling of a new initiative. If you were to go down memory lane for a moment, and if you were to retrospect and think about when you initially received your diagnosis, how might initiatives like Take Charge have approached or essentially influenced your entire approach to your recovery? Very curious to understand.
So this, first of all, thank you so much for having me. May I please request a little bit of silence in the audience because at certain moments I can hear you guys more than I can hear her. Gets a little difficult to comprehend the question and I'm trying my best to answer this one.
Absolutely.
So when you talk about taking charge, if you ask me at that point, it's not something that you can identify in the moment. It's always something that you look back in retrospect and think, okay, yeah, this step that I took at that point was me taking charge. So I think the first step that I took, which I think was me taking charge, was understanding that this has happened. I think that acceptance of what has happened was the first step because initially I kept trying to think that no, there must be a mistake. That there is it's wrong, you know, it cannot be right. Then sometimes it happens, you know, we all watch Bollywood movies and we feel, kuch to mix up hua hoga, ye meri report hai hi nahi.
Ji, bilkul.
So that happened and then I thought that maybe I did something wrong in my diet, maybe something was wrong in my lifestyle that this happened and maybe if I can just reverse that, it can just go away. But then wisdom prevailed and I thought that even if I want to try alternative methods and you know, try to take care of my diet, the first thing that I need to do is accept this and ask my oncologist the right questions. So I've literally bombarded him with different questions. I'm sure, doctor, you must be feeling, meeting the patients like me every now and then. I asked him what the treatment options are, why this and why not that. And the most important question that I asked him was, what next? Because you here are telling me that I'm going to be cancer-free for sure, but how's my quality of life going to be after I'm cancer-free? Is it going to be the same or am I always going to be labeled a cancer survivor? While I'm very proud to be labeled a cancer survivor, there's a different fun in accepting that I'm Chavi version 2.0 and I'm much stronger than I was before. So that is the charge that I took at that point. And after that, during my journey, the most important thing that I recognized was that no two cancers are the same. So no two reasons why somebody gets the cancer. The same cancer are also the same. They're always different for different people. There is no, I think there's no proof in medical science that why this person has a cancer and why the other person with a similar lifestyle doesn't. So to recognize what could have gone wrong in my life so that, you know, it doesn't come back was something that I was trying to introspect. I still don't have all the answers, but I try my best to, take care of my lifestyle, wake up at a certain time and take care of my diet in a certain way. And that, I think, is me taking the step to be proactive.
Chavi, thank you so much for sharing that. It's deeply personal. It's not easy to share, and I think your candor really moves us all. And if I've understood you correctly, it was essentially a multi-step process, but the first step was coming to terms with the fact that this has happened to you and answering the question, why you, to which, of course, there are no answers. And then the second step was to essentially regain control, getting the information right at your fingertips, asking the questions such that you could take charge of your own recovery, right? So against that backdrop that we've just heard, Dr. Sumant, of course, it seems that recurrence of breast cancer occurs in 10 to 50% of cases. That figure is, of course, staggering. All right? So you're in the incredibly difficult position of helping patients cope with the fact that, all right, there is this fear that's always looming in the backdrop, and yet they need to continue to live their lives to the full extent. How does one possibly strike that balance?
So I think the initiation, Chavi ma'am has done a very beautiful discussion. First and foremost is when the patient has a disease. So that is the lightning kind of a thing. The lightning strikes. Why me? Why not anyone else? I have not done anything wrong. Whatever I have done, everyone else is doing. Right. So that is one of the first things. Going through the journey as a smart patient is something we as oncologists always welcome, and we are very happy to have our patients who go through whatever is being told with good discussions and like a democratic process. Yes, in breast cancer, there is a chance of recurrence. I think this time, the patient, it's like she said, Chavi 2.0. So it's a Chavi 2.0 living it. So she's not scared of the disease. She knows what is happening to her, what has happened to her. And if we talk about recurrence, yes, there is data that up to 25-30% patients in early breast cancer also can recur. But again, we have to understand there are two aspects of it. One is the disease biology itself, that what kind of breast cancer was it. You have different kinds of breast cancer, both on the luminal levels or on the levels of the estrogen, progesterone receptors, and lots of those things. And
Right.
yeah, and the second part is what I can do to stop it from coming back. So what is inherent, the doctor is taking care of it by giving beautiful medicines and whatever new innovations are happening, but what I can do. So as a survivor, or as I think the better word is Yodha, which you become in your 2.0, you have to be aware that the first 5 years are the only major crucial years when the disease tends to come back. So that is why in cancer we always talk about 5-year recurrence rates.
Right.
So after 5 years, you are mostly equivalent to a normal person, the chance of getting a cancer back. So I think what we have to do, and which has been scientifically proven, is that we have to follow 4 or 5 small dictums. One is controlling our weight and doing regular exercise, because the data is clearly showing that if your BMI is normal, if your body weight is normal, and if you're doing around 30 minutes of regular exercise per day, then your chances of getting a cancer coming back becomes less. Similarly, diet is something which has to be balanced, not too much binging on carbs, which has again been scientifically proven. And the third most important part is abstinence from alcohol and tobacco. So I think if we are able to manage that, so in totality it is nothing but the same thing which we always say, a healthy lifestyle. So if we are having a healthy lifestyle, I think we'll be able to cope up with it, and we'll have a beautiful 2.0 life with us.
Well, speaking of 2.0, and I want to, take it back to you now, Chavi. I think what's often overlooked in the conversation around breast cancer survivors is their ecosystem, and that includes their ecosystem of caregivers, right? So if you could walk us through the role that perhaps your caregiver played in your story of recovery, whether it's managing your medical appointments, helping you make more informed medical decisions, or simply being a quiet voice of strength, which is priceless.
So I think, first of all, I feel cancer is not a disease which is an individual disease. It's a disease which happens to the whole family. So caregiver becomes extremely important. And so I think there's a step-by-step role that everybody plays in a cancer journey. First is the doctor, who's going to treat you, do your surgery, tell you this is medicines, what you have to have. Second is the caregiver, who's going to actually make sure that you do all those things and have what you need. And third is you yourself, because it's your journey. So a caregiver's journey also is different for different caregivers, just like a cancer journey. So depending on what the patient needs is what the caregiver journey looks like. In my case, I think for the first 3 months, were the hardest after the surgery for me. And it was difficult even for me to understand what I wanted, right, what I needed. So obviously it was that much more difficult for my husband to understand what I needed. But I know that my journey was, it was not just a cancer journey, it was also a journey of me rediscovering myself. So for him to allow me to go on that path without a worry was the biggest strength that I could have ever expected, because there were times that I just wanted to run away, and I would just tell him that I'm taking off for 2-3 days, and he would be just, okay, you go, do what you need, take the time, don't worry about work, don't worry about kids, I'm here.
Incredible.
I don't know mentally what he went through, because he never told me. I told him everything that I went through. So I think that's probably the only thing that he could do during that time, but that was the most important thing that I needed.
What an incredible pillar of support, right? And, another point that Chavi brought up earlier in the conversation that really struck me was that one doesn't just want to be labeled as a cancer survivor. What they're most concerned about is quality of life, right? Is their 2.0 version of life going to resemble their former self? How do you guide patients through that journey?
Yeah, so quality of life is something which has evolved as the main endpoint of all cancer treatments. Earlier, when cancer treatment started, or when the clinical trials were designed, it was designed on overall survival, it was designed on progression-free survival, that how long the patient will remain disease-free. But right now what we have been discussing, or right now what the dictum has become, is quality of life. So quality of life is something like, someone intelligent like her, she says, I want my life back and I want it to be as good, as beautiful as it was before. So quality of life is definitely one of the best index for cancer treatment. So coming back from the thing she started, surgery. Now we are getting into smaller surgical fields. We are able to get into breast conservation surgeries where the, I'll say, the defacement of the body is the least. So that is one important part of breast cancer. We try to avoid these topics. Even patients at times try to avoid these topics, and we have to like jam it into them that you talk to us. You don't have to just tell us, just remove the breast. No, you have to understand what disease you have, how we can conserve it, how we can maintain your body structure. The second aspect came with drugs. So I am a medical oncologist. So medicines or chemicals means chemotherapy, which are used to treat. So nowadays, the biggest invention, I think, in cancer chemotherapy was a simple tablet for nausea vomiting. I think Chavi might have used it, which was called as MCET or ondansetron. 20 years back, it was not there. Think of people, how they were suffering. So now, even the nausea, the vomiting, major problems are not there. So we have skull cooling caps, which we can put on the scalp. The hair can be saved. So basically, medical oncology has evolved. It has evolved from a branch which was more like a destructive branch to something very constructive, very beautiful. And we try to preserve the quality of life. So oncology it was a Trishul branch. So you had a medical oncologist, you had a surgical oncologist, and you had a radiation oncologist. But now it has become a holistic oncology. So it is not only oncology, it is psycho-oncology, nutritional oncology, everything interwoven into one thing. So a cancer center is incomplete till you have a comprehensive, collective group of people who are able to give you a complete holistic solution in cancer.
Sounds very multidisciplinary.
Yes, it is.
And all science aside though, Chavi, as a public figure, you really add a human lens to the conversation. So, for your fans, your followers, or even the ordinary layman out there who may be facing a similar situation that you are in or you have faced in the past, what words of wisdom might you have to share, or how might you better separate fact from fiction? Because, your voice carries so much weight.
I don't know about words of wisdom, but I think one thing that I can say is that for the longest time, because I was talking, like Doctor, you also just mentioned, quality of life, it is so important nowadays. I kept focusing on going back and living the same life that I was living before cancer. I remember that I had an injury which I went to get tested and the cancer was diagnosed. It was just by fluke. But the injury happened while I was doing a pull-up. So my only concern was, will I be able to do a pull-up again? That is my quality of life that I want back, right? I think, spiraled down into depression because obviously when I came back home after the surgery, I could not even lift my hand 5 degrees. So it was something which was maybe something which was going to happen in the future, and the doctors told me that you can't lift more than 5 kgs. And I said, 5 kgs, matlab what? Bicep curl 5 kgs or deadlift 5 kgs? What? 5 kgs what? Nobody had an answer to give me.
Right.
And I think it took me a few months to understand that my quality of life is going to be good, but it's not going to be compared to what I was pre-cancer. And I'm glad I stopped making that comparison, and this is what I would like to tell everyone. Don't make that comparison. Just take one day at a time. Rather than thinking, one day I'm going to do a pull-up, you can say, okay, today is day 1 from the time, I will eventually get there. And that's why I'm 10x of what I was before cancer, because I'm so glad I stopped comparing. I just took one day at a time. Otherwise, I would have just been stuck in the same chavi, not 10x. So yeah, there's no defining how much more you can be just because you fought cancer. I think that just adds so much more to your what you achieved.
That is so beautifully put, and this is not easily shared. We really admire your strength, and we salute you, Chavi. And coming to you now, Doctor, since Chavi has added the human perspective from the medical perspective, what is it that you'd like to share, with our audience, with our viewers, in terms of separating not just fact from fiction, but debunking so many of the myths that surround the disease?
So coming to the myths, I think basically we have to start at 2 or 3 things, which I think people like Chavi should help us in doing this, because biggest myth which is oncology community has to face is that biopsy spreads cancer. So I use this stage to bring it to all the people that biopsy does not spread cancer, and it is the most essential part to plan your treatment. So basically what we discussed today is cancer treatments have evolved, and you'll be equally equal or better person by the time you evolve from this treatment. So do not get scared. Just go through your treatment with the advice of your oncologist. And I think the world is very bright on the other side.
All right. And when we look at Chavi 2.0 and your plans ahead, your aspirations ahead, right? It seems like, you know, you've certainly on the other side of that dark tunnel, and there's a bright future ahead. What does that look like? And to what extent does this term breast cancer, or what you're coping with, factor into your everyday thinking and decision making? Or do you essentially believe that this is a bigger, better, brighter you?
Absolutely. I think breast cancer is the best thing that happened to me, because I would never have gotten out of my comfort zone and did all the things that I'm doing today because I was very comfortable. I was just so comfortable in the life that I was living. Sometimes I feel that life has a path for you and you need to be jolted out, and it was just that. It was just that for me because it was stage 1, it was grade 1, it was diagnosed just by fluke. It was just that nudge that I needed at that point, and I got it. And I also want to talk a little bit about the fear of the recurrence that the doctor was also speaking about, that breast cancer mein hota hai na, wo zyada hota hai. But my point is that as a healthy individual, you spoke about a good lifestyle. I had a great lifestyle even before I got cancer. I was healthy. I was always exercising, giving time to my health. I was particular about my diet and everything. I had healthy pregnancies. I breastfed both my babies. And still I got it. I got it. Yeah. So if it recurs, it recurs. I just want to put it out there that fear should not be like a dangling sword, that what if? Because even the first time, what if? I mean, I'm a huge believer of faith, and I feel faith is something which should be so strong that when we leave our house in the mornings, sitting in a car, heading towards a destination, the fear of meeting with an accident never even occurs to us. That's what faith is. So there's no point in manifesting that by just being fearful about it. Hoga to hoga, dekhenge. And medically, we've made so much advancements today. I was very, very happy with the whole treatment that I went through. Doctors were so supportive. Medications were so good. They just scared me a little bit in the beginning. Ye side effect, wo side effect. But thankfully, everything was great.
Oh my goodness, such moving words. And, you know, doctor, when you hear a breast cancer survivor say that breast cancer is possibly the best thing that ever happened to me, to what extent does that move you as a medical professional?
Yeah, so this has been the journey. I think as an oncologist, our biggest friends are our survivors, our yodhas. So I'm really happy, and I'm the more of it that Chavi being such a big influencer on the society, she's bringing out these topics. It matters a lot to us, and I think she deserves an ovation, a standing ovation for that.
Standing ovation. Let's have it, ladies and gentlemen. Let's have it. I think it's deeply deserved.
Thank you.
This is a story of truth, of survival, of strength, of resilience. Let's happen to one of our very own. All right.
Thank you so much. You can say this was just a test to know if you haven't gone off to sleep. Glad you're awake.
Don't open the secrets.
All right. And then I think by way of closing comments, and I'll pose my question to the both of my panelists here. All right. I think, you know, oftentimes there is a delay in prognosis. Okay, or detection. Like you said, you discovered your diagnosis by chance. But oftentimes, even in the wake of symptoms, there is a hesitance. Concerns loom on one's mind, such as being a financial burden on one's family. All right? Fearing the diagnosis in the first place. Not knowing the best course of action. Thinking one has to die one day anyhow. If you start to get in that zone of where your thoughts are doomed, or it's a very daunting time, what might you say to that person, both as a fellow survivor and as a medical professional?
Doctor, you first.
Okay. So I think two things. All cancers are not same. Everyone, each body, each cancer is different. So we are not supposed to get scared and not take too much of influence from other people who have gone through it. And yes, the science has progressed so much that yes, you will win over this. So you will become a cancer warrior, you will become a cancer yodha. So don't worry, go to your doctor.
All right. And to the yodha over here.
So yeah, no two cancers are the same. In fact, I just want to talk about a little experience that I had when I came out with my cancer diagnosis. I was bombarded with a lot of messages from fellow patients and people who were fighting and survivors. And I read some really Horror stories, yeah. I mean, I was very, very touched reading those. But after a point, I stopped reading because I didn't want to have that fear in my own mind and I didn't want to manifest it. And I decided that my journey is going to be my own journey and I'm going to make my journey. I'm not going to let my journey depend on somebody else's. And I think that positivity and that faith is what helped me a lot. And having said that, don't underestimate the importance of regular checkups because वो बोलते हैं ना कि have faith in God but lock your doors. It's just like that. Have faith in God but don't forget your regular checkups.
All right. With that, I think that makes for a wonderful note upon which to close. Dr. Gupta, Chavi Mittal, huge round of applause for both of our panelists.
Thank you so much.
All right, and can we please have Pooja Sethi on stage to felicitate both of our panelists? All right, thank you so much for sharing that. Thank you, Chavi, that was wonderful. Thank you. Thank you so much. A token of our appreciation for sharing your stories with us, sharing your insights, your wisdom, and adding that very human lens to the conversation. Chavi Mittal 2.0, ladies and gentlemen, our Yodha right here. And to Dr. Sumant Gupta. All right. Thank you. Thank you once again, ladies and gentlemen. That was particularly moving. So now we move into a conversation that's at the very heart of our healthcare agenda. And that's that ensuring that innovation in cancer care is not just about breakthroughs, but also about accessibility for every patient everywhere. So the theme of our next discussion, ladies and gentlemen, is advancing cancer care in India by bridging innovation and accessibility. And to moderate this very vital discussion, it's my pleasure to please invite on stage Kalpana Sharma, Times Network Health and Lifestyle Editor, whom you heard from earlier. Kalpana, welcome back to the stage. Thank you. And joining her on this panel are distinguished voices, really, from diverse spheres of cancer care. So we have Ms. Aanchal Sharma, who's a social entrepreneur and founder of Can Heal, who's working to make integrative cancer care more holistic and more patient-focused. If we could please have Ms. Sharma on stage. Thank you so much. Thank you so much. And Ms. Vaishali Iyer, who's the Country Head of Communication, Engagement and CSR at Novartis in India. And Novartis is, of course, driving initiatives that merge innovation with community impact. And can we also have Dr. Geeta Kadyaprat, who's MSFRCS Glasgow Senior Consultant, Breast Surgical Oncology and Oncoplastic Surgery Lead at Apollo Athena Women's Cancer Center, Apollo Hospitals, Delhi. A pioneer in oncoplastic surgical techniques. Thank you. And Dr. Shyam Agarwal, who's the chairperson of oncology at Sar Ganga Ram Hospital, which is, of course, one of the country's most respected oncology centers. And he's very much dedicated to advancing treatment standards and raising the bar for treatment standards pan-India. With that, all of our panelists have now joined us. And I will hand it over to my very capable colleague, Kalpana.
So much.
Thanks.
And so we just had two very interesting discussions on cancer. And Chavi was here. She was talking about her cancer journey. Cancer, the dreaded word that we all fear. And I would like to start this panel as well with our cancer survivor, who's bringing difference and change in the lives of other cancer survivors and even people who have been diagnosed, which is I will pass on this question to you, what was it like when you got the diagnosis and how did you take charge of your cancer journey?
Thank you, Kalpana, first of all, for giving me this opportunity. And I'm grateful that you asked this question. As Chavi also mentioned that two cancer survivors or cancer patients don't have same journey, right? When I was diagnosed in 2017, it was more than a diagnosis of cancer. It was difficult for me to hide for good 22 days from my family that I was diagnosed with the cancer. because my brother is about to get married, and I don't want to ruin that happiness, which we have waited for a really long time. So I remember I used to go to hospital for PET scan, for biopsy, for every test, it's required. And same day in the night, I have to participate in all the festivals, dancing, celebrating. And then I also cut my hair so that no one would know that I was sick or I was diagnosed with the cancer.
So brave of you.
So this is how I got to know my diagnosis. And after 22 days, when my brother finally got married, I went to the hospital straight, and I had my first surgery, still without knowing my family, where they install a chemo pot under my collarbone. It was a 1.5 hour surgery, and then few hours they keep me under observation. And then after that, I drove back and I break the news to my family, yes, I was diagnosed with the cancer. So it was, those 22 days actually become like a 22 years for me. And I was like, when you are dying inside and still you have to smile, you have to, laugh. And though you don't know that you're going to survive or not, what is going to happen, because I don't have an education on this particular subject. So you know how one can feel. So this is how my diagnosis happened.
And we were talking about, you should also tell the audience about your initiative where you are helping cancer patients. That would be very interesting, because not many of you know, but there was a art therapy session that happened in the morning for cancer patients, and it was so inspiring, led by Aanchal. So please tell us about it.
So yes, that was a beautiful session where, again, thanks to Novartis for giving us this opportunity. That it's called Take Charge. So every survivor and the cancer patient, the beautiful thing is that everyone is not from Delhi or NCR, right? People travel all the way from Saharanpur, from Bareilly, and they're just being a part of that 1 hour workshop. And I run a community called Can Heal Community. So we see a lack in many, not a lack. I think hospital have their own way to tell people or run a support group, because they have to talk about the treatment aspect as well. But in Can Heal, we create a community outside the hospital, where we make them feel you are in home, you feel, you can express your emotions there. And not just this, we are trying to reduce their financial burden also by getting pathology labs and other people on board, which are the products required them throughout the journey and after the journey. And one more thing I can add in this, we talk about, success, right? What is the success, or what is, we are doing for the awareness. But my take is on this. We talk about anything, we have 1,000 of more conventions like this, or the, promotions or anything, but we are missing one point. People who just came out of a cancer, they have been rejected by the job. Some of are not even, they're thrown out of the job if they are already working. So they have to hide their biggest battle first of the thing. The second thing, they're always under the fear more than the cancer or, recurrence or anything, that if I don't have money, I'm not able to take the treatment. So I would request through this platform, I'm sure there are lots of pharma companies and lots of doctors, even the care group, there are lots of people who do this caregiving. If we can give them, because everyone don't come from a very well-off background, if we can give them a small visit charge. I'm sorry, this was not a question, but I thought if we can do that something, for them, where they can financially, little bit of independent, it will make a huge role in their life. Even the companies can create job for them, where they can, people who, see, I'll give you an example. You met the girl today, right? She was a 27-year-old girl, wheelchair bound, and Dr. Geeta also met her before. Don't have any family. And 5th time she was diagnosed with the cancer. In fact, she's dealing with the last stage cancer. Her partner, who's her friend only who's taking care of her, but she don't have financials, right? She's every time scared or have to put something on social media to raise fund for herself. But sadly, we have a problem. We don't come forward to help people till the time we don't see them dying. So she have to put, many people judge them, that, judge her, that, oh, she's doing emotional drama, oh, she's doing this, oh, she's doing that. But get into her shoes. She's scared of dying every moment. You know?
That's a very strong statement, and we'll come back to this stigma discussion. But I would like to throw my next question to you, Dr. Sham. With 4 decades of experience in the field of oncology, and this being the Breast Cancer Awareness Month, and the theme is Spread Awareness, Save Lives, what do you have to say, about the entire situation? How do you see it as an oncologist? Are people aware enough?
So there are several aspects of, cancer management. And I think let's first talk about early diagnosis, since you're talking about awareness. So it's very unfortunate that in a country like ours, people are not going for checkups routinely as perhaps they should be doing. And I was shocked to see the figures from our country that the women undergoing screening mammograms is less than 2%. If you were to look at US, its figure is touching about 80%. UK is touching 70% and Europe is touching 50%. So there's a huge gap between what is available and what people are supposed to do, because the guidelines do suggest that after the age of 40 to 45 years, women should undergo, a mammogram at least once in 2 years. However, the government of India says that women should go to their primary healthcare workers, because you don't have the mammography machines available in small towns or, villages. So they should go to their primary health worker for a clinical breast examination once in 2 years after the age of, 40 years. So even that perhaps is not being done. So the third thing which one can do is breast self-examination. So which should be done by women after the age of 30, 40 years, every month when at the time of perhaps menstruation and so on. So, awareness is there, but there is no implementation of the recommendations from the government or from ICMR. So that's the reason why the tumors in the breast are diagnosed as cancers at late stages. The incidence of early breast cancer detection in our country is less than 30%. Majority of the women will come to us with, advanced stages of breast cancer because of so many factors. And one factor, of course, is a lack of equipment, lack of awareness, and then, of course, literacy and poverty and so on. So therefore, there is a huge gap between detecting a tumor early, because I think, as we all know, if you pick up the breast cancer at an early stage, the cure rates would be exceeding 90%. Whereas if you detect it at the 4th stage, then cures are just not possible. So there's a lot of work to be done at each level, whether it is a government hospital, whether it is a private hospital, whether it is an NGO or as a society. So we need to encourage women to come forward to have these facilities or this awareness about breast self-examination, clinical breast examination, and screening mammograms. So I think there's a lot of work to be done, and a platform like this from Times Work can help promote this awareness that people should come around and promote early detection of breast cancer.
That's interesting. Dr. Geeta, I would like to ask you my next question, because when it comes to breast cancer, I mean, you would have seen so many patients, Aanchal was talking about the stigma. What is it that you notice, you've observed that, why is it that women don't come forward? And I mean, I've heard so many cases that they know that, those lumps in the breasts are not normal, yet they won't go for a checkup. Why do you think there is so much stigma around this?
So more than the stigma, I think it is a huge sense of denial. And, it has got nothing to do with your level of education or literacy. I've seen such horrible advanced cancers in women who are IAS officers. And you keep wondering, aren't you see your breast kind of dissolve into nothing and you come with ulcerated breast, leaking blood and pus, and you're still not kind of ready to accept that it is cancer. So denial is a huge issue that we see. Then there is the stigma, and there is this, the patriarchal nature of our society also, where women don't get a chance to express themselves. They know that they are the the only pillar around which the whole, the whole household works. And if she is away for reasons like a lump which is painless, it's growing all right, but it is not causing her any discomfort, she continues to do what she does. And if I were to say that if the educated ones also on a priority list, if you were to ask me also, if you ask me, I would say that when my last mammogram was, say, about 8 years ago, which is such a shame considering that I am a breast surgeon, but that's the way we are because
Headline.
Likewise?
I'm saying headline.
So, that is how we are wired. And I think it is no great credit to us if we try to behave like superwomen every single day and we think it is a great service to the society. But what we realize is at the end of it, it is about you. And you've lost the plot by the time it comes to you. Because I say that in a priority list of 1 to 10, if I were to say number one priority, my child, number 2 priority, my mother-in-law, then my husband, and then my work, then my colleagues, this, that, and the other, and I am 10th on the priority list. By the time I get to priority number 10, it is 11 in the night. And I just couldn't be bothered about what happens to priority. So that priority number 10 stays number 10. So I understand the stigma. So just coming back to what you were saying. So this is the way things are. It has not got anything to do about your level of education. The stigma is there, but I see a lot of empowered women, and not just people on the forefront. I see a lot of people coming from lesser backgrounds also trying to be very vocal about their situation, trying to tell people, what they're dealing with. But it is also about the society. The society doesn't engage in that discussion. They are just curious. They just want, you are a piece of news to them. So I keep telling my patients, don't divulge this information to a lot of people because they are counterproductive. Because we want you to be in a good, positive space. And most of these curious bystanders would be relating stories of how people didn't make it. I said, talk of those people who are by you, who really care for you and going to tell you stories about.
Also talk about all the things that you can do. Ayurveda, homeopathy,
Yes.
it can cure cancer.
So we deal with it all the time, and I can assure you it is not a great space to be in. And the thing is, because of the kind of social media exposure we have, everyone is an expert. And it is the behavior of the human mind to accept what I want to hear. So if somebody says standing on the podium that, doing a biopsy is going to cause the cancer to spread, you do a mammogram, the cancer will spread, not realizing the kind of harm that they're doing. So I am seeing a lot of patients who come with an MRI, who come with a PET CT, but they've not got a mammogram and a biopsy done.
Because we have been told by the society.
Yeah, so this is this person who sounds very convincing and talks with a lot of conviction that that's the wrong thing to do, not realizing what kind of
And a
harm.
lot of followers.
Huge number of followers. So that is what I say. Social media is great so long as you are a responsible person on the media, because what I say on media has to be done with a sense of responsibility. I should not be sharing wrong information with people who go to the social media. So it's a lot of things.
I'll come to you,
can I-
Vishal. Yes. Yes, please.
So every day we see patients who don't want a biopsy to be done. The myth is, if you touch the tumor, if you put in a needle, it will spread. So it's actually a huge, huge myth. Barring 1 or 2 cancers, you have to have a tissue diagnosis to declare that this patient has cancer. So I think this is an important platform, important message which should go from here, that biopsy is mandatory to diagnose cancer. No PET CT scan, no MRI, no mammography can diagnose or confirm the diagnosis.
I hope we are able to address this through this platform. And Vaishali, I'll come to you next. As the head of patient advocacy at Novartis, you obviously deal with a lot of patients. And you know, what do you see as the biggest challenge and how do you really support them?
So one of the principal philosophies at Novartis is that nothing for the patient without the patient. And I think that's something that we stick to very, very sincerely. So even this campaign, for example, the Take Charge is developed and co-created with the patients. So we've spoken to multiple patients, cross-section of the country, to really figure out what is that one actionable insight that is going to bring about a movement. Because it is not about just going and telling people, right, that you got to do something. It has to come through the language that they talk about. So most often, you know, as being pharmaceutical companies, scientific in nature, we tend to use terminologies that the medical fraternity uses because we're so used to only working with the doctors. Just switch the cell and then just say that what is the conversation that the patient is actually having? What are the real fears of the patients? And I think we've heard enough that it is about the patient and the caregiver, the entire ecosystem that supports the patient, and what is that vocabulary? And that's when the patient is going to resonate with what we are trying to say. And Take Charge is one of those campaigns which we've said that, you know, we will create with the patients so that people resonate. And what was really beautiful this morning was every single patient or a caregiver out over there did resonate with that two words, you know, saying take charge. And it was just so beautiful to see how that insight has come into action and people were motivated to go out and make a difference. So I think that's the big difference. You've got to start and live the life of the patient and start thinking from their angle.
And that is where I think Aanchal comes in.
Yes,
and
very much.
Yes. So how do you feel, Aanchal, you can reach out to more people and, you know, who are seeking help, because cancer somehow tends to be a very lonely journey about the patient and the caregiver. How do you feel, you know, because there are forums, there are communities, but a lot of people tend to go in a shell, they don't want to talk about it, and they suffer in silence. So how do you feel we can bring about that change and help them take charge of their health and journey?
So Kalpana, in Can Hill community, we are majorly focusing on that. We have many cancer patients and survivors. I'll give you a real story here. There is a lady called Priyanka. She's from Gurgaon, and she said, Aanchal, post-cancer treatment, it's been 5 years. You know, I feel like I'm not alive anymore. I don't know things about me. I don't know what I like. I don't know what I don't like, right? It took me, so when I got to know this, it took me 1 year to convince her, please come. If you don't like that meetup of Can Heal, you can go back. You know, just come for 10 minutes. And she again she is trying to escape. Oh, Aanchal, I'm down with the fever and all of that thing. But that one push from our side actually convinced her. She came and she's now regular with all our meetups, you know.
Lovely.
Next day she called me. There was a rain. She said, Aanchal, you know what happened? I went to my roof. I take a shower in rain and feel alive again. So that is what we are trying to do. So small gaps where they feel, you know, like I always say, you know, we always address the numbers and the percentage of the survival and all of them, and then, you know, other information. But sometime being a survivor or a cancer patient, I don't want to go there and I don't want to listen that thing again and again. Maybe that's the positive part, and that is very important for us to know about, you know, new things, what is good for us, what all precaution we have to take, what all medicines are good for us. But still they said, I have gone through so much of pain, you know, now I need a place where I can spend some happy moments. So what we do, we call them every month. We just, do workshops like a art workshop, bike rallies. We do other workshop, dance workshop, something where they have fun and nobody is talking or addressing cancer. And we just tell them, come, have fun and go back.
That's so
Just
nice.
to add to what she said, and this morning when I was sitting through this meeting, what really came out was, are we reframing the conversations around cancer? Yeah. So one of the pieces that stuck to me was, we were just addressing everybody as cancer survivor, and they're saying, no, we're not cancer survivors. We are people who fought cancer and won, and we want to live a beautiful life. So the whole take charge comes from the fact that nobody wants to be labeled as a survivor, which is a level down, but as a person who's like living life fully.
That's very interesting.
And that is also coming from a person who's dealing with the last stage cancer.
I think I'll rephrase everything and I'll keep this in mind. Do not address someone as cancer survivor, but actually they are fighters and they are emerging so strong, way stronger than all of us. Dr. Sham, again, changing the narrative a bit. Yeah. We know cancer cases are growing. We know the age bracket that we would originally assume that, this is the age bracket that gets cancer, the age is coming down and all of that. But in your practice, have you seen, what kind of a role, it's a non-medicine question maybe, but what kind of a role does faith play in treatment?
Say that again?
Faith.
Right. Right. So I think it's very, very important. So we see patients day in and day out, and we regularly make this statement to our juniors, to our colleagues, and even to our patients. And that statement is that if a patient has full faith in the system and in the team of doctors who is treating, he or she, here it's most likely she in breast cancer, but then we treat all sorts of cancers. So they will get the best out of the team, and the best result only comes in if you have faith in your treating team and the doctors who are involved in their care. So there are patients, today social media, Google, etc., all is there. But then this is such a disease, when anybody gets it, and today's treatment has become so very expensive. When they come to us, we tell them, you're going to take this medicine, which is going to cost this much thousands and maybe 100,000 of rupees. So it's quite natural and normal to go and cross-check that the doctor is, giving you the correct advice. So we don't sort of challenge that, and we don't blame them. But ultimately, I think you have to have full faith in the system where you are getting the treatment from, and the team of doctors to get the best result for yourself and, of course, for your family. So I think faith is very, very critical.
That's very interesting because, you would expect a doctor to just keep on telling you that, this is the treatment course and you will go through it. But, that sort of, to have faith in your treatment, obviously, like you said, it can work magic. Dr. Geeta, I would like to ask you, I heard somewhere that they say, a young, I'll exactly quote it, that early stage, breast cancer in early stages is a good cancer. I didn't want to get it wrong. How do you explain this statement?
So, I get when I see patients, so there's a diagnosis and you see that it is a hormone-sensitive tumor, it is HER2 negative. And I'll say कि आपके tumor का character अच्छा है. So, they will kind of wonder, what is this? आप क्या बोल रहे हो? Cancer तो cancer होता है, इसमें character कैसे अच्छा होता है? तो होता है ऐसा. So, it is not one disease. So, about 20 years ago, you would treat every breast cancer the same way. Things have changed so much. So much, and it is changing as we speak, because I do realize for a fact that in another 10 years, every single patient on a daycare bed would be having a completely different treatment for the same disease. If you're talking breast cancer, every bed would be having a different kind of individualized, personalized, precise treatment. So that is where we are. So, we see a lot of new molecules coming in every day, and I'm sure Novartis is also on the forefront of having developed these molecules and are in the process of developing more molecules. Of course, they're exorbitantly expensive. In a lot of molecules are very expensive, but the narrative is changing around breast cancer. So if you call an early breast cancer, which is hormone sensitive, which is small, you can call it a good cancer to have.
Something that can be treated.
Yes, and the other thing that, because it is, you're there. So when I talk about advocacy, I think what is wrong with our advocacy is, so Anchal is an advocate, and you are also doing your piece. I'm doing my piece. I've got a foundation. I'm sure Dr. Sham is also. The trouble is we are doing the same things in different pieces, but we are not collaborating. So if Novartis actually means to kind of get our voices amplified, to be heard in the corridors of power, and to your question about how mammograms can be done, because it's not going to happen. It's not happening. I can tell you that mammograms as a screening protocol is not going to happen in our country. At least I don't see it happening for the next 50 years. But having said that, this collaboration, you have to get all these foundations who are doing bits and pieces together on the same table, get them to understand what we're trying to address, and if you do not repeat the same thing and do different things, I think the impact is going to be much bigger, and your voices will certainly be heard where it needs to be heard.
Absolutely. You're making a very, very important point, and it's eventually when all the entire force comes together is where the momentum will happen. I mean, I fully agree with you on this.
Dr. Sham, you want to add something?
No, I think we all need to sort of get together. And as I said in the beginning, we really need to have awareness programs. And to, as Dr. Geeta said, there's so much happening in the field of breast cancer. It is mind-boggling. When we started doing the treatment for breast cancer, we were talking about removing the breast. So now it's not happening, to that extent. Now people are talking about breast-conserving surgery. So which has become a major common theme, and actually women want it. So that is one change, which has happened, which we must convey, that even if you have breast cancer, it's not your breast is going to be removed all the time. So you can just have a portion of it removed, and the results are going to be the same. So the other paradigm shift which we need to tell women and people are that even with a tumor which is 2 centimeter, Dr. Geeta would have liked to operate all those tumors, maybe 10 years ago. We want to operate, but then the role of chemotherapy and the role of targeted therapy has come up in such a big way that unless you do the biopsy, characterize the tumor, you should not be doing that, because a 2 centimeter tumor should not be operated today, should be given chemotherapy and then operated after 4 or 5 months. So there is a sea change happening, as Dr. Geeta said, in the evolution of treatment for cancers. So today we are talking of next generation sequencing, because the tumors are governed by genetic aberrations. They are not inherited. 95% of the times women acquire those changes in their breast cell genes which result into cancer. Now we have the ability to pick up those genetic aberrations and target them, not only from the tissue but also from the peripheral blood, because the tumors are shedding those abnormal DNA mutations in the blood. You just do a blood test, and within 15 days you get to know this is the target, and you can target. You're not talking of chemo, you're talking of targeted medicines. There's so much happening in this area, and in the next 5-10 years, as Dr. Geeta said, so we are going to do these liquid biopsies or looking at the gene aberrations in the blood, because the tumor is shedding the DNA mutations in the blood, and you will, have personalized precision therapy for each individual. So I think we need to really spread these words, not only for breast cancer, it's going to happen in every cancer.
That's very interesting, and keeping the time in mind, I would like all of you to give me one message for women suffering from breast cancer. What is that one message you'd like to give them?
So I have, again, because these are the platform we don't get very often, so I do want to take the opportunity here. So one message is not for every cancer patient or a survivor. Here I want to give for a society. please think what I said before. Please try to create some opportunities for these female who don't have a family, who are single mothers, or who are still need support financially and medically. If you can create a small, jobs for them, it can be really a very big help. And everyone we can help at least, in their basic survivals.
Would anyone else want to?
Yeah, I think it's about just, I would say one thing, trust your doctor. The doctor is the best person to take decisions for you. And I think that's the most critical piece, in addition to asking the right questions and getting all the information, but no substitute to the doctor.
So I would say that, we keep talking awareness and all that, but what I want to say is that women should, great idea to take charge of your life, and please exercise your power of choice. Nobody should be making the choice for yourself, because I see a lot of patients, small 1 centimeter tumor, amenable to conservation, has a mastectomy done because her husband, her son, her neighbor all wanted to be a mastectomy. So I think, and the woman doesn't want it, but she doesn't exercise the power of choice, because I think that is the way it is for her. But I would encourage each one of you, if you know anybody who has a problem like this, that she should exercise her power of choice.
Yeah, I think breast cancer, if detected early, is curable. It can be eradicated, and person can lead a normal life and should be positive, number one. If somebody is detected in advanced stage, people are living for years together, decades, so there's nothing to fear. It's become a chronic disease like diabetes, hypertension, and heart disease. So it's not that everything is over if you have a diagnosis of cancer. You still have a lot of life, and it all depends on Achal, Vaishali, and all of us to make their life more fruitful and active. Thank you.
Just another thing, and that is, please try and normalize breast cancer.
Yes.
Don't make a hula baloo around it and make the person think that,
Yeah, because I'm living more than happy life than anyone else maybe been through a cancer.
And you are shining the most today. Can't call it tonight yet. Thank you so much for joining us. Thank you.
A huge round of applause once more. And can we have Pooja Sethi back on stage to please felicitate each of our panelists, the token of our appreciation. Thank you for sharing such a rich range of insights from your personal and professional anecdotes alike. Let's have you please remain on stage with us. And Kalpana, if you could kindly do the honors and present each of our panelists with a token. Such powerful, real human stories, ladies and gentlemen. Yes, keep the applause coming. The tales of bravery and emotion. All right. Thank you once again, Ms. Sharma, Ms. Iyer, Dr. Geeta, and Dr. Sham. Adding a lot of weight to the conversation, advancing cancer care in India by bridging innovation and accessibility. So, ladies and gentlemen, we're now going to shift our focus to a subject that is transforming healthcare at a rapid pace, and one that has the power of revolutionizing diagnosis, treatments, and patient outcomes pan-India. So the theme for our next panel is artificial intelligence and data-driven care, which is the new backbone of Indian healthcare. And this discussion will very closely examine and explore how artificial intelligence, data analytics, and digital tools are unlocking new opportunities to make healthcare more precise, more personalized, and more accessible. And to moderate this discussion, if I could please invite my colleague, news anchor and principal correspondent with the Times Network, Ashish Parikh, back on stage to guide us through what promises to be a riveting discussion. And joining him in this panel are some of the most dynamic voices that are shaping the future of artificial intelligence in healthcare. Those are Mr. Arvind Pachapur, who's the Chief Commercial Officer, CDX, Strand Life Sciences, who brings expertise in leveraging genomics and artificial intelligence for advanced diagnostics. Pleasure to have you with us, sir. And Dr. Abel George, CEO of Apollo Adlux Hospital. There's a strong focus on integrating technology to improve hospital efficiency and patient care. Thank you, Dr. George, for joining us. And we also have Mr. Deepak Sani, who's the founder of Healthians, a pioneer in health tech innovation and preventative diagnosis. Mr. Sani, it's a pleasure to have you with us as well. With that, I will hand it over. So, Mr. Arvind, Mr. Abel, Dr. Vijay, and Mr. Deepak, over to you. And Ashish, take it away.
What a powerful lineup I have right now with me, and it's fascinating for me to talk about AI today because almost every sphere that we talk about in India or across the world, artificial intelligence comes into the picture as well. And interestingly, healthcare has become that sector where AI is increasingly becoming very, very important. I'm sure a lot of you have seen viral videos. You've seen a lot of clips of patients uploading their test results, their x-rays, and ChatGPT essentially helps them understand what exactly the issue is. But a lot of people go as far as saying that that is going to replace doctors, but that's a little too far-fetched. Having said that, we still need to understand the consequences and also the advantages that AI is now bringing in. Also understanding whether it is just a fad or will it now become a tool that will help in cost cutting and also help doctors be more efficient. It's a wonderful panel I'm having here. Arvind, I'll start with you in terms of AI here because let's be real, a lot of people talk about AI, the applications of AI. As a person in the field, what are you looking at on ground? Is there a particular disease or a particular sort of an ailment that you think AI has been able to crack? Wherein doctors, beyond all of these fancy equipments, are using AI realistically to ensure that there is a proper diagnosis and also there's not just time saving but also revenue as well.
Sure. Over the talk today, I will probably cover two areas. One more kind of broad applications of AI, and then we'll talk about something specific, hopefully later on. But I mean, nowadays you can't even do 9th grade math homework without AI. So AI is everywhere, and so it is. So we come from we heard a lot from Dr. Shyam Agarwal and others on the prevalence of next generation sequencing and personalized medicine for cancer and for various other disorders. So my company, we come from that niche in the healthcare segment. And one of the common areas where we see it actually being used in lakhs and lakhs of cases across the country is use of molecular tests in prenatal situations to understand if the fetus is carrying some chromosomal defects, and also with babies who are born with disorders to really understand if there are any genetic causes underlying. The first one is about 1% of all pregnancies, and the second is about 2% of all deliveries. So big numbers in a country where we have millions of babies being born. And when you do such tests and you want to understand the underlying causes, there's a lot of analysis that goes into it. One looks at the physical characteristics, and then one looks at the genetic footprint, and one tries to drive correlations. To do that properly actually will take lots of hours to do. So increasingly, most leading providers are using AI to do what they call the GP correlations, or the genotype-phenotype correlations, trying to understand. We have about 20,000 genes in our body. So to take it from 20,000 to about 300, a few thousands or a few hundreds is done using some commonly known parameters. But to go beyond that, one uses these AI techniques to really fine-tune and take out countless hours from the mix and make it more affordable, more accessible, and truly, when these things become truly affordable and accessible is when 100% of pregnancies will be using these tests, as against probably a few percentage grade.
Absolutely. You're talking about affordable, you're talking about accessible. There's one more AI I want you to add there, which is to ensure that it is accurate as well. Now, I'm sure a lot of people are sitting here in the audience as well. You've all tried to look up on Google, anywhere online, or ChatGPT. Every time you had a migraine, a headache, or any sort of an issue, you look it up, and I think it's more often than not, it tells you you have brain tumor. I mean, that's how reliable it is in today's time. But Dr. George, I need to ask you, Apollo has, of course, started using AI to predict heart diseases and COPD as well. But again, if AI gets it wrong, if the diagnosis is wrong and AI is at the center of it, who's going to take responsibility? Will it be the AI company? Will you, if the patient comes to you, will you say, well, go ask OpenAI, I have nothing to do? Will you blame the doctor or will you blame the hospital? Who's going to take responsibility?
Yeah, so I would say that the responsibility is a shared responsibility. So there are three stakeholders in it, right? So one is the program or the algorithm developer, the second is the hospital, and the third is the clinician himself, right? So as far as the responsibility of the algorithm developer is concerned, they have to ensure that it sticks to specific guidelines. Now, for example, you're developing an algorithm for something, say, like predicting an ECG, right? So it has to ensure that it sticks to the AHA guidelines. Now, as far as the hospital is concerned, in terms of integration, in terms of development, in terms of deployment, the hospital has the liability to ensure that it again sticks to regulatory guidelines. It sticks to certain frameworks, like, for example, the HIPAA guidelines, the FDA approvals. But end of the day, it is the clinician who is the most important stakeholder, because it is the clinician who uses the AI to kind of enable him to better his decisions. So the primary responsibility of using AI wisely always lies with the clinician. So a clinician should not be using an AI as a replacement, but rather he should be using it as an enabler. And that's where the most important point is that, like as you were saying, we kind of tend to upload our reports on ChatGPT and see that suddenly we have a brain tumor. But then just imagine if the clinician was doing the same thing, right? So the onus of the liability or the onus of responsibility of a patient lies with the clinician. So as far as the responsibility, as far as the legal liability is concerned, a very lot lies on the clinician.
Absolutely. And I think any AI model is only as good as the data is. And speaking of data, I have the right man here to speak about data and, of course, the details of that as well. Help us understand how exactly can data, you collect data from across the nation, you look at all of these numbers that are coming in as well. Help us understand the trends that we're looking at across the nation, and also how this data can tailor results and also the accuracy in terms of the India use case. For example, one of the things that you look at when it comes to a lot of AI models is that the results usually are tailored for its US customers. Unless there's a large number of Indian users, you won't see results that are customized, that are tailored for Indian users. Yeah. In terms of healthcare, how is that working out?
Sure. Yeah, first of all, thanks for having me here. So when you look at, first we have to understand what kind of a data we look at. So we look at data from a point of view of city, geography, demographics. Then we look at data from a point of view of the biomarkers, which is the clinical data. Now, when you look at data individually, which usually people used to look at, then this doesn't make any sense. It starts to make sense when you look at the trends, right? So we started collecting data over the last 10 years. Now we have data of the same patient who has grown with us for the last 10 years. And which helps to look at that if this person has a disease in the 7th year, 8th year, 9th year, what has happened 6 years back, right? And 6 years back, the report was absolutely normal. But we could still find out that the same pattern is running into someone else's patients, another patient. And then we can recognize that the same trend and same things have been followed up, which means you can actually do a lot of predictive analytics is the first use case that comes in there. Then added to that, you also see the data along with all the combinations. So we now have a wearable data. We now have coming from rings and everything else. We have data which is genomics data, right? And then we have data about his active lifestyle and health. And then we also collect a lot of lifestyle data in between, asking the questions to a person stating that, is he a smoker, drinker, what does he do, stress lifestyle and everything else. Today, you can also analyze a lot of stress level in the person from all that we wear. Then we have sleep data, right? Now, when we combine all of this, then the sort of a trend that we are seeing is very, very different. And we're seeing the disease pattern in India is also changing, right? So if, for a small example, if I have to ask anybody, which city do you think is the diabetic capital of India, right? Any guess you guys have? Any guess?
Let's ask
He's saying
the experts
Kolkata.
here.
He's saying Kolkata.
Arvind should go first.
Kochi. Any guess you want to give?
Bengaluru?
It's Hyderabad.
I was close.
So, and nobody would imagine, because if you sit in North and you talk about North, people will say the lifestyle, everything else is like so bad, or probably people at Gujarat eat so much meetha, and probably Kolkata. But the real data says that it is actually Hyderabad. Now, when we went into the deep of it, we started realizing why it is Hyderabad, right? And we spoke to the doctors, somebody said weather, somebody said genetics, somebody said anything. And all in all, we could not find an answer for a year. And we kept on searching in what is the reason is. And finally, the reason came out to be that in the world, the third highest consumption of soft drink per liter per person is actually Hyderabad. It's the highest in India. And the reason for that is the spicy food and the weather. And that converts that into a sort of a soft drink. So when you start linking in, you know where to go and stop the root cause, right? So that's the power of the data. When the government sees it in whole, they realizes that it is if you really look at base, if you ask me today in the 10 years of experience, actually the problem is that we don't educate health in schools, right? And it starts from there. So if you tell a person or a person in nursery or a KG that 20 minutes or 30 minutes of exercise is important in your life from that age, then you see a lot of lifestyle diseases will not happen. So all of this data is actually signaling towards the central point, which is basically the habits that we have adopted, and that's why the lifestyle disease takes over everything else.
Absolutely. Dr. George, you just heard him speak about the kind of data he's collecting and the results that he's been able to deduce. As a doctor yourself, when you look at such data, now data, there's a lot of data, but the problem is how we interpret data, what kind of data we have at our hands when we need it. You have a patient who needs data about diabetes, but you aren't able to access it. That's a real concern. As a doctor, with all of this data, with AI catering it to you for your particular patient, how easy is it going to make your life? And also, do you think the treatment will get better, or do you think it will only get expensive?
So as I said before, AI is an enabler. Now, for example, take the simple, example of diabetes that we said, right? Now you take a demographic like, I come from Kerala, from Cochin. Now, if I have maybe 40-50% of my patients coming from Cochin, and we take the history and we take, for example, we have a system repository of the diabetes or the pattern or the predisposing factors of diabetes that is there, and then we also have the treatment patterns that are there. So now when a patient comes, when a new patient comes, so there is already a repository of data that is being analyzed, and that kind of enables a clinician to get his treatment, to give a better treatment. Like, for example, say that a patient is given a set of glycemic drugs to control his diabetes. Now, if there is a system-generated event such which says that now, considering the previous events of patients, the type of patients that have come to you, the system kind of says that this drug might be better in a particular subset of patients. That is actually an enabler. So what AI eventually does is it kind of reduces the economic burden on a patient, in the sense that like for example, you start a specific treatment, then you understand that it really does not work out, and then the patient comes again, you change the medicine. So then it is a cascading effect wherein the patient ends up paying out of his pocket more and more. And it is not just with medicine, because with every visit to the hospital. It is not just the prescription that is there. The patient undergoes investigations again to find out the root cause. But then if you have like a system wherein, the system kind of suggests to the doctor, right? But then at the end of the day, again, it is the clinician's call whether to, take it or not based on scientific evidences and based on the legal formalities that are there to kind of making him enabled to give a better lifestyle to the patient. Definitely, yes, AI would help in that regard.
Absolutely. In fact, the Indian healthcare ecosystem is filled with examples of pilots, very, very exciting pilot projects that actually never take off. Do you think AI and the ChatGPT and all of these models, do you think these have the ability of scaling in a way that it's not just used as a fancy feature in your top-end hospitals, but also something that can be utilized in remote areas that actually change the way healthcare is provided, even to the marginalized community in India? I mean, that's for you.
So I have quite an exciting example of something we are working on, where AI has really made something possible which would not have been possible. And I'm talking about early detection of cancer. And so, as was referred in the previous panel, our cancer tumors also shed DNA in our blood. So one can analyze a blood sample to get to know a lot about the cancer as one can, or almost as much as one can from actually analyzing the tumor. So, but by the way, first thing, right, with AI, great power comes great responsibility. AI is made up of multiple factors that come together in complex ways that can't be explained or understood very well, as against traditional methods where it's few factors which are very well understood. So whatever one develops with AI has to be followed with a lot of validation and confirmation and actually real life checks. So with that in mind, so what in the field of cancer, what's happening now is people are studying signatures from millions of regions across your genes to see if there are patterns that correlate well with cancer patients. And these patterns are noticeable and detectable at a much earlier stage of a cancer than the other traditional methods would otherwise, because then you would have to wait for the tissue to manifest, then you would take a tissue, then you would do put it under a microscope or do next generation sequencing and things of that nature. So now when you have these multiple signatures and across thousands of patients, you need AI, and this is what we have done. We've trained it on Indian patients. So it's now something that's something that can be taken to nooks and crannies of the country and can truly be a tool in detecting cancer early. Of course, it has to be affordable. Back to the first thing, and it's currently not affordable, but the idea is to leverage technology more and get scale so that we can make it affordable. And in such cases, right, the other thing to take into mind is, the typical pushback is, hey, are you using Western foundational models, and is it applicable to India, and is it relevant to our Indian population? And in that, so anything you do in medicine, right, has common biological factors that affect human beings regardless of race and regardless of where they are in the world. And these are kind of these pervasive patterns. And then you have population-specific patterns that layer on top of that. So any model that is built on the pervasive patterns take you to quite a good extent. And then when you fine-tune it further with local patterns, it makes it that much more better, which is what is done. And so we're doing that now, and we're working with lots of hospitals to actually test it in real world and to get get validation that way, and hope to take it to every primary care facility in the country. Let's say it will take a good 15 years.
Absolutely. I think the real validation is when the patients can afford it, and second, they trust it. Yeah. To all our panel of experts here, I think we are almost done with the session here. A quick rating when it comes to AI and data in India right now. On a scale of 0 to 100, how close do you think AI is to real world usage? 0 to 100. Starting with Deepak.
Sure. So you're asking how accurate it is, or
how accurate, how affordable, how close is it to being an assistant to a doctor?
Oh, okay. So I think it's quite far away. So I would say probably 2030 right now because it's a long journey. So it's a learning
Is that
experience.
an optimistic estimate?
Yeah, it's an optimistic estimate in terms of because it is long way. We didn't had a digitized data. India has just got digital data from last few years or last decade, right? You need years and years of data to actually train an AI and say it is there, right? But we are progressing very fast. Before COVID, I was expecting this to be a 10-year journey from what we have immediately seen happening in the last 2 years in AI. So it's going very, very fast.
Right. So Deepak says 30 to 40. Arvind?
I would, both these folks are experts, and so I would say probably quite a high double digit when it comes to things like interpreting images and very specific things with codified structured data is available, and probably much lower, probably single digits for most of the other things where we do need a lot of data and a lot of longitudinal observations.
And Dr. George, you're the doctor here, you're the one who's supposedly at the risk of losing his job because of an AI, as per some conspiracy theories. So what's your estimate?
Yeah, same here. I think we are a long way. We still have a long way to go. I would say maybe on a scale of maybe from 0 to 100, I would say overall 15. So if you break up 15 now, for example, certain diagnostics now, for example, there are certain institutions or certain organizations where they use AI to kind of predict lung cancers and things like that, where, things are progressing fast. But then on an overall scale, because India is a very complex country with the world's largest democracy, so the magnitude that we are dealing with is humongous. So if you think about it on a broader scale, definitely yes, we have a long way to go. So I would overall rate it at maybe around 15.
Absolutely. So the ratings here are low, but one of the things I think we all agree on is that AI and data-driven technology has the scope of being the backbone of Indian healthcare, given the fact that it meets 3 requirements: accuracy, ability, and accessibility. It's an absolute pleasure speaking to Dr. George, Arvind, and Deepak. A big round of applause, and thank you, everyone.
And Ashish, I ask that you remain on stage, please, to felicitate each of our panelists. Can we please present each of our panelists a token of appreciation as our thanks, as our way of saying thank you for being here at the Times Network India Health Summit and Awards 2025. Yes. These are our AI pioneers, ladies and gentlemen. They are truly setting new benchmarks for AI and data-driven care. All right, thank you once again. Thank you once again, gentlemen, for doing the honors. All right. So, ladies and gentlemen, with that, we are now going to turn our attention to the next set of awards. Ladies and gentlemen, and a highly coveted range of categories. If I could please have Pooja Sethi on stage to join us in helping do the honors as we present the next set of awards. Pooja Sethi, once again, is the managing editor of Times Network Digital. And we have extremely coveted categories and some winners that have come out on top that we need to salute, that we need to celebrate and recognize for their efforts, their groundbreaking work, and their contributions to the field. So, ladies and gentlemen, we hope you are ready as we are going to soon very much unveil the winners. And they are raising the bar for standards for Indian healthcare, setting new benchmarks for our global counterparts to follow, and with their care, their compassion, and their clinical expertise, they are absolutely redefining healthcare in this country as we know it. So that, of course, calls for a celebration. And that's what the Indian Health Summit 2025 is all about. Recognizing trailblazers, and that means all of you in this very room. All right, so we'll start with our first category, and that is New Generation Medical Institution of the Year. And it goes to Shri Lalitam Bingai Medical College and Hospital. Can we please have the team on stage? kindly do accept the honor for New Generation Medical Institution of the Year, Sri Lalitambangai Medical College and Hospital. And now we move on to our next category, which is, ladies and gentlemen, Distinguished Contribution to Healthcare and Medical Training. And this award goes to ACS Medical College and Hospital. If you could please have them here, have the team on stage from ACS accept this incredible honor, this special moment. Thank you so much. Our congratulations once again, sir. Okay, can we please have Mayank Shrivastava on stage to kindly join us in presenting? IPS Officer Mayank Shrivastava, I think you're amongst us in the audience. If you could kindly do join us on stage in helping present the next category of awards, please, sir. We'd be deeply obliged. All right. And with that, we move on to our next category, which is Excellence in Gynecology and Laparoscopy Surgery. And the award goes to Dr. Rajashri Taishete Basale. Can we please have Dr. Rajashri on stage to claim this honor, Excellence in Gynecology and Laparoscopic Surgery. Congratulations once again to Dr. Rajashri. Our heartiest congratulations once again. Dr. Rajashri for Excellence in Gynecology and Laparoscopic Surgery. And with that, we move on to our next category, which is Excellence in Cardiac Sciences. And Excellence in Cardiac Sciences goes to Apollo Adlux Hospital. Can we please have the Apollo Adlux Hospital team on stage to receive this recognition? Congratulations to the team once again, Excellence in Cardiac Sciences. All right. And ladies and gentlemen, with that, we move on to our next recognition, our next felicitation this evening, which is for Excellence in Hair Transplant and Restoration. And it goes to Ajay Bansal of DHI Medical Group. Can we please have the DHI Medical Group team on stage and Ajay Bansal doing the honors, please, in accepting the recognition. Okay, let's move on to Healthcare Innovator of the Year, and it goes to Mitra Hospital, Navneen Nair. Can we have Navneen Nair on stage, please, to accept this incredible honor for Healthcare Innovator of the Year? Congratulations once again to Navneen Nair and team over at Mitra Hospital. Healthcare Innovator of the Year, ladies and gentlemen. And with that, we move on to our next category, and our next category is Excellence in IVF and Fertility. And the winner in this category, Excellence in IVF and Fertility, is Dr. Mona Dahiya. Congratulations, Dr. Mona. Huge round of applause. Thank you so much. It's a very special moment, a special honor. And our next category has several winners, ladies and gentlemen. So I'll announce the category, and then I'll announce each of the winners. And the category is Emerging Star in Gynecology. And in this category, Emerging Star in Gynecology, our first winner is Dr. Srividya Taduru, Consultant Obstetrician and Gynecologist at Samraksha Hospital. Can we please have Dr. Srividya on stage to accept the honor? Also, Emerging Star in Gynecology in the same category. I'll announce the next winner very shortly. And the next winner is Dr. Ananya Polam Reddy, Senior Consultant at Sun Life Hospital. Can we please have Dr. Ananya Polam Reddy on stage to accept this honor and this special recognition? Thank you so much, Doctor. Thank you so much. All right. And our next emerging star in gynecology is Dr. V. Anusha Reddy, who's the Managing Director of Vanasthali Hospital and Vijay Lakshmi Hospital. Can we please have Dr. V. Anusha Reddy on stage to accept this honor as the emerging star in gynecology? Lovely. All right, and we'll move on to the next emerging star in gynecology was Dr. Manjul Prakash, who's the consultant of obstetrics and gynecology at Dr. Bansal Ultrasound and Mother Care. Can we please have Dr. Manjul Prakash on stage in accepting the recognition? Lovely. And our next emerging star in gynecology is Dr. Pratibha Garg, who's the director and senior consultant at Swastik Maternity Center in Delhi. Congratulations, Doctor. And our last and absolute final winner in emerging star in gynecology as a category is Dr. Amit Kamath, who's the chief consultant at Kamath Hospital, Mumbai. Let's please have him on stage. Congratulations once again, Doctor. All right, and can we please have Dr. Rajul Tyagi, Infertility Specialist and Director, Javitri Institute of Medical Sciences, on stage to accept this special honor. Thank you, Dr. Rajul. All right. Thank you so much, Doctor. Okay. And we'll now move on to our next category, ladies and gentlemen, which is excellence in women's health. And we have multiple winners in this category as well. It's a very coveted category, and we have a lot of distinguished achievers. The first of which is Dr. B. Padmavati, who's a consultant gynecologist at Basant Sahani Hospital, Secunderabad. So can we please have Dr. Padmavati on stage to accept the honor for excellence in women's health? Thank you so much, Doctor. Congratulations. We celebrate you and we salute you. All right. Lovely. And our next winner in excellence in women's health is Dr. Indira Gauri, who's the chief consultant of obstetrics and gynecology at Indira Hospital, Hyderabad. Can we please have Dr. Indira Gauri on stage to accept the honor? Our congratulations, Doctor. And we'll move on to the next winner in the same category, excellence in women's health. And the winner is Dr. Reshmi JR, who's the in-charge and senior consultant, Department of Reproductive Medicine at Kinder Women's Hospital and Fertility Center, Chertala and Alepe. Congratulations, Dr. Reshmi. We salute you and we celebrate your efforts. With that, we move on to the next winner in excellence in women's health. And the winner is Dr. Nishita Agarwal, who's the owner and director of the Gynae Clinic and Hospital in Faridabad. Dr. Nishita Agarwal, let's please have you on stage, ma'am. Congratulations once again. And our next winner in excellence in women's health is Dr. Bhumika Bansal, who's the director and head of obstetrics and gynecology at Max Super Specialty Hospital, Lucknow. Can we please have Dr. Bhumika Bansal on stage to accept the honor, this very prestigious felicitation. Thank you so much. And our next winner in excellence in women's health is Dr. Anil Gurjar, who's the professor of obstetrics and gynecology department at SMS Medical College in Jaipur. If we could please have Dr. Anil Gurjar on stage. Thank you so much. A lot of highly distinguished medical professionals to celebrate tonight. All right. And with that, we'll move on to our next winner. Again, this is in the same category, Excellence in Women's Health. All right. And the winner is Dr. Manisha Man Kadyan, Consultant and Director at the Kidney Hospital in Panipat. Can we please have Dr. Manisha on stage to accept the honor and the recognition, once again, for excellence in women's health. And our next winner in excellence in women's health is, ladies and gentlemen, our next winner in excellence in women's health is Dr. Abhay Sethi, endoscopist infertility specialist at Amaya Clinic. So if we could please have Dr. Abhay on stage to accept the honor and the recognition. Thank you so much, and congratulations once again, sir. Thank you for your contributions and for raising the bar when it comes to women's health. All right, and we now move on to our next winner in the same category, Excellence in Women's Health. And the next winner is Dr. Shilpa Goyal, who joins us as Director and Consultant Obstetrician and Gynecologist at Magnus Hospital, Udaipur. Let's please have Dr. Shilpa Goyal on stage to accept the honor and the recognition. Congratulations once again, Doctor. And we now move on to our next winner in the same category, Excellence in Women's Health. And our next winner is Dr. Neha Bajaj, who's Consultant Gynecologist and Infertility Specialist at Kailash Hospital, Dhanbad. Congratulations, Dr. Neha. We welcome you on stage as you receive this honor. And our last winner in the same category, before we move on to our next category, which is Excellence in Women's Health. And the winner is Dr. Simi Harris, who's the Director at We Care Women's Clinic. Can we have Dr. Simi on stage to accept the recognition, please? For setting new standards for excellence in women's health. All right, our next category is a very coveted one, and it's called Maestro in Gynecology. We have several winners in this category as well. And the first of which is Dr. Geeta Shanbanas, who's the Consultant Gynecologist at General Hospital, Niyatikmara, Tiruvananthapuram. Can we please have Dr. Geeta on stage to accept the honor? Congratulations, Doctor. Congratulations on this honor. Maestro in Gynecology. And we now move on to our next winner in the same category, Maestro in Gynecology. And the winner is Dr. Veena Chudamani, who's the Consultant Gynecologist at SK Hospital in Tiruvananthapuram again. Dr. Veena, if we could kindly have you join us on stage in accepting the prestigious honor. We now move on to our next winner in the same category, Maestro in Gynecology, and the winner is Dr. Bindu Suresh, who's a Senior Consultant of Obstetrics and Gynecology at Karotukuzi Hospital, Aluva, Ernakulam, Kerala. Congratulations once again, ma'am. Thank you for joining us all the way from Ernakulam, Kerala, and we congratulate you, Dr. Bindu. We celebrate your achievements and accomplishments in the field. Our next winner in the same category, Maestro in Gynecology, is Dr. Urvashi Seghal, who's the Director at Phoenix Hospital. If we could please have Dr. Urvashi on stage. Thank you so much, ma'am, for being here and for accepting this recognition from the Times Network here at the India Health Summit and Awards 2025. And our next maestro in gynecology, ladies and gentlemen, is Dr. Kiran S. Gautam, who's the Managing Director at Gautam Nursing Home. Thank you, Dr. Kiran, for being here. And we congratulate you on this honor. Thank you so much. All right. And our next winner in the same category, which is Maestro in Gynecology, is Dr. Ashok Kumar Rai. He's from the Obstetrics and Gynecology Department at Savitri Hospital in Deoria. Let's please have Dr. Ashok on stage to accept this prestigious honor. Congratulations once again, Doctor. And our next winner in the same category, which is Maestro in Gynecology, ladies and gentlemen, is Dr. Sudhir Nayak. If we could please have Dr. Sudhir Nayak on stage, who's the director of Sri Guru Hospital and Oyster Hospital in Mumbai. Thank you so much. Our heartiest congratulations to Dr. Sudhir Nayak. And we now move on, ladies and gentlemen, to our next Maestro in Gynecology, and that is Dr. Aswath Kumar, who's the Professor and Head of Unit, Department of Gynecology at Jubilee Mission Medical College in Thrissur, Kerala. Let's have Dr. Aswath on stage, please. Congratulations once again, that big smile. And our final winner in the same category for this second set of awards, there's more to come. For this second set of awards alone, our final winner in the Maestro in Gynecology category is Dr. Dhan Lakshmi, who is a professor and senior consultant, Department of Obstetrics and Gynecology with Sri Ramachandra Institute of Higher Education and Research. Thank you, Dr. Dhan Lakshmi. We congratulate you on your honor. All right, thank you once again. And thank you, sir, and thank you, Pooja, once again for helping us do the honors. I ask that you please take your seats. And before we jump into our next panel discussion, I want to once again acknowledge our sponsors, thank them, extend our heartfelt gratitude, because efforts like this do stem from, a collaborative vision and mission. And so the Times Network India Health Summit and Awards 2025, of course, could not have been possible without our sponsors and our partners, and they include our powered by partner, which is Intas, our co-powered by partners, Novartis, of course, and All Out. Our knowledge partner is Dr. MGR Educational and Research Institute, our supporting partner, Fit India. Our strategic alliance partner is Onyxtel Communications, our wealth partner, Nuvama Wealth, and our outdoor partner, Heights. But now we're going to turn our attention towards another pressing challenge in Indian healthcare. And it's one that directly impacts patient trust, safety, and the credibility of our health systems. That's right. The theme of this discussion is strengthening regulatory compliances by tackling contract manufacturing gaps and counterfeit drugs in India. It's a loaded topic, and this session will truly explore the collective responsibility of regulators, of industry leaders, and clinicians like yourselves in safeguarding quality and restoring faith, essentially, in the healthcare ecosystem. To moderate what promises to be a very critical, fascinating dialogue, I'd like to please invite my colleague, Amita Vadva, who's a senior news anchor with Times Network, to the stage. Thank you, Amita, for doing the honors once again. And joining her are esteemed panelists who include Mr. Durga Prasad Satapathy, who's the Executive Vice President with Intas Pharmaceuticals. He brings deep expertise in pharmaceutical quality and compliance, of course. And then there's Mr. Rohit Chadda, who's the Medical Director of Nova IVF Fertility, bringing a clinician's perspective on the importance of trust in treatment. Then we also have Dr. Prateek Das, who's a senior consultant nephrologist at Rabindranath Tagore Hospital, Narayanan Health, whose frontline experience, I believe, really highlights the life-saving need for safe and effective medicines. And we also have Sushant Mahapatra, who's an advocate with the Supreme Court of India. So clearly we bring you a 360-degree perspective on the topic. And with that, Amita, I ask you to take it away. The floor is yours. Can we have more mics? I think we might be short a mic. Thank you so much. There we go. All right.
Gentlemen, please take your seats.
Thank you.
Thank you, Pooja. Good evening once again. And this time I'm joined by esteemed panelists on stage because the issue at hand that we are going to discuss is very important. And this reflects when it comes to the changes in society, both comes with positives and negatives. And this is where we are going to a little bit have a more attention or focus when it comes to the negatives and how can one counter them, especially when it comes to the area of healthcare, because this amounts to, reflecting on our lives, on our health, and for a very, very long time. So joining us here on stage, as I said, eminent guests, and when we speak of strengthening regulatory compliance, what does it mean in the long run? And what does it mean when it comes to recent cases that have been in the news? Sir, let's begin with you. How would you see the concerns that have been raised with substandard drugs, counterfeit drugs? How can one actually, challenge and acknowledge them and to remove them from the system altogether?
Thank you very much. I think this is a very tricky question, and actually identifying a counterfeit drug is impossible. So like there is no system or there is no process how you can identify whether this drug is spurious or it is a counterfeit drug. Because those who are into this business, they replicate, or maybe sometime it is better than the original packings. So it's difficult. And the end user is the patient and he doesn't have a choice of selecting the drug. Many a times the responsibility goes to the doctor. So in my opinion, in my 30 years experience, I have gone through many cases of counterfeit drugs for our company where we have gone into investigation. And seeing both the packs, it was completely difficult for me to understand which one is real. Probably with the evolution of AI, blockchain, or the new coding systems, there has to be something on the pack. The regulators should make it mandate so that the patient does scan the pack and understand whether it is a original pack or it is a counterfeit drug. Probably that is the only way it can be held. Or the second thing is, it is the regulators who have to ensure that these contract manufacturing companies who they do not have their own marketing process, but they manufacture for many companies. They have to bring in some control over there. That would also reduce the counterfeit drugs.
Can doctors be deceived too, sir? Can doctors be deceived too? When we speak of such kind of drugs that are, largely available, can doctors be deceived too?
Yes, at the same time, because after the patient, the doctors are the most vulnerable in the most vulnerable situations. When you are using a drug, you're not knowing the quality exactly, whether it is a spurious drug or a normal drug, then either you have, what are the possibilities? Either you have a low action of the drug, blood sugar will not be controlled, blood pressure is not controlled, cholesterol will be remaining high. At the same time, there may be a no effect of the drug, there may be a failure of the drug in terms of the response. This creates two kinds of problem. One, there is a no effect, there can be an ineffectivity of the drug, as well as the symptoms, withdrawal of the drug. Suppose you are taking steroids, corticosteroids from some disease for a long time, and suddenly you become very sick and life-threatening situation because spurious drug is there, you don't know, you're giving the drug is not there. At the same time, when you're talking about the antibiotics, you are giving at a lower dose, in a substandard dose, you are the patient is not cured. That is one important thing. There you are not getting your adequate response. But at the same time, the bacteria are growing, there are more resistance are coming up, resistant bacteria is going up, and that affects the other people, this multi-drug resistant. If you see nowadays, many of the reports, as a nephrologist, we get many of the urine culture sensitivity report, is a multi-drug resistant Klebsiella, is responding to no drugs. So this is in a several way, it is very dangerous for the doctors, because the doctors always wants the patients to be cured or is improved. And if they're after the experience of so many years of practicing, they see that the adequate response is not coming, then they should raise the flag, because this is the pivotal point. That is the affection of the patient first, society, but doctors are very close to them.
So whose credibility, sir, then comes at stake? Does it come the credibility of the manufacturer of the drug? Does it come to the credibility of the doctor who is giving it? What about the patient trust?
See, first we have to understand what is a substandard drug, what is a spurious drug. There's a difference between the two. When we say spurious drug, it's in legal parlance, it's called a counterfeit drug. So this is a replica of the drug which does not contain drug at all. So suppose some famous brand is there. So ultimately what happened, these culprit, the criminals, they try to copy that brand. So Government of India has introduced one scheme that by this they have given the mandate that 300 brands in India, top brands in India, must have a QR code. Like Mr. Satpathy was telling about this blockchain, all these things. So things are going on, but one thing that it is not that India has become the hub of a counterfeit drug, everywhere counterfeit drug are being sold. Yes, there is a 5% drug is there, 5 to 6% drug is there, maybe a 10%. I don't know the exact figure. But what is going on is not that India is totally flooded with the counterfeit medicine. There may be a political game, geopolitics is also there. But yes, problem is there. So the problem is to solve it two ways. One is the counterfeit drugs. The criminal intent is there, then that is to be controlled by the government, and government is doing well for that. But still the technology is required to be adopted for this. Rules are sufficiently there, so regulators have to work more on this.
Regulator, that means CDSCO?
CDSCO and state, again, this is a good question you ask. We have two types of control in India. One control is the state government. There is a state licensing authority and state drug controller, and one is the central drug licensing authority, CDSCO. So CDSCO has a different role, and the state licensing authority has different roles. So inspectors are appointed by both the central government as well as state governments. So they have also their role to play. So collectively there should be a coordination, and coordination going on. There should be more coordination between the state and center. And then I think now the technologies are coming up, this problem can be solved. But as Mr. Doctor has said, some response is not there, something like this, it's all right. But then the government is working on it. And I think maybe 1 year or two, this problem may be minimized. It cannot be stopped because, thief is a thief. Criminal is a criminal. So there will always be a criminal will be there. So it cannot be eradicated. I don't think only India, world over this problem is there.
Yes. But this is when it comes to life is at stake, sir. This is about healthcare that we are talking about. And India, which is known as the pharmacy of the world, shouldn't be rather be infamous when it comes to such counterfeit products, and the way that they seems to be, progressing and spreading at a faster pace. How does one counter them?
So, first of all, I thank the Times Now group for allowing me this opportunity. So we are deliberating on this very serious topic, and I'd like to look at the whole topic from the angle that we doctors are the primary consumers, and it is the patient who is the secondary consumer. And we are the ones who are acting as the guarantors of the product. So there's a loss of reputation for us on a personal level. But the context that you bring, that is that the country is suffering a loss of image, is also a bigger picture. Now that the geopolitics being what it is, and pharmacy, the pharma industry is facing, I would say, existential crisis right now. In that scenario, being very honest and being very clear about the quality is the first and foremost thing that we should do as a country. And for that, all the pharma products, the companies should come together. What I fail to understand, and I don't know, the pharmaceutical industry is basically a manufacturing industry. So if there was some sort of a quality control happening right at the manufacturing level, then that should have taken care of most of these issues. What I understood from Mr. Satpathy, and I do not understand much about this industry, is there are players who would do contract manufacturing, meaning they'll order particular pharmacy, for particular companies to manufacture for them, they'll label them and then sell in the market. That has to stop completely, because we would like the product to come to us, like the farm to the table. We'd like the product to be produced by the manufacturers and they to be consumed by the user, and there should not be any middlemen or brokers in between, and which would, I would say, take away most of the troubles that we are facing right now. So that would be my suggestion, that we should actually look at possibly some sort of a quality control at the manufacturing level, and then maybe something at the user level, like a QR code or some sort of a scanning device by which the consumer knows that this is an original product. I would say this is the way we would look. Regarding exporting to outside, there has to be a hologram. Again, something I speak from a non-technical angle. There should be a hologram or something like that, which would ensure that our products, like Japanese quality, we should ensure that our products are actually of top quality when we are exporting across the world, because that's essential right now, given the situation that we are in.
So, sir, where does the problem arise? With the manufacturers or till the time it actually reaches the market on the shelves? Because when it comes to consumers at large, I guess that would be a very little percentage that would be actually checking, when it comes to the QR code or the authenticity of the medicine. It will be, available off right the bat of the shelf in any pharmacy. How does one counter that, right from the manufacturer till the time it is available on the shelf?
If you look at the evolution of pharmaceutical industry 2 decades back, there were only 200 manufacturing companies in this country. As on today, when we are speaking, we have more than 1,500 manufacturing companies in this country. The reason why the flourishing happened is there is something called, the slogan came, outsourcing. People do not wanted to invest their capital in creating infrastructure rather than using existing infrastructure. So in those days, those pharma companies, the large top 10 companies maybe, when their volume increased, their plant capacity was not enough. So they started outsourcing job work to some other companies, manufacturing companies. There are 2 different types, like one is called P2P or the other one is called lease license, LL. LL is like I take ownership of my quality control. The API is sourced by me. My quality control person goes to the plant. He just uses the facility for manufacturing my brand. P2P is there is an existing company who manufactures a brand. I take that brand and sell it.
No middleman.
Sorry?
No middleman.
No. So, but what happened? Later on, those manufacturing companies, they started manufacturing for anybody and everybody who takes a drug license and goes to them, say that starting from any XYZ, anybody can take a drug license and go and tell them that I need this much quantity, you manufacture for him. Now, when you manufacture, there are few things, like when we manufacture as a responsible pharmaceutical company, first thing is we do a plant audit. We do the plant audit, not only the plant audit, we do the API plant audit, we do the packaging unit audit. The second thing is when the product is manufactured, we bring that product and do a sterility and stability test in our own lab, and we put that product into stability. Every product has got a shelf life. Suppose the product is a shelf life of 2 years and at 25 degrees centigrade. So that product, a quarantine stock is kept at a place which is at 25 degree. So every 3 months, we have to test the product for the potency to ensure that the potency is not deteriorating, and we have to maintain a record. Now think of a person who doesn't have a quality control facility, neither a lab or a qualified person. He manufactures the product and sell it to the market. The drug law, if you see the contract manufacturing law, there is a law, rule 84E, which says that if there is any adverse reaction, it is the manufacturer and the marketing company, both are responsible. But when, as a company where we check the product at a interval, and when we see there is a potency loss, we have a control of recalling the stock, because the logistic network, the distribution network is in our control. Whereas in the contract manufacturing companies, you never know where that product is. So that's how the amount of low quality, low grade drug have started floating in the market, and that has led to...
But should obtaining license for selling such drugs, should that be made a little more stringent?
I'm not a regulator. I cannot demand that. But yes, I would recommend that we should control this contract manufacturing, and until unless a person have a facility of doing QA/QC test in-house and a sterility stability state throughout the lifespan of the product or the shelf life of the product, they should not be allowed to manufacture and market the product.
So legal framework, would you want to add on that, sir?
See, as Mr. Satpathy said, there is a loan license is there. So under loan license facility, what happened? I can hire the services of the manufacturing company. I can engage my technical person. I can supply my supplies and APIs, and then the drug will be sold in my name. So suppose ABC company, ABC Limited, the address will be of the original manufacturer. That's a loan license. So that is basically Rule 69A already is there. But then what happened, as he said, is from 1980, this practice of outsourcing started. Now it became even Mr. Satpathy was referring these 1,500 companies, but to my knowledge, there is 7,500 manufacturers are in India. 7,500, and 40% of that in Gujarat, and 15% in Karnataka, and 18% in Maharashtra, and remaining spread all over India. So now issue is, today, if we see the practical part of this, one thing as a legal practitioner I see, laws are there and it's very perfect law. Since it's 1940 law. Drugs and cosmetics 1940.
Yes, 1940.
But as for me, that law stands good today itself. It is such a good law. But only thing is that, as he says, stability, QC and QA is concerned. The main problem is that in a manufacturing company, three things are very important. That is called human resources. What is that? Manufacturing chemist, quality assurance, and quality control. So as per my experience, what I found, unless and until these MSME companies, contract manufacturing companies, either bigger or smaller, they have to invest heavily in their technical persons. Because what happened, I will give an example. One small company, some MSME company, whose turnover is maybe 50 lakh crores to 100 crores total. Where is the problem? The owners, they does not produce, knowingly they don't do any work, they produce any substandard drug. But problem lies with the manufacturing chemist. He doesn't know what to mix with what. QC, he doesn't know where these expiry dates are there, how the labeling should be made. So my suggestion is that legislations are already there, but government has to has to think seriously to invest more into the manpowers.
So does the regulator take the call? Because
yes,
regulator comes out...
No, regulator has to take a call.
No, but they come out with, these monthly lists, BP medicines.
So that is an NSQ medicine.
But
by only publishing that, that's not, you cannot wash your hands away. Like now BAB study, now they have imposed BAB study, bioavailability, bioequivalence study, now they have imposed. It is an amendment of 2017. Now after 8 years, it is being imposed immediately with immediate effect. So my point is that there should be some arrangement. There should be a panel of experts like CROs there, clinical research organizations are there. They can be roped in to audit these small companies. So they can be given a statutory recognition for auditing these companies. So as he said, big companies have all their, definitely there's a difference between the product of the big company and small company. We have to understand what is the quality. Quality, when you take a medicine, that medicine pass under the law should pass 92% minimum and 110% maximum. There's a limit to the medicine. What is the strength of the medicine? So if any medicine passes 92% plus, then it's a standard medicine.
Okay.
So now you can understand 92, 98, 104 and 110. So these are the 6% you can go on adding.
Okay.
So if the big companies are there, normally their medicine is found in the 105 to 10% purity. So ultimately over the period of 3 years, it's touched down to 92 to 95%. So that's why they are stable medicines are there. But the small companies, there's a problem. Their manufacturing chemist doesn't know how to manufacture it properly. So that message must go to the government.
Yes.
They, instead of making the companies to invest heavily in a capital investment, Like a restaurant, I will give you an example of a restaurant. You make a very good restaurant, invest in crores of rupees, but then chef is an idiot, suppose.
No, but profiteering over someone's health.
That I will come on. I will
Yes.
come on that also.
Yes, but I just want to take another comment from the doctors here, two of them on the panel, because when we speak of such manufacturers, doctor, do doctors have certain trusted brands that they often, turn to?
Yes, that we actually gain with experience, that it has been utilized for so many years in the patients, and that was working. That's how the trust builds. But unfortunately, particularly post-COVID situation, as a nephrologist, we do lots of drug level testing, and we saw the patients coming with the same dosing. They have a level of 5, 6, 7, 8. Now they are same dosing, they're giving 1, 2 level. That is quite dangerous for the kidney transplant patient. That's why we thought that something is wrong, and that is not related to a good brand or a bad brand. Okay, it is not like that. So in that situation, what we did, that we first had a peer discussion. Somebody from Calcutta is discussing, my friends in Mumbai, whether you are getting the same thing, the same drug, same brand or not, because it's a very sensitive issue. You cannot disclose or cannot blame or ask somebody and tell that. And if that, yes, my experience is also that we are facing same kinds of thing. In those situations, first we go to the pharmacy and they check the batch numbers, lot number, and if this something is wrong, know the pharmacy, you ask them to inquire with the distributor, and we also ask the company people that this is my finding. And in many situations, the trusted and big companies, they have come and they have withdrawn the whole batch from the whole of the country, and they have given they found something wrong. So this thing happens. So we should, from doctor's perspective, I think we should have a very low threshold for raising the flags, because it is after the health and life and death of the patients, and also the everything which have gained in life as a doctor can be ruined in some few days' time.
But does it monopolize certain pharma sectors and companies? Yes.
So that's the million-dollar question. I concur with whatever Dr. Das said. To a large extent, trust has developed over time, and that's the best judge. Now, post-COVID, somehow I've also had the same experience. Smaller companies with no entry barrier have come in, and the whole bad press that we are getting as doctors, as that we have a hidden agenda to promote a particular company. Also, the whole public hue and cry about low-cost generics, all pulled together has messed the waters completely now. And we really need to look at the whole thing. The cost is not at the cost of quality. So we have to look at that angle as well. My point, as you mentioned and he mentioned as well, is very simply, we have to have either a third-party assurance, or we going by what these manufacturers are telling us. But then if you are a manufacturer and a seller, then you have to have that much pockets to be able to do it. Then the whole business will then move into the big players. So how do we answer that? Don't know the answer.
So what initiatives, sir, do you believe that doctors can take, government could take, and then the consumer can take?
I don't think consumer has got any role in this, because
But to check
whatever
at
is
least what they're
prescribed by the
buying,
doctor,
yes.
he has to, or she has to
be
consume.
more aware of what they're buying.
See, bringing in, if you look at the contract manufacturing or the CMO, there is a conflict of interest. Me, being a manufacturer, I want to manufacture, then I want the price to be least, and the manufacturer wants to earn the most. So we have a conflict of interest in profit. So the only thing which can get better profit to the manufacturer is reducing the quality. As sir said, the quality parameters are 90% to 110%. Say a paracetamol 500 mg, I can give you 450 mg. Now the parameters are set because over a period of time, the potency loss happens. It is natural. And that's how the shelf life is decided, that over a period of, it should not go below 90%. So in that case, maybe a paracetamol instead of 500 milligram, you have to do 510 milligram, 520 milligram. I don't know that calculation. There is calculation for that. So over a period of time, if you keep it at a room temperature, it will come down to 500 milligram in 2 years' time. That's how the shelf life is decided. Now suppose you put pressure on me. Suppose I quoted a price of 2 rupees per tablet, and you say, no, I need it 1 rupee. So I'll, instead of 450 my drug will pass, because that's the regulatory standards. I'll manufacture 400, so 50 milligram I'll save in every tablet. That is my profit, and I'll pass on that benefit to you. But what happens to that drug over a period of time? 450 milligram will come down to 400. So if the drug is used today, probably it will give you good effect. over a period maybe 6 months, the efficacy would be low. So that's what is the scenario today. I'm just giving you one example. If you go into biologics, there is another challenge like, you know, the contract manufacturers, they manufacture, but the guy who takes it and sells it, there is a serious cold chain to be maintained in that. Or in case of vaccines, if it is not maintained, then, you know, the biologics deteriorate immediately. Like if it is exposed to a higher temperature for maybe 2-3 hours, probably the protein dissociation happens and the efficacy would be 50%, maybe nothing, 0. So these are risks which I think as doctors, they should ensure that these companies sprouting every day and coming to them and selling the drugs, they should not experiment with that.
Yes, but it's a risk. But legally, I mean, do you vouch for reforms, especially when it comes to quality control?
See, fairly speaking, I am very much satisfied with what are already there in the law, and daily the new guidelines and new things are coming up. So I don't think that there is a more requirement of a further stringent regulation. Regulation already is there. How much you are going to find it out? But the one point which I want to address is that this is a necessity to invest heavily in these 3 segments, the chemist, QC and QA. Once you invest good amount on this, good educated people are there, they take the responsibility, and some private editors, so there's a huge scope for employment also. If they take up the guarantee, by that no law can fix up some guarantee on the CROs or some independent editors and the manufacturing chemists, QC and QA. Ultimately, this problem of substandard medicine, not of standard quality medicine, that will wipe out. Because each and every manufacturer knows that if one of the product is found to be NSQ, his at least 10 to 15 years are going into waste because he has to face a legal proceedings. The manufacturing is done, suppose in Gujarat, the drug is sold in Meghalaya, then the person who is in Gujarat, he has to travel to Meghalaya, and in a company, suppose the 4 directors, 5 directors, all 5 directors to appear in the Meghalaya, the amount they are going to spend on a lawyer like me is a different issue altogether, but it runs into a lakhs. So the manufacturing, the small manufacturer or even medium manufacturer, they don't do the work knowingly. I am not talking of the counterfeit medicine. There's a criminal act. But only because lack of expertise and high manpower, high costly manpower, they are not able to afford, the problem is there. So my only take is today that the government of India should think it very seriously in every forum, not more than 30 forums I have said this. If this problem is taken care of, definitely the quality of the drug is going to be increased and the name and fame which India has as a pharmacy of the world going to be stable.
Well, let's keep up with the reputation of that.
Yes.
But would you want to share any personal experience that you have, encountered something like that with your patients?
One thing I want to share that fortunately or unfortunately I had the experience of visiting the lab in my city. There is a drug control forensic drug lab. So that situation is pathetic. The instruments are not been purchased over the years. So the staffs has been transferred over the years. The one reason they were telling the staffs that one reason is being that it is grossly underutilized because they are receiving 10, 20 samples in a year to test the drug level. So these things are there from the government side. It is there, and we from the doctor's perspective we should have a lower threshold for monitoring the drug level. Whenever we have any suspicion, we can always utilize this system. If this system goes up, then is a Meghalaya drug can be tested in Calcutta. So it is no need to take in Gujarat or Mumbai or Delhi lab. So these controlling authorities are there, but that should be slightly strengthened. And because we are now very much aware, everyone in this hall is very aware, our viewers are also aware that there are spurious drugs and that is dangerous for everybody. So that needs to be corrected at every point. It is not the only regulatory or legislation cannot. It is a porous wall. So it starts from the patient's response to the doctor's responsibility to the legislations and is a big responsibility of the manufacturing companies.
So that means, in conclusion, that when it comes to fixing responsibility, because the doctor's reputation is at stake, the manufacturers and especially when it comes to the patient, because a lot of trust has been put in by the patient, especially when it comes to the doctors and the medicines that are being given by the same doctor to the patient to heal for medical treatment. But thank you very much. This has been actually a very lengthy discussion, but it is important looking at healthcare and no risk that should be also given. And let's keep up with the reputation that India has of the pharmacy of the world, and we are living up to that. But when it comes to counterfeit and substandard drugs, well, that is exactly what I said. Accountability needs to be fixed. Thank you very much, gentlemen, for joining us here. It's been a lovely conversation with you all. Applause, please, for our esteemed panelists joining us here on the stage. Thank you, Pooja. Over to you.
Sure. And Amita, I ask that you please remain on stage for a few moments longer to present each of our panelists a token of our appreciation. I think it's deeply deserved. So if we could kindly have a memento as our way of saying thank you for being here at the India Health Summit and Awards 2025. All right. That's right, ladies and gentlemen. They're all combating spurious and substandard drugs in India, ensuring trust, safety, and compliance. A huge round of applause once more for Mr. Durga, Dr. Rohit, and Dr. Prateek. All right. Thank you, Amita, for guiding us through that discussion. So we now move forward to a very special address that combines two powerful forces. All right? Sports and health. Now, sports not only inspires discipline and teamwork, but it also plays an incredibly pivotal role in preventative healthcare, helping us build a fitter, stronger, and healthier nation. So at this time, it gives me great pleasure to invite on stage Mr. Mayank Shrivastava, IPS Deputy Director General, Sports Authority of India, to deliver his special address on sports as preventative medicine, building a fitter, healthier India. Mayank, sir, if I could kindly please have you on stage, and I ask that you take the podium that is to my left to address our gathering that is very much looking forward to hearing your remarks, sir. All right. Mr. Shrivastava, huge round of applause. If we could kindly please have you on stage. I believe Dr. Mayank Shrivastava will be with us momentarily. All right, since it'll take a moment longer, we are going to kick off with our next panel, ladies and gentlemen. So we're going to turn our attention to a subject that deeply resonates with today's generation, and that's youth and mental health. So in an age that's marked by relentless academic, professional, and social pressures, mental well-being has become as important as physical fitness. And how we cope with these pressures will define not just the future of our youth, but also the health of our nation. So to take this very vital conversation forward, our next panel discussion is on youth and mental health and coping in the age of pressure by making India fitter and healthier. Moderating this important dialogue is someone who has been consistently bringing health issues to the forefront through her journalism, Ms. Kalpana Sharma, Health and Lifestyle Editor with the Times Network. If I could please invite Kalpana to take the stage once more. Thank you so much, Kalpana, for being here. And joining Kalpana in this discussion are Major General Vikram Dev Dogra, CEO of Kho-Kho World Championships. Let's please have the General on stage. Thank you, Major. All right. And joining him, Dr. Praveen Gupta, who's the chairman of Marengo Asia International Institute of Neuro and Spine in Gurugram. Let's kindly have Dr. Praveen Gupta also take the stage to join the panel. And ladies and gentlemen, last but certainly not least, Miss Pooja Bedi, wellness entrepreneur and founder of Happy Soul, joins us on this panel as well. So it promises to be very exciting, a complete 360-degree perspective on the subject. We can't wait to see where this conversation goes. It's a critical one, and our panel here is here to do it justice. With that, Major Dr. Praveen and Miss Pooja Bedi. Huge round of applause once more. All right, Kalpana, let's go ahead and start. And as we have our third panelist join us, he can chime right in. Can we have the mics on and the music down, please? Thank you.
Hello. Oh, it works. Hello, everybody. How lovely to be here. Good evening.
Good evening. And
Good evening. Hello.
wakey, wakey.
Well, we are going to wake them up.
Yes, absolutely, absolutely. So, right now coming up is a very interesting panel. We keep talking about youth, we keep talking about where they're going wrong, you know, with so many opportunities, so many really avenues that have opened up for them, but yet mental health remains a struggle. And today we are going to talk about youth and mental health. Dr. Praveen joins us. And so, Major General Dogra, I would like to start this conversation with you. I mean, you've been in army yourself. You've completed 3 triathlons, Ironman triathlons, and the last you completed at the age of 62. And
I think that deserves a round of applause in itself. That's
Absolutely.
amazing. Well done.
And you've been in army, you've seen a childhood that, you know, was very different from how it is today. So what is it? Tell the audience how it was like, and, you know, what are the things that you'd like to tell today's generation, that, you know, what are the things you enjoyed? Probably they have more avenues, more opportunities today, but take us through your journey.
So good evening, everybody. I think today's youth has much more opportunities because of the overload of information which is available to them on the internet. And because they have so much more information, they also have more challenges. I believe we had challenges when we were young, but their challenges are those plus more because of decision-making becoming difficult due to the overload of information, because of mental stress which comes out of this information, and also the screen time which they need to spend now with the various gadgets that they look at. And therefore, because of all this, I think the devils that they have to combat are more in the mind. So it's to do with anxiety, maybe depression, maybe a question on your own identity. Who am I? What is my role out here? What am I come here for? Your want for instant gratification because of the social media that you have around you, and the distractions which are there. Also the non. And also, I think the kind of life that they lead, which is less physically inclined.
Yes.
So I think these challenges all result in the kind of environment that they are going through, which is more challenging and leading to mental stress. And that is how I feel the youth of today is different, and they have to combat all this. Yeah.
So, Pooja, through your podcast, and you've been very vocal about your journey, and you know, mental health, yes, it's found a bigger dialogue and bigger space in discussions today, but it is something that's always been there, and you've been very vocal about it.
You know, there are a couple of things. One is mental health and one is mental illness. There are two separate things,
Absolutely.
right? Mental health is what the youth of today in general are grappling with. Mental illness is something that has been prevalent for eternity and ages. My brother, in fact, was diagnosed as schizophrenic, and my brother committed suicide. So, and this happened, I think, almost 27 years ago. So, it's been something that we spoke about. Back then, it was very stigmatized. And speaking about these things was considered taboo. And people wanted to push it under the carpet because it was like, oh, pagal hai, you know, that concept was there of hiding things. And we spoke very openly about it because these things are treatable and they should be spoken about and people should be empowered, educated and aware. When you come to mental health issues, which the youth of today largely are facing, actually every age group, but in general, it's the youth the most that are the victims of it. There are a couple of things here. One is the fact that you're looking at a generation that cannot do without technology. It is the future, it is their present, and there's nothing you can do to change that. The question is, how do you create systems that enable you to work with it? Because you can't say, don't do this, right? So A, do you limit the amount of hours, or do you say spend a certain amount of time outdoors? So say, for example, if you see, I'm into holistic wellness, right? So when you see the human body, the earth has a frequency of 7.83, which is called the Schumann frequency, right? The Schumann resonance, right? That's the frequency of the planet Earth. Human beings have a frequency of between 5 to 10. We're somewhere in the same range as the Schumann frequency. It's Schumann resonance. The human body is designed to be in earth frequency. So things, simple things like going barefoot on the grass or on soil, grounding yourself, going into the outdoors, these are very important things to get your hertz, those hertz sort of compatible with earth, because that is our greatest state of calm. It brings you, it takes out the stress, it brings better sleep and all of these things. Now, technology today is one technology. So it's not just that you're picking up a phone, looking at it and putting it down. You're wearing these smart watches on your hand. There's constant electromagnetic frequency being beamed into your body, right? You go to sleep with the charger and the phone right next to you. Constantly you have that in your circuit. So what are the small changes we can make where you're not disabling yourself by cutting off from technology, but at the end of the day, you're keeping your entire body and mind in control, where you are in control of it, right? It's an addiction. So are you using social media or is social media controlling you? These are the important things. Like I use social media for a lot of information, a little bit of entertainment, but largely I use social media for research. I find so many interesting things. People are putting out such interesting content. I'm learning a lot. I use it for growth. Right? Some people use it for mindless scrolling, and that's taking away a large chunk of their productivity, their mental, and then there are comparisons that come in, right? You see social media, people are looking glamorous, people are looking gorgeous, you're suddenly feeling like a frumpy person, people are looking so intelligent and so talented, and you're feeling like a duffer, you know, so, so all these things come into the picture as well. So, you know, when you think of humanity, and you see that we're going away from being human, that's when the problems arise, right? We can use technology, but not be consumed by it so it's harmful for our mental balance, our physical balance, our emotional balances. So basically how to stay in balance with technology, because it's not something you can negate from your life.
And, you know, something like you mentioned that phone is also important, because when we were growing up, I remember my mom would say that, you know, you're getting addicted to the television. But really, every generation has something new and, you know, they have to learn.
But in our generation, we had like some 3 hours of TV because nothing else came. There was statics that would come immediately. I think Saptahiki was there, and then there was that wonderful Chitrahar that used to come.
Right. Dr. Praveen, we are talking about a very important topic, and, you know, you can throw light on how the young generation, you know, is grappling with anxiety, depression, and other mental illnesses. And, you know, what do you think are the contributing factors?
See, the world has become a very complex place now. And for the young generation, it is the interplay of so many things that is impacting their minds. Because our mind is a play of certain chemical transmitters like dopamine, serotonin, and that is what causes mental illness, right? Unlike mental illness as something mythical, now it's an interplay of transmitters. So there are 3-4 things happening simultaneously. One is what we have talked about is how life appears on social media like a stage. And we are all behind the scenes and we think that my life is so bad and their life is so glamorous and shiny, right? So we are always have this fear of missing out or self-perceived pity or sympathy that I am not doing well, somebody else is doing so well. Second thing is there is an increase in requirement for perfectionism. Society-induced perfectionism and self-induced perfectionism has grown significantly 3 times over last 3 decades, which means we are all putting more pressure on ourselves to look perfect, to talk perfectly. Same time, there is so much pressure or competition to succeed. If you see the data, there are about 12,000 students who committed suicide in 1 year. In Kota itself, the factory, about 40 kids committed suicide, right? This is despite all preventive measures. Combined with the grappling of social media and internet, people who are into Instagram are 2 to 3 times more likely to suffer from anxiety and depression. Why? Because these reels that we live in instead of the real world, they actually cause dopamine spikes. These frequent dopamine spikes upset our nerve transmitter balance. So we are not able to live without them. So this difference between real and real is getting more and more wider, and this 3-pronged attack on the mind is causing huge imbalance on the mental health of the youth, which is troubling them so much. So I say they are living in the prison of spring. We want everything to be the best or good, and the moment it is not good, we are not able to adapt, and that is where the main challenge of mental health lies.
I think also, there's just too much options out there. So what happens is, you're like a leaf in the wind, right? And if you compare to our generation, which is all about stability, I think what the younger generation today lacks is stability. They don't want stability in jobs. If they're miserable for even a little bit, my boss is toxic, the environment is toxic, and they leave the job. They have no staying power. They
get those BTs.
Yeah, it's a generation where they're very fragile. The coping skills. I mean, when we were kids, we got whacked around and, we survived. I mean, if we talked about mental wellness or balance or something wasn't right, we got 2 slaps and all our chakra auras, everything came into balance, right? It's today's generation is very like, you touch me, I'll report it. The fragility is there. They cannot, work hours have to be only so much, and then I need my work-life balance. They're not able to multitask effectively. There's no sense of stability. Even the relationships, very transient. Not working, leave it. Job's not working, leave it. I don't like this food habit, leave it. I'm trying this diet today, I'll leave it. Everything is so transient. So if you have roots, right, there's stability. If you're like a leaf in the wind flitting from experience to experience, that's how your mental state will also be. Right? And now actually I see a surge of revival in a sense. Old films are coming back, emotions are coming back. I see first there was something called FOMO, right? The fear of missing out. Now they're calling it JOMO, the joy of missing out, right? So that's coming to the picture. And we also have to understand as human beings, we can only consume so much of data. Today, say compared to 1850, where the study is amazing. It says the amount of data consumed by human beings in an entire life cycle is the amount of data. And data, we talk about newspapers or conversations and, schooling and back then in those years, or your job, etc. The amount of data that was consumed by the human brain back then in an entire lifetime is the amount of data we consume in 1 day today. 1 day. Can you imagine how our brains are processing this, trying to filter out stuff? I mean, and we have to learn to cope with that, right? So all these things I think are very important for us to consider.
Major General Dogra, I would like you to comment on this. You've seen a rather simplistic life filled with discipline. Tell us something, some wisdom if we can borrow today. And, what do you suggest? Because you've been fit all your life, and how does fitness comes into this entire, because with kids getting addicted to their screens, they don't want to go out. So what do you have to say?
So I don't think the kind of fitness that you're talking of is what is essential out here. I feel what is required to combat this kind of anxiety or the stresses of social media and the stuff we've spoken about is more to do with our ability and courage to first confront our fears. You know, if I am suffering from some kind of an anxious situation, or I'm getting into depression after a period of time, then for me to be able to acknowledge that first is what we need to learn. I mean, the youth today need to learn that. Once they have acknowledged it, and then you need the courage to be able to share it. Because the doctor spoke about students committing suicide. Why did they do that? Why weren't they helped? Because they never probably disclosed the situation with the people who mattered to them. So you need the courage to come out and tell somebody that, listen, I am now getting into this kind of a slide. And that is not weakness. That is, I would say, it is the beginning.
It takes a lot of strength.
Yeah, it takes a lot of strength. That courage is required. But then that is being honest. And honesty is the beginning of healing and moving ahead in life.
Especially honest to yourself first.
Absolutely. So I feel this is one line we need to put through to the youth. The second issue I feel is to do with mental strength. Now that mental strength, in the way we have let our children grow up, probably, and I say probably because some people would be endowed with it, but the others have not probably got that kind of resilience built into them. Because resilience comes when you do things which are difficult, out of your comfort zone, or things that you're not used to doing. And so therefore, we need to inculcate mental strength and resilience into our youth for today. And there are many, many techniques which we can adopt. And therefore, sports does help you get into resilience because it's a good medium where you learn how to lose, you learn how to not always be successful, and failure is universal. We need to learn how to take that. If a child who's going for a coaching factory in Kota is committing suicide, then somewhere that child has felt that he's not reaching where they're meant to reach. And that part probably can be tackled if you take this line. So I think resilience and also the ability to be able to open out and tell people that I am now suffering this.
Something that I want to ask both of you. First, I'll ask Dr. Praveen that, parenting has changed a lot. Parents operate from fear these days that, what if I push my child too much and, he takes some extreme steps. I have to be a gentle parent. I have to ensure if the child does not feel too stressed. And like Pooja mentioned that, they cannot handle being disciplined. So in your practice, what are some things that you see that, disturbing trends that you've been noticing?
See, the thing is that adaptability, as we have discussed, is the biggest key, and that applies to parenting also. So there is a word called mindful parenting. Mindful means that you are connected to the reality of your own household. See, God has made all households and all people unique. And as a parent, it is very important to focus on the unique attributes of your own child. Try and connect with those attributes and try to define your parenting according to your child, because you two are the system and that small universe that you have. Now, the moment you start doing it, in the moment you are present with your child, it will all come to you. You don't need to read a book on parenting to deal with your child. The moment you connect with your child, it will happen automatically. So it is important thing is to recognize the unique attributes of your children, of your own family, your unique desires and expectations, and try to instill, foster and nurture that so that you are able to give them that environment which is conducive to their personalities rather than everybody else or perceived personalities, which will make you a great parent, which will create a great bond, which will be your child's strength against mental illness, which will make him adaptable, which will make him connect, and which will allow him to succeed in his own way, not somebody else's way, in his own way in this whole world, because there are different people, different world, and different flowers, different fruits, different vegetables. Nothing is like anything other, and we need to understand that to be able to foster that.
There's this wonderful quote of Khalil Gibran, this poem of his on children, and it says, "Your children are not your children. They are life's longing for itself. You can house their bodies, but not their souls." and their future lives in the house of tomorrow, which you cannot visit, not even in the dreams. And you are the bow from which the archer shoots the arrow to go forth, right? And you're just there to be the conduit for that. Now, you're responsible for this child being on the planet, right? You owe this child a good education, love, stability, warmth, caring. But no child comes with a manual. No child comes with a how to operate manual. And each child is so different. The same household, two children born, even twins for that matter, have completely polar personalities, right? And you can't tell what influenced them, whether it was somebody at school or whether it was an incident or whether it was a movie or whether it was a moment, because the human mind is so volatile, malleable, adaptable, creative. There are all these things that go on in human beings, right? As a parent, you have to do the best that you can do, to the best of your knowledge. You are also doing it for the first time. We as parents put so much pressure on ourselves. Am I doing it right? Am I this? Am I that? They have their own journey. And you know what? The same shit happens to all of us, including our children. We will all go through the same crisis. Nobody's journey is different. We will all have moments of pain, moments where we will fail, moments where we will succeed, moments when a loved one will die, moments when we will suffer financial hardships, moments when we'll be rejected, moments when we will not be promoted, moments of great financial distress. We all go through that heartbreak. We all go through it. How we respond is our story. So what you have to teach them is how to respond to life's challenges. As a parent, you have to enable and empower them in how to be resilient in the face of no matter what comes away. Tomorrow you may not be on the planet. You will not be there to guide them. What have you taught them in terms of how to respond to a crisis, to respond to a situation? Their resilience, as you spoke about, that is very crucial and that is key. Right? So our job is to shape them responses. And that comes through SEER programming, right? Your social, economic, experiential, and religious programming that teaches you how in any adversity, it's through the lens you view it. You can be divorced, for example. Some person can see it as the worst experience of their life and that their life is over. Another can see it as empowering, that they have rid themselves of bad relationship and moved on forward with their life. One person can be mentally broken and one person can be mentally relieved, right? How you view it, the lens in which you see a situation defines your journey forward from there, right? So these are very important. The eyes that you give your child to view situations, society, life, experiences, and tragedy, most importantly. And the same tragedies occur with all of us. How do our responses get shaped? This is what we need to teach our children as parents.
And also working in a team, like, in army, for example, you always work in sync with each other. That's the same with sports as well. It teaches you to, rely on others. It teaches you to seek help where needed. What do you think children today can learn from that?
So I think first thing they must learn is about self-discipline. And in the army, we are taught that self-discipline is equal to your freedom. The restrictions that you have in the army, or the regimented life, the fitness, the camaraderie, the team's work, these are not limitations. They are actually the weapons that our children must employ so that they can regulate their lives, probably formulate a schedule where we wake up in the morning, exercise instead of giving excuses, put down their screens, meet real people, and use this opportunity to step out of their comfort zone, even if it's just for a moment a day. And by doing that, they can generate the resilience, the mental strength, and that will help them throughout. So I think discipline, self-discipline is equal to self-love. And if you equate that, it becomes easier to inculcate self-discipline because you're doing things for yourself. And that reality, that realization must come to the youth.
And you said something very interesting that, sports also teaches you how to take failure.
Yes.
Kids don't want to fail these days. That is the reason there's an increase in suicide rates as well. So, Dr. Praveen, would you like to throw light on, how this dependency on screen, lack of physical activity, how is it really impacting the youth today? Since your speciality, your field is that.
I'll narrate you a small incident. I went to a party of 10 school kids a few days back. In our time, if you went to a party of 10 school kids, you would have to shout to be heard. There'll be so much noise. But in that party, there were 4 or 5 boys sitting on a sofa, playing a game on each phone, and 5 girls sitting on the other side of sofas playing game together but on a phone, and there was no noise at all. But that's how today's connections are, right? So the whole thing here is the journey between the real and real has become more important than ever. Right? Why? Because when we connect, see, simple thing like sitting on a panel like this also is a small connection. It's very different from connecting through a phone, right? So which means the more real connections that we can foster in life, like building synapses, those connections make your resilience. They are a part of your mental health network we don't realize. It's sitting with a group of friends on a cup of coffee, which can be so de-stressing. It could be like going to a health club or staying in a health camp for 7 days. Meeting friends 7 times a month can be as good as that, right? It can increase your life by many years. So to inculcate that is a part of habit 1. Second is to develop hobbies. See, when we grow older, and we all heard of midlife crisis, we get trapped in routines which are dictated by our jobs or our professions. So hobbies allow us to learn something new. It gives us our mind to look forward to something every day. And it actually refreshes your brain, builds new synapses, secretes endorphins, which makes you powerful. Third is physical exercise. You would be surprised to know the single most important way to prevent dementia is to walk 30 minutes a day, because that simple exercise improves the blood flow to your brain. It actually empowers and makes your brain more healthy. With a balanced diet, if you were to combine all this, you have a recipe of strong mental health which is resilient, which is adaptive, and which can survive the change that is taking over our world at this point of time.
Even oxytocin, love, hugs,
Yes,
kisses,
love.
sex, all these things are so important in
Oh,
releasing
absolutely.
oxytocin in our brain, which is so important, absolutely.
Thank you. That
And
was
you know,
very
and you know,
interesting.
they say that positivity, I'm a positivity and happiness life coach, and positivity is a mindset. You have to create that mindset of positivity and seeing things with a positive lens. And happiness is a choice. It's a choice you wake up to daily. You choose to be happy in the day, you know. So I think that's very important to start spreading that to people and saying positivity is a mindset, happiness is a choice. Make these choices today.
Right, that's a very beautiful note, and I would like to tell everyone that Pooja, has a Happy Soul channel that she runs, and there are some very interesting conversations there. Would you like to end?
Well, actually, you can actually just go to poojabedi.com. There are a whole bunch of recorded courses that are going to be coming up, a lot of meditations, a lot of resilience sort of information put out there, a lot of limitless programming, how to delimit yourselves, manifestation, even for women with menopause. There are all sorts of recorded courses coming up on that. So just stay tuned, poojabedi.com, and hope to make the world a happier place, basically. We're all here. We're all in this together, Let's spread smiles and sunshine.
Absolutely, and that was a very interesting panel. We learned about resilience, we learned about being happy, and happiness is a state of mind, and of course, your insights were very, very useful, so thank you so much. Thanks.
All right, thank you. And can we please have Pooja Sethi back on stage to please join us in felicitating each of our panelists. Dr. Praveen, Ms. Pooja Bedi, and Major General Vikram Devrogra. We'd like to present all of them with a token of our appreciation. Thank you for being here at the India Health Summit and Awards 2025. A gesture of our gratitude from Times Network. Thank you so much. Thank you so much. A quick photo op to capture the moment. Some great visionary work here in the field of mental health, guiding the future of our nation. All right, and with that, we move on to our next session, which is a very special keynote on the topic, Can India Become a Vishwa Guru in Healthcare? And to do a deep dive on this critical subject, I'd like to now please invite on stage Professor Anupam Sibal, who's the Group Medical Director and Senior Pediatric Gastroenterologist and Hepatologist at Apollo Hospitals Group, the former President of the Global Association of Physicians of Indian origin as well. If we could please have Anupam Sibal on stage to do the topic justice. Thank you so much. And we'll have you kindly take the stage, sir. Over to you. I present you, Mr. Anupam.
Thank you very much. Good evening, friends. It's indeed a privilege to be here this evening, and I'd like to thank the Times Network for this kind invitation. So I'm going to try in the next 5 minutes answer a question, can India become a Vish Guru in healthcare? But to be able to answer that question, let's look at fields where India is a Vish Guru. Our deep commitment to democracy. In the last election, 642 million Indians voted, which is more than the combined population of 5 of the G7 countries. And for one voter, Mr. Darshan Das, who lives deep in the Gir forest, the Election Commission has been setting up a polling station because no Indian should have to walk for more than 2 kilometers or travel more than 2 kilometers to cast her or his vote. Adaptability. Indians can be found in all but 3 countries of the world, and wherever we go, we leave an indelible imprint, from becoming presidents to prime ministers to vice presidents of countries. And of course, our love for peace. In our glorious history of 10,000 years, we've never invaded any country. Let's look at areas or fields where we were once a Vish Guru and we can reclaim that position. Education. Takshila was established 1600 years before the first university in the West, Bologna. We now have more than 1,000 universities. We produce 6.5 million graduates, 1.5 million engineers, 300,000 MBAs, 100,000 lawyers every year. And guess what? By 2030, every 5th human being on this world who's a graduate will be an Indian. If we look at commerce, 1/4 of the industrial output and 1/3 of global trade was from India. And of course, in the last few decades, we made remarkable progress. We now are the 3rd largest economy in terms of purchasing power parity, 4th largest in terms of nominal GDP. And by 2047, when we'll be completing 100 years of our independence, 20% of the global middle class will be in India. Now let's look at healthcare. Some very impressive gains. When we became independent, our life expectancy was 32. Today, it's 70. Our infant mortality rate was 150. Today, it's 25. We have the world's largest health insurance program. 41 crore Ayushman Bharat cards have been issued. We have more than 170,000 Arogya Mandirs for primary care. We have ABDM, which is Ayushman Bharat Digital Mission, and we have Ayushman Bharat Health Infrastructure Mission, which has more than 60,000 crores allocated for improving infrastructure. And I think if we look at digitalization in health, it's a reality today. Arogya Setu, our app that looked at COVID, became the most downloaded app within 2 weeks of it being launched. CoWIN has records of 2 billion vaccinations, and if you look at the global picture, in many countries you still have to carry, including developed countries, a vaccination card, but for us it's all digital. And if we look at eSanjeevani, that's a program that the Ministry of Health runs for telemedicine. More than 42 crore consults have taken place through this program. And what is very gratifying is that 57% of those teleconsults have been in women, because women find it hard sometimes to go in for a physical consult, and eSanjeevani has kind of changed that. Now, how can India become a Vish Guru in healthcare? Well, there are 3 key initiatives that can actually help us achieve that. And the first is Heal in India. But before I touch on health, let me just spend a moment on space technology. Now, everyone acknowledges India's strength in space technology. We've launched satellites for 36 countries, including the US. We have the ability to launch more than 100 satellites in a single mission. And our Mars Orbiter mission was the first mission in the world to reach the orbit of Mars in its maiden attempt. Now, look at what it cost. It cost $65 million, and film Gravity, which was made, cost $100 million. A year after Gravity, Interstellar was made. That cost $165 million, and the Chandrayaan mission to Moon cost $74 million. The reason I'm mentioning this is because we understand frugal innovation. So when a country chooses a partner in space technology, they look at technology, they look at cost, they look at expertise. And that's what happens when a family chooses to come to a hospital or come to a country. They look at expertise, they look at technology, they look at cost. Our cost is about 1/10 for many procedures compared to the West. Our outcomes are comparable, and we have the experience and the expertise. We do more than 300,000 open heart surgeries a year, more than 250,000 knee replacements, more than 60,000 robotic surgeries, 22,000 kidney, liver, heart, lung, multi-organ transplants. And we have the best technology that is available anywhere in the world, whether it's a PET MRI, whether it's Zapex, or whether it's a proton that was acquired and established in Chennai a few years ago. The second initiative is, and that's where the strength of India in digitalization of our life is really going to contribute, and that is Heal from India. Now, what's stopping monitoring patients anywhere in the world through technology out of India? It's something that can be done, something that's already being done. EICUs, telepathology. There are 13 subspecialties in pathology, and there will never be enough specialist pathologies in niche areas. Telecardiology, teleradiology. If you want a complicated MRI reported, it can happen out of India. So this is going to definitely happen in the years to come. And then, of course, the most exciting is Heal by India. There is an estimate from the World Health Organization that by 2035, the world will have a shortage of 12.9 million healthcare workers. Any guesses where those healthcare professionals are going to come from? They're largely going to come from India, because India has the ability to train and produce 1 million healthcare workers a year. Nobody else can do that. Last year, for the medical exam, the entrance exam, 22 lakh class 12 students sat for 1,23,000 MBBS seats. There's still another 20 lakh plus kids who wanted to do medicine and we're very happy doing something in healthcare, whether it's in health IT, whether it's in nursing, physiotherapy, dietetics, or what have you, or healthcare management. We now have 808 medical colleges. Our number of medical college seats has doubled in the last decade. And we produce more doctors every year than all of Australia has. Australia has 100,000 doctors. We produce 123,000. Our postgraduate seats have gone from 30 to 72,000, and over a period of time that number will go up. So we will produce enough doctors, not just for India, but for the world. And because we have the adaptability and we are fluent in English, we are going to be able to do that. No other country is going to be able to compete with us. The second area is, in terms of Heal from India, is about pharmaceuticals. We are the world's third largest. We have the ability to provide vaccines. In fact, 50% of the global demand of vaccines out of India, 40% of all generics in the US, 20% of all medicines in the UK. And in recent years, we've seen a lot of progress in medical technology. There are several parks that have been established, and we are going to progress in medical technology as well. And of course, we believe in sharing. Through Vaccine Maitri, more than 100 countries got 250 million COVID vaccines. And we, of course, believe that the world is one family, and when India led the presidency of G20, we acquainted the world with the message, Vasudev Kutumbakam. For the Global Association of Physicians of Indian Origin, and I just wanted to highlight that there are 1.4 million doctors of Indian origin across the world, and we in this society have members from 56 countries. In fact, every 7th patient in the United States is seen by an Indian, and while Indians make up only 2.5% of the British population. 18% of all doctors in the United Kingdom are of Indian origin. So our Prime Minister wrote us a message for our Gapio conclave, and I end with that, and I quote, and he said that our view is anchored in the ethos of Sarve Bhavantu Sukhina, Sarve Santu Nirmaya, which means may everyone be at peace and may no one suffer from illness. So, my friends, with that ethos, can anyone stop us from becoming a Vish Guru in healthcare? Thank you very much.
Mr. Sibble, if I could have you back on stage, we'd like to present you a token of our appreciation. And to do the honors, if I could please have Maruti Indoria on stage. And he is the Vice President of Times Network Digital. Sir, we'd like to present you a token of our appreciation. And thank you for gracing the occasion and for sharing your insights as to whether India can become a Vishwa Guru when it comes to health. A symbol of our gratitude, a token of our appreciation. Maruti, if we can have you present Mr. Sibble this special recognition and honor. All right. Thank you, gentlemen. Thank you. Thank you, Maruti. So now we move on to a special address that we'd referenced earlier. It combines two very powerful forces, sports and health. Now, sports not only inspires discipline and teamwork, but it also plays a pivotal role, as I mentioned, in preventative healthcare and in truly helping build a stronger, fitter, more resilient and healthy nation. So it gives me great pleasure to invite on stage Mr. Mayank Shrivastava, IPS, Deputy Director General, Sports Authority of India, to now deliver his special address on sports as preventative medicine and building a fitter, healthier India. Sir, we invite you to please take the podium. Thank you for being here, and the floor is yours. Over to you, Mr. Shrivastava.
Well, I would like to thank Time Network's people who, first of all, partnered with Fit India and invited me to address all of you. Good to see so many healers here. Good to see those people with whom we have partnered earlier also. My topic that was given to me is sports as preventive medicine and building a fitter India. And the context is Fit India. I would like to introduce myself. I am Mayank Shrivastava, IPS officer of 2006 batch, and I am currently on deputation to Sports Authority of India as Deputy Director General and looking after Khelo India. Khelo India is a flagship program, and one vertical of Khelo India is Fit India. So what happened that, what triggered actually the government of India to think about launching Fit India, a program for fitness, a program for making people aware about the importance of fitness, a program to push people and to pull people towards fitness activities. I mean, you people are already, the crowd here, the audience here already knows the data, so I'm not loading you with data. But you know that nowadays in India, we are not particularly kind of very, very sporting nation. Most of our people, they don't go to any field, they don't go for any sports, they don't go to gym, they don't go to other activities, and with time, the lifestyle-borne diseases have increased in number of people who are afflicted with sugar, number of people who are afflicted with blood pressure, high blood pressure like diseases, number of people who are obese, it's increasing day by day. So the government thought, if it is increasing, then our aim to make India a sporting superpower cannot be realized, and the government launched a program called Fit India. It was launched in 2019 with the goal, as I will already told you, and currently what we are doing under Fit India, we are engaging in various programs. We are collaborating with various people to increase the awareness about fitness. When it was launched in 2019, Honorable Prime Minister gave a slogan, "Fitness ki dose, aadha ghanta roz." The idea was to motivate people and tell them that, maintaining fitness is not a Herculean task. It doesn't require you to spend plenty of time in, for example, sports field of play or in gym. Only half an hour if you give to your fitness, you will be fitter, much fitter. And there are plenty of exercises which people can adopt for half an hour. Even 20 minutes also is sufficient to make someone, keep someone fitter. So we have started plenty of program. The most prominent among them is Sundays on Cycle. On the inspiration of our Honorable Minister, Dr. Mansukh Mandviya, we have launched a program in December 2024 called Sundays on Cycle. So what we have done, we have allotted a particular day with a particular kind of exercise. Cycling, as you know, is an exercise which doesn't demand plenty of things from you. It just demands some time. Half an hour is also sufficient. It's very cool on your knees. It's very cool on your thighs. It's very cool on your body as a whole. But nevertheless, it rushes blood into your body and it keeps you fitter. So Sundays on Cycle we started, and because this is a movement, Fit India is a movement, and movement cannot be successful unless we collaborate with people, unless we join other institutions, unless people join us. So what we decided under the inspiration of Honorable Minister, that every Sunday we will invite a particular cross-section of society, particular group of institutions, particular class of people to be part of Sundays on Cycle. And it's my privilege to announce from here, and I don't know whether you people knew that or not, being doctors, that once we have collaborated with IMA also. And in Delhi and throughout India, we have done Sundays on Cycle with IMA, and on that day, plenty of doctors came to IMA officials, including came to Major Dhyan Chand Stadium, from where we did a cycle rally, and throughout the country, IMA representatives and other doctors were part of that. Just for a statistics thing, I would like to tell you currently more than 10,000 locations we have covered in India. More than 2 lakh people have participated in Sundays on Cycle. And if you ask about the success rate of it, because there is no measurement, we cannot tell you ki, okay, these many people have their sugar, the disease of sugar has gone down, or it has been cured, or it has been contained. But we know the success rate of our movement is like that. More than 1.5 billion impressions we have got on our social media platforms. So, of course, people are taking it up, and many people have joined us as Fit India Ambassador, Fit India Icons. We have a facility, we have got a program in which we allow people to join us if they have good presence of in social media, and if they are fitness enthusiasts. Fitness icon, if you want to know who are fitness icon of Fit India icons for us, Ayushman Khurrana is the latest addition. We organized a Fit India Carnival at Delhi Jawaharlal Nehru Stadium this year, and Ayushman Khurrana was awarded with Fit India icon. Later on, Jackie Bhagnani was also awarded with Fit India icon. His wife also was given this reward. So plenty of people are joining us, and again we will be, because every Sunday we are rotating the cross-section of society with which we are conducting this Sundays on Cycle. Again we will be conducting a Sundays on Cycle with IMA and doctors. I would request all of you to be part of Sundays on Cycle. Apart from the Sundays on Cycle, we have been collaborating with many people. Milind Soman is one. He organizes Pinkathon. So he organizes 3,000 meter, 1,000 meter, 10,000 meter and full-fledged marathon, 42-kilometer marathon only for women. And you know, the success of this event is that even the homemakers, those ladies who have never come out from their houses for, you know, sports activities, they are coming out and they are becoming part of that. And so we have collaborated with them. So Pinkathon is another thing that we are collaborating with. And very soon we'll come up with fitness activity for each day. So we will have 7 days, 7 activity. And in those activities, apart from actual, you know, the physical thing, there will be some activity for mental health also. In fact, one activity will be a no technology day. And just like you keep a vrat, keep a fasting during Navratra or something, we would encourage everybody to keep a fast. व्रत रखेंगे 1 या 2 घंटे के लिए, क्योंकि हमें पता है पूरे दिन के लिए रखना तो मुश्किल है. तो 2 घंटे के लिए व्रत रखेंगे कि हम कोई मोबाइल यूज नहीं करेंगे, कोई लैपटॉप यूज नहीं करेंगे. ये हमारा मानना है कि ये हमारे फिटनेस के लिए, ओवरऑल फिटनेस के लिए ये भी जरूरी है. तो योगा भी पार्ट होगा उसका एक दिन, सो दैट वी कैन ऑल्सो केटर टू आवर मेंटल वेलनेस. Soon it will be announced by our minister. And when it comes to preventive medicine, you know, sports and fitness activities, of course, they act as preventive medicine, because the more, there is a saying in army and police, the more you work today, the more you practice, the less you bleed in war. So preventive medicine, sports does the same thing. The more we work out, the better we are, the fitter we are. And I mean, whenever, wherever your body parts kind of degenerate or develop some kind of, they become older, you will still be able to walk freely and you will be able to feel energetic. Of course, before you people, this is not so important, but you know, what we have done, we have started propagating sports in those areas which are troubled by terrorism, because it's not only health of ours, but health of our country is also important. So I'll give you a few examples how sports have shaped the people, how sports have brought peace, how sports has brought young people into the mainstream and not only give them a lifestyle full of fitness activities or sports activities, but also it has put them in an area where they can be constructively used, they can constructively contribute for the wellness of our country. The first example is from Kashmir. You know, there was a time Kashmir was known as an area where there are pattharbaz. Now those hands which once wielded patthar, now they are kicking football. A few months back, a big tournament was organized in Kashmir, and football, which is not very popular in the heartland of India, it's very popular of course in Northeast, Bengal and Goa and Kerala, but not in the mainland India. Nevertheless, in Kashmir, it attracted huge crowds. Huge crowds. Even Honorable Prime Minister mentioned it in his Mann Ki Baat. And there are plenty of people who are now playing footballs in Kashmir. Similarly, through our Khelo India centers and other activities, there are plenty of Kashmiris who have adopted sports like wushu, which is less known among us. There was a time when I was superintendent of police in Narayanpur district of Chhattisgarh. You know, if you know about Chhattisgarh, you know about Maoist violence. So this area, my area was this area was marred by Maoist violence. And in fact, Narayanpur district headquarter was such a small district headquarter, if you can use a kind of humorous anecdote or phrase for that, if you throw a stone from center of Narayanpur, it will fall out of the district headquarter. It was such a small headquarter because other areas were full of jungles and they were not safe. This was somewhere around 2009-10. And if you, from Kondagaon, if you turn to Narayanpur, there was a huge patch of jungle. And अगर आप शाम को वहाँ जाते तो मुर्दानी सी छाई हुई रहती थी. ऐसा लगता था कि मतलब यहाँ पे कोई रहता नहीं है. It was very pessimistic, very doomed kind of area. I decided that I will wean youth away from Maoist. I will wean youth away from terrorism. I will, because it's not that local people who are engaged in terrorism as such. There is some Maoist propaganda that leaves no other option for the youth people there but to join Maoist. They are given no other alternatives. So I started sports there. And, I organized plenty of tournaments, athletics tournament in particular, because for athletics, you would not require that much of, it's not very technical thing. Running, at least a very crude style of throwing, a very crude style of jump, So the effect was like that. And I, contacted some people who gave some good money. So award was very good. Award was very good as per the Bastar standard, of course. For example, the winner would get 10,000 rupee. And for example, if it is 100 meter and any guy who runs below 11 seconds, then he would given, is it for me? Okay. So if she runs below 11 seconds, then 5,000 more he'll be given. The result was very encouraging. Later on, some shopkeepers contacted me. They gave me special thanks. उनका कहना यह था कि सर जब से आपने शुरू किया है हमारा जो दुकान खाली पड़ी रहती थी अब वहाँ से बहुत सामान जा रहा है. क्रिकेट के बैट बिक रहे हैं, बैडमिंटन के रैकेट्स बिक रहे हैं, शटल्स बिक रहे हैं. Later on, you found that the whole district headquarters was buzzing with some sports activity, and that area is now very popular, very good destination for football. People, the Abuj Madia people, the Madia people, they are very good at football. So, the sports has got that power. It heals people, not only physical healing, but mental healing also. And beyond this, I have nothing much to say. I would thank you. I appreciate your patience. You people are here. I'm seeing you since last 2-3 hours. Thank you very much for patiently listening to me and wish you best of luck. Thank you.
All right, sir, if I could ask that you please remain on stage with us. And can we have Pooja Sethi back on stage? Or actually, let's have Maruti Indoria back on stage, who is the Vice President of Times Network Digital, to kindly present our guest with the token of our appreciation. Thank you for being here, sir. IPS Officer Mayank Shrivastava. Excellent. This is a token of our gratitude, sir. Thank you for sharing your rich range of insights. And we here at the Times Network thank you for raising the bar here at the India Health Summit and Awards 2025. Thank you once again, Maruti Indoria and Mayank Shrivastava, sir. Thank you, gentlemen. All right, with that, we now move on to a critical conversation that lies at the very foundation of healthcare delivery in India, and that's infrastructure. So from tertiary hospitals to primary health centers, and from manpower to technology, strengthening our healthcare backbone seems to be the need of the hour. And in today's era, digital tools are becoming powerful enablers in this journey. So our next discussion is aptly titled Revitalizing India's Healthcare Infrastructure by Leveraging Digital Power. And moderating this session is our colleague, Mr. Prashant V. Singh, who's the editor at etnow.in and etnowswadesh.in. May I please invite him to take the stage as he's joined in this dialogue by our panelists, who include Dr. Devleena Chakravarti, who's the Managing Director of Artemis Medical Services Limited, Lieutenant General Dr. Bipin Puri, who's the Director of Medical Services North India with Indraprastha Apollo. Let's have all of our panelists on stage, please. So I'll repeat that once again. Is Prashant now with us? If Prashant could kindly take the stage. And joining him are our panelists. And I think everyone has reached the dais to approach the stage. So with that, Dr. Devleena and Lieutenant General Dr. Puri and Prashant. Thank you. Prashant, take it away.
Thank you. I know everybody, most of us at least, are waiting for the dinner and other things also. But this session is very power-packed. We have two panelists, very interesting. One is decorated, one has been to many places. So I would like to start with you. Devleena, while research, I found out that you have been to Berlin, you have been to Boston, you have been to many places, and now you are serving as the Managing Director of Artemis. So what are the global things that you are trying to implement at your hospital? Because since I am the editor of the ET now, so I have found out that your stock is also nearly 1,400% up in last 5 years. So what you are doing that a penny stock has become a real stock?
Thank you, Prashant, and thank you for this invite. And I'll go slightly beyond Artemis Hospitals because it's not today about me or Artemis Hospitals. Of course, I will dovetail it with the discussions that we have today. The concept of today's discussion is revitalizing Indian healthcare. And if, with your permission, I would like to say there, essentially in my mind, there are three cogs in this wheel if you want to revitalize Indian healthcare. And, I am a medical doctor, a radiologist from Lady Hardinge Medical College, Tata Memorial. Then I went abroad, studied at Harvard. So God has been kind that I have had a lot of Indian and international experience. And today we talk about our country, India, and what we need to do as to create a soft power in healthcare. So the three cogs in the wheel, which I am talking about, the first is definitely the availability of healthcare. When we say healthcare, we talk about infra, we talk about people, and then the access to a healthcare facility. Typically all over the world, and there are different timelines. If you want to reach a primary health center, you should be able to reach it within 15 to 20 minutes. If you want to reach a secondary, it has to be between 30 to 45 minutes, and a tertiary care, less than 1.5 hours. So like kind of taking an average and not going into the details of primary, secondary, and tertiary, today, in my opinion, that the biggest problem for us is, and which is basically at the bottom of the pyramid in the rural areas, in tier 3 cities, the access to healthcare. So whether it is infrastructure, whether it is people, whether it is just an ambulance service or the roads, how do you reach? And that government is doing a lot. So in the primary and the secondary areas, we are seeing a lot of improvement. So whether it is improvement in immunization, fall in the infant mortality rate, and so on and so forth. But what continues to bother us today is the availability of tertiary care to the people who are at the bottom of the pyramid. And that needs to be addressed. So today, almost 2.5, 2.6% of our GDP goes to health. And ideally, 6% GDP is what the world looks at in health for a universal coverage. And I'm sure the government, with its focus on India becoming a soft power in health, increase in allocation of GDP is going to be something which is going to move the access to health. The second cog in the wheel, which we have huge amount of muscle, is the digital health. And so be it telemedicine, teleconsultation, tele-upskilling of paramedics, nurses, upskilling them, whether it is AI for predictive medicine, diagnostics, we have it all. And every third, I would say, startup today is looking at digital health, how to make, digital health accessible. So that's a huge space, and we have a clear advantage. And the third cog in the wheel for becoming a Vishwa Guru in healthcare is the research and development in health. And we have huge number of hospitals, huge amount of data, large number of patients. The type of data that we have in India, the West are lining up to buy that data from us. So here I will say that at Artemis Hospital, we have created a separate building for research and development, where we have got Indian scientists all back from United States, from Germany, and all over the world, who are working in a very a very academic environment. We have 3 to 4 patents that we are going to be filing in, so that we become a true force and power in terms of healthcare delivery. And all these cogs have to be equally addressed for us to move at the speed that we want to move.
So now I would look to come to you. So Lieutenant General Puri, she spoke about the time frame also. And you have served a different ball game altogether. Armed Forces, you have served as the apex post as a Director General. So, and forces are known for very fast-paced treatment because you don't have any time for this. So what do you think, what is the key difference between your experience and what you are witnessing in the private hospitals, and what you are trying to implement so as to make it much better?
Thank you, Prashant. At the outset, would want to thank the Times Network for having me here this evening. Well, yes, let me begin by saying that it has been my proud privilege to be leading the Armed Forces Medical Service. Let me also say this, that it comes with a huge sense of responsibility, because you are the shoulder to the entire armed forces. And it means that you're looking after the health of the Indian military, Army, Navy, and Air Force, each with its own peculiarities, each having its own nuances, each having working in different terrain. So talking of Army, look at the Army, whether it's on plain ground, whether it's desert warfare, whether it's high altitude warfare, whether it's mountain warfare, whether it's forest warfare. So each terrain throws up different challenges. We as doctors, we adapt, try to analyze, conceptualize what is the terrain, the issues, the problems, the challenges which may come to our soldiers, and then plan, strategize medical care in that terrain. So let me say this, that perhaps one of the most challenging has been high altitude locations like, let's say, the Siachen Glacier, etc. Now, those have been very, very challenging issues. Near Baramulla, Drugmulla, beyond that, when the temperatures are minus 50 and high altitude locations, those are huge challenges that I know that the military goes to the challenge, but the doctors are just not very far behind. So I sincerely believe that we as doctors have evolved, make our medical doctrines based on the theater of war. Now, as you can see, the theaters are changing. War is changing. You've just seen the recently concluded war. There's more of air force, not much of land operations. So based on the type of operations, we change our strategy. What sort of medical help would be required, as those medical doctrines have evolved and continue to evolve to find the right best practices, so to say, as far as medicine is concerned.
Okay. And when we talk about technological innovations, the entire discussion is hollow if we don't talk about AI nowadays. So what is your opinion on AI? Because there are a lot of articles, you might take it as a conspiracy theory that people like Elon Musk and Bill Gates are writing that AI will replace doctors, but some prestigious websites like WebMD, Healthline, NHS.co.uk, Harvard Medicine, they are writing that AI will complement doctors. What's your comment on this?
I absolutely endorse that thought process that AI cannot replace the doctors. AI will give you the machines, whereas the human factor, the doctors, will give you the human touch, the empathy, the compassion, and to move and analyze the machine. So I think AI is going to be an integral part of our lives. I have no doubt in that, because the way it has complemented, has improved our work conditions, our ethos, our precision work. We talk of precision medicine today. We talk of predictive medicine. We talk of preventive medicine. We talk of so many algorithms that we are talking about today. I know for certain, having now working in the Apollo ecosystem, a lot is happening as in the AI space, and there are a huge number of algorithms which have come in our workplace, suggesting preventive health, predicting what sort of problems we are likely to have. So when a patient comes in, when he comes for his preventive health checks, he's analyzed in terms of his parameters, his vital parameters, his weight, height, blood pressure, pulse, etc. Investigations, extensive biochemistry as well as hepatological investigations. All that is fed into the AI algorithm, and based on that, the algorithm tells you you are a possible suspect. You may land up either in a chronic kidney disease or a chronic lung disease or a liver fibrosis scenario or a cardiac problem. And also now with AI, you have we have coordinated with Microsoft, and they have this HoloLens by which all these parameters are added to this through the AI into the system, and actually you can visualize what is your current status of your heart and what are going to be the problems. So that is the level of AI where it has gone. Now you look at fecal microbiome. They take some sample from your stool, and that microbiome is analyzed. It can help you to diagnose whether you are likely to have metabolic syndrome problems, obesity, diabetes, etc. And what you can do to change your fecal microbiome. So there is so much happening in the AI space. And I'll give you another example which I'm very, very fascinated about, and I thought must share with everybody. What the Apollo ecosystem has done, something very, very interesting, and what we call as connected care, Apollo Connected Care, Comprehensive Connected Care Program. What it means is, like at Apollo Indraprastha Hospital, we have ICUs. Patient has come out now from the ICU into a ward. Sometimes the patient, while in the ward, becomes a little dodgy. He becomes, he loses control of his vitals and problems. Each of these patients is wearing a wearable device. The wearable device is monitoring each of these patients through another command center. And that command center, the moment the patient becomes a little wobbly, the command center calls up the intensivist, please look up this patient. And so that the patient doesn't collapse, patient doesn't, there's no code blue or a code orange for this patient, and is rushed back to the ICU or treatment is delivered. Now this has extended not only in the ward, it has now extended to nearby hospitals. Okay. We are also extending this service now to e-ICUs So this service has become a rage that people are wanting this from us, and this is becoming a huge. So all this thanks to AI, early warning signs, which help us to make early diagnosis.
Devlina, we would like to come to you. So any example like Lieutenant General Puri, which has served as a shot in the arm for doctors at Artemis especially,
Yes.
any real life or practical experience?
So yeah, I think most of the hospitals are on the same page. Like we create what Dr. Puri mentioned, the hospital safety network, when people are wearing wearable devices once they are shifted out of the ICU, so that their shift back to the ICUs is reduced, early warning signs are picked up. So we are also using AI for determining strokes. So what is happening is when we have a stroke network, and we are connected to multiple smaller hospitals where they do not have either an intensive care or neurologist or both, or an interventional neurologist to take care of stroke. So wherever this, so we have a stroke and we are the central nidus for this. So in our network, whenever a patient comes with suspected stroke, the software in their CT scan with the help of AI can predict whether the patient is a candidate for stroke or not, and so that the window period is actually respected. A lot of time it could be a vertigo because of her ear problem, and a lot of time it could be a posterior circulation stroke. So this scan, the brain scan which happens, is fed into an AI system, and the moment we predict that it is an impending stroke, all stops are pulled, the patient is shifted faster than you can imagine, and we go in for anticoagulation and saving lives. So we have launched a program called Samay, which is actually a stroke program, integrated stroke program, which works with our network hospitals to shift the patient the moment we identify there is a problem. The other thing is what we have launched is a health kundali. It is basically the next generation sequencing, your genetic next generation sequencing. Along with AI, we are able to predict from the age of 35 to maybe 95 what kind of diseases you are going to be falling prey to, what kind of lifestyle, dietary changes, or what kind of checkups you need to do. So a huge boost in the arm for predictive medicine, that we are using. These are just few of the examples, including the FMT, the fecal microbiome transplantation, identifying super donors to get your gut health well, which is a work going on with our scientists in our scientific labs. So a lot of these activities are going on across, and I think in terms of predictive medicine, in terms of preventive medicine, and complementing what we do, AI is going to be there all through, but definitely not replacing doctors and not replacing the acumen which every physician brings on the table.
Conspiracy theory outrightly rejected from the India's largest news platform.
I don't think so. It was a conspiracy theory. For us, it was never a theory, because we know what we are doing, and we are happy to have more help at hand, and we are hardly threatened, or we don't even give it a second thought, to be honest.
Devlina, one practical challenge. We are talking about a lot of technological innovations, but technology has a certain price tag attached to it.
Right.
And when it becomes heavier on pocket,
it
becomes, not reachable for some people,
yes,
but it is reachable to some people. So what to do, and in terms to make this, luxurious kind of treatment also affordable, luxurious treatment? Because some treatments are luxurious, I know, everybody knows. What's your take on this?
So, very apt question, Prashant, and you have asked the right person. I'm the radiologist. I'm a radiologist. So tech has been in my bloodstream from the time I started practicing. Now there is a myth and there is a reality, and let me first do away with the myth. So we in India, so for instance, we buy an MRI machine from Germany or from the United States, from Siemens or GE or wherever. The place where these MRs are manufactured, if you go for a baseline MRI in Indian rupee, you will be charged 35 to 40,000 rupees. Now, when this machine comes to India and we pay all the duty and the taxes and the shipping and so on and so forth, your baseline MRI costs here anywhere between 5 to 7,000. So what we are doing is we are already aware of how price sensitive the Indian population is. And we are constantly cross-subsidizing. We are bringing in economies of scale. So while in a German or an American center, they do 10 MRIs a day, we do 70 or 75. We sweat the machine harder, but make sure every patient pays that much less. And having said that, you know, what do we compare with? On one side, we have created this whole concept of free healthcare in the public sector. So the moment we compare with the free healthcare, anything that we do will look expensive. But free lunch do not last forever. So we have to find a way. And that's when I say that government and private players should come into a kind of partnership, create a national grid for healthcare delivery so that there is no duplication. We do best at what we do. The government does best at what they do. They cross-subsidize us. We cross-subsidize the patients. And there is always a way forward. So the cost, you know, the world looks at India as a destination for tertiary care because we are 1/10 of United States or the people in the West. We are probably 1/3 or 1/4 of Southeast Asia. But we still find ourselves expensive for two reasons, comparing with the public healthcare system and the affordability. But as we kind of continuously cross-subsidize, as there is insurance penetration, as there is Ayushman Bharat, I am sure there will be larger and larger coverage of people in use of technology. And from our side, we will continuously endeavor to keep the prices lower.
Lieutenant General Puli, your quick take, because I think that bell is buzzing and most likely that is for us.
Yes, so I think, Prashant, I'll just capsule what I'm going to say. As far as cost is concerned, it's a genuine thing, especially in countries like ours. But you see, take an example of COVID. When COVID came, much of the RT-PCR kits that we were saying, ventilators, were being imported. They were so expensive. Just in a very short time, we became indigenous. We started emulating the kits. We started producing the kits. The ventilators were being produced. And the costs came down dramatically. So my thing is, when telemedicine, when it came to this country, it was fairly expensive because of the hardware, the software, etc. But with e-Sanjeevani, when it came during COVID, millions of telemedicine consultations, the costs came down. As the volume increases, the cost will come down. As the expertise improves, the cost will come down. So that is my point number one. I'm actually saying what she just said. But the second point which I'm trying to make is Indian Jugaad. Indian Jugaad mein har cheez ko you can customize. You can pick up the best things and try and make it more economical. And I sincerely believe that would really be the way forward in countries like ours. We can do as well with a similar sort of infrastructure.
Now, just to close this, wrap this up, one quick line, one health tip that you live by and want people to follow from both of you.
So I sincerely...
One-liner.
Yeah, so I'll just say in today's times with so much of inaction, obesity, diabetes, metabolic syndromes, and non-communicable diseases becoming a pandemic, the main thing is to move to physical activity. You must exercise. So my catchword would be keep moving, keep living.
Keep moving, keep living is the takeaway. Your
Exercise and conscious eating. Make sure what you put in your mouth, you're sure what you're eating. Yeah.
Thank you so much. We are getting infinite insights, but time is finite to us. Thank you so much. Thank you to audience as well. Thank you to the panelists also. Thanks.
All right. A wonderful session once again. A lot of fascinating insights came to the surface there. And I'd like for Prashant to please felicitate each of our panelists with a small token of our appreciation, a symbol of our gratitude. Thank you, Dr. Puri. Thank you, Mr. Agarwal. And thank you, Dr. Devlina. A photo op to capture the moment. And thank you, Prashant, for spearheading that discussion. All right. So, ladies and gentlemen, up next, we bring you a very special fireside chat. And this chat truly cuts through the clutter. It cuts through the misconceptions that we often carry about health and fitness. And the session is titled Fitness and Beyond. Define and then defy your inner boundaries. All right. And ladies and gentlemen, to moderate this insightful conversation, may I first please invite on stage. All right. Are we ready? Okay. All right. So, ladies and gentlemen, to moderate the conversation, if I can please invite on stage Ms. Rudrani Chaturaj. Okay, all right. All right, I think we're going to have a slight change in plan. Very briefly, if I could please have Maruti Indoria on stage and Pooja Sethi both on stage from the Times Network. And we would like to present Ms. Pooja Bedi a token of our appreciation. So if we could have Pooja Sethi and Maruti Indoria back on stage to do the honors. If I could please have you back on stage, the both of you, Maruti Indoria and Pooja Sethi. All right, and we'd like to present Ms. Pooja Bedi a special award for being here at the India Health Summit and Awards 2025. A powerful and credible voice in the field of mental health in this country, doing so much with her inspiring entrepreneurial work and setting the path for future generations. All right, thank you so much. And thank you so much, Pooja Bedi, for being here. All right. Thank you, Pooja, and thank you, Maruti, as well. So as I was mentioning, this next fireside chat is going to cut through the clutter. It's going to help separate fact from fiction and all the misconceptions around health, around fitness, and there's so many. So the session is aptly titled Fitness and Beyond, Define and then Defy Your Inner Boundaries. And to moderate this insightful conversation, if I could please invite on stage Ms. Rudrani Chaturaj. Let's have Rudrani on stage, please. I know she's here. She's entered the building. Let's have her on stage to do justice to this conversation. And joining her in this exclusive chat is someone who truly personifies strength, discipline, and fitness. Mr. Vidyut Jammwal. He's an Indian actor. He's a martial artist. He's a producer. He excels in action and cinema. He's known for performing stunts himself. He's ranked among the world's top martial artists. That's alongside Jackie Chan and Bruce Lee, earning global acclaim for the ancient Indian art form. And his film Jungli won the Jackie Chan Action Movie Award, and the Commando franchise made him Bollywood's top action hero. He's ranked among India's most desirable men. He's a youth icon for his ideologies and his inspiration. Vidyut Jammwal, ladies and gentlemen. And drawing from his deep study of ancient Indian texts and tours India, sharing how Patanjali's Yoga Sutras, Shiva Sutras, and the Vedas echo ideas in quantum physics, inspiring the youth to blend timeless wisdom with modern science. He's an icon. He's here amongst us. And Rudrani, with that, he's all yours.
Thank you so much. Hello, everyone. This is so exciting to be here. And you heard the very long introduction for Vidyut. It's actually longer because his achievements are too many. And he continues to be an inspiration. Let's give a round of applause for Vidyut Jammwal. So, like the session topic is, it says define and defy your inner boundaries. Vidyut is someone who has transformed not just his own life, but transformed lives for others, inspired so many. The first question that I want to ask is, in a very broader note, how have you understood fitness? People talk so much about fitness is this for me, fitness is that for me, lifestyle is this for me. What is your understanding of fitness, Vidyut?
Good evening, everybody. Thank you for being here. Like, what do I understand of fitness? Is that what you asked me? Yeah. Like, the more you get to know about yourself, the more you know about the fitness that you desire or you need to be, the level you want to reach. So I think the more you know yourself, the more you know about the fitness levels you have. I think that's how it is.
Absolutely, and you are now at a level that is really incredible. You know, just some moments back, I mentioned about defying your inner boundaries. I think we have a lot of questions about how do you defy your inner boundary? What are we talking about? What do you mean beyond just fitness? I'm going to start this by giving you a glimpse of the kind of things that look almost impossible to us sometimes that Vidyut has done. I would like to play a few videos and do a little breakdown with him and try to understand. Vidyut, this is going to be a surprise for you. So we're going to play some interesting videos for all of us to watch. Okay, can we please play the first video?
I'm not saying that thinking is bad. Like everything else, it's useful in moderation. A good servant, but a bad master. And all so-called civilized peoples have increasingly become crazy and self-destructive because through excessive thinking they have lost touch with reality. That's to say, we confuse science with the real world.
Thank you. I would like to play the full videos, but I know we are short on time. So this is to give you a glimpse of how he has gone beyond the understanding, defied his inner boundary for sure. Vidyut, how do you do this? How do you defy your inner boundary? Because that balancing act is incredible.
Like, how do you define, matlab, like, zaruri pata hai kya hai, that you need to know what you desire to do. Sometimes when I watch something or I watch somebody, I appreciate them. I'm like, wow, how did this human being do this? When I hear this wow inside me, I know I have the ability to do it too. That's my first realization. If you appreciate somebody, if you like something, if a cell lights up in your system, trust you me, you have the ability to do it too. And in my case, I follow it. So in this case, I was rollerblading a lot. I was working on a film called Track, and we needed to be rollerblading. And at that time, we got the Red Bull World Champions. And whilst I was rollerblading with them, I understood the idea of balance, like from the best in the world. And to enhance myself, I kept working on different methods of balance. And slacklining, this is highlining when you put a wire between two mountains or buildings. So this is amazing. Everybody should know what their balance is, how much can they balance. I think that's important. Jaise, I'm sure most of the people here work out in a gym. Like, the question you need to ask yourself is, how many of you can just stand up, take your laces off, take your socks off, put that back? If you can do that, you are fit in the regime or in the realm of balance. So if you want to balance check, this is a great way to know how balanced you are and then find a way to enhance that balance.
That is really interesting. You know, that I think we all have to do that. But Vidyut, defying inner boundary to hai. But you've also done like really scary stunts, you know, where you show like you have to be at a certain level of fitness to do that. Here, it is the heights that you're doing it and jumping and doing that is incredible, sure, but also scary. How do you kind of overcome fear?
No, it's the same thing. How do you have the courage to sit in front of so many people and have a conversation with somebody? That needs courage. You can ask people who have stage fright. It takes practice, it takes a desire, and once you keep doing it, you excel in it, and then people wonder, how did this one do it? It's as simple as that. If you desire something, go after it. Go after the method, learn the elements, the basics, and then you will excel in it.
You know, we always complain about आज बहुत गर्मी है और आज बहुत ठंडी है and क्या let's not go and do something, let's not go and go for a walk. I'm going to show you a video that'll make you realize some people just never have any kind of excuse. They will do whatever they have to in any kind of temperature. And it's going to make you feel very cold, this video for sure. Can we show him doing something in this video?
I train like Vidyut Jammwal, and I think everybody should train the way they think they should. I love you guys. मैं भी पहली बार इतने बड़े पे देख रहा हूँ. I've only seen it on my phone. It had snowed yesterday and day before yesterday massively. So to come here was difficult yesterday. So today I thought, why not?
For all the Vidyut fans who wanted to see six-pack, you will see it now.
The temperature is -8. I had buried myself in snow for 3 hours. It's a part of the Indian yogic tradition. So this was my training. I did this for about 18 days. So this is one of those videos.
Thank you. Just to give you an insight into how much he pushes himself. Like, this is incredible, right? Vidyut, and I'm saying this because we're in awe. Tell me, how have you kind of agreed with yourself to do this? You know, why have you agreed to do this? Like you were explaining, it is a part of your training process. But we'd like to know a little more because this is just something else, right? Like we kind of, like I said, when we think about cold weather, it's an excuse not to do anything. And then you see this, it was like -8 and then you're inside that water. It's, how is your brain even functioning at that time?
Like in the yogic kriya, this is not done really for the physical ability. This is for the mind. We always talk about the mind and we are never told about how to train our mind. This is one of the ways you do it. One of the ways, like there are zillions of methods. For example, if you enjoy smoking a cigarette, example, and the moment you're about to light a cigarette up, stop yourself. This is you stopping you and tell yourself that I will not do it for the next 1 hour. That is also training your mind. It's like if you desire to do something really at that time and you stop yourself, this is you teaching yourself. And once you train yourself, you start getting used to excellence from within. And I think this is one of the reasons I enjoy doing this. For me, being in snow, buried in ice for 3 hours was one of my best experiences. It was really not physical at all. Initially, it was physical. 10 minute, 15 minute, uske baad aap aur aapka dimag. It told me about all the disorders that I'd ever heard any doctor tell me. Gangrene ho jayega aapko. This is me sitting, 30 minutes, gangrene ho jayega. Then I passed that and then I realized, you know, chilblains ho jayenge. So I went through all of it and after I surrendered myself fully is when I realized that you can surpass all of it. And I think this is in everything of our lives.
I think most of the times when we don't want to go to the gym, I think we'll have to think of Vidyut Jammwal saying, train your mind. Because, isn't it? It's kind of easy to say no.
You know, like training your mind means I watch so many young people, I'm agnostic about age, but stress, anxiety, nervousness, trepidation, fear, everybody's feeling it more than what I've ever known. That's because we're not training our minds in any way. We want six-pack abs, we want big shoulders, we want to look like a bodybuilder, but what about the mind? I see the strongest men who we think are strong, when it comes to standing up for somebody, they never stand up. That means the minds aren't strong. So it's very important to train your mind. I think so.
You know, because you brought that aspect saying that people want to just get six-pack, want to become bodybuilders and all of that. There is also a lot of things that gym trainers often tell us, right? You know, for example, if you don't do strength training, you will never be able to lose weight or you will never be able to go there. Or stuff like your protein intake has to come from a certain place and that's a certain amount you have to take and you have to do this kind of a diet. Hum sab sunte hain. Vidyut, I want to know your idea of what do you think about the suggestions that you hear, especially given by gym trainers.
Like how many people train here? Can you like how many of you go to a gym or any form of training? That's it? This is like 5% of the people. Okay, now 10. And how many of you have a personal trainer here? You have a personal trainer, you have a lot of them. Now the thing is, like when I meet people and they ask me about, Vidyut, what do I do to change something? My question is, how much time have you had this trainer for? And if you've had this trainer for an X amount of time and you haven't seen the result, you're improving, you're feeling good about it, but you aren't seeing a drastic change, that is, you aren't achieving what you need to, then you need to start considering the kind of trainer you need to have. Like when I watch people, most of my friends, they're training with trainers who are either professional bodybuilders or are into bodybuilding, but most of the people don't want to look like bodybuilders, and they should really not look like bodybuilders because it's about fitness. If you want to be a bodybuilder, train with a bodybuilder. How many of you train with an athlete? For example, somebody who plays kabaddi or somebody who's a squash player or somebody who's a gymnast. Anybody here? No, not bad. Well done. So he would know, when you train with an athlete, like I'm not talking about a national champion, I'm talking about an athlete who's given his life a few years to it. You will see they talk differently about protein also. This is a bodybuilding concept of kitna protein le rahe hain sir, aapka body fat percentage kitna hai. This is bodybuilders language. The trainers have learned from other trainers who are bodybuilders and they think this is the amount of protein we need to eat. I'm not saying it's right or wrong. I just think everybody needs to know how they want to look. And for trainers, I believe that if you have a trainer and you really believe that the trainer is good, I believe give him 6 months only and don't pay him for it. You fix an amount with him and tell him at the end of 6 months, I will pay you any amount you're asking for, but show me the results. So I think that's what really can make a difference to people.
This is a revolution, guys. You go next morning and say, "Jab tak result nahi dikhenge, tab tak." I think this is wonderful. The most honest thing I've heard in a while. The other thing also is that, you'll see a lot of people also will feel very awkward to go and train at certain places, because of the way that they talk about fitness, like you rightly said, the kind of it's kind of beratement also to the person who's training. You're almost afraid to go to the gym because the atmosphere is not kind of safe, which is the way you talk, right? What are your thoughts on that?
Like, for example, I'll tell you from my observation, I like the way people watch people or actors or fitness enthusiasts or sportsmen. I watch human beings too. When I'm in a gym, I watch everybody, and I watch people being trained by the trainers. For example, I watch women doing deadlifts. Deadlift is when there's a bar which has a lot of weight on it, and you pull it from 0 to a certain position. Like, I wonder, why are the trainers making these women do heavy deadlifts? इन्होंने कुल्ली बनना नहीं है, इन्होंने luggage खींचना नहीं है. Like, why are we doing these exercises? This is for professional power lifters, where you go from 0, pull it up to a certain angle, and then push it above your shoulders. But I watch people doing these things and doing a lot of heavy weights. So my mind questions people too, that why haven't they questioned these people? So I think जो आपने शुरू में बोला था ना रुद्रानी कि first define the boundary. Like, you need to know what do you really need. And I promise you, if you have clarity of what you need, it will take you maximum 3 months. Like, maximum 3 months. I see people in my gym for years, and they're very dedicated. This is for all the people who train. I see the dedication in you. I've watched them reach the gym at 6. I watched them train diligently for 1 hour. And these are not people who are in the film industry. They are regular people who go and do jobs. They give their 100%, but I watched the trainers ask them, "Aapne aaj ye to nahi khaya?" Like, food is such an imperative thing. When most of the people I know are foodies, and they are asked not to eat this, don't eat this, after this, don't eat, so they're depressed. But they're listening to the trainer, they're doing everything, that 1 hour of sweating, but I see no change. No change. Yeah, the only change is they're not as happy because they're not eating what they love to eat. And to beat it up, the trainers will call in the evening showing their sincerity, saying, "Sir, aaj aapne sham ko kya khaya?" And the client will feel, "Arey, kitna sincere hai." Like, I don't think this should work like that. Eat what you want to eat, but that 1 hour in the gym, give it your all. And if you give it your all, I promise you, this is the maximum you can do.
I mean, isn't this amazing that we have him here? Because we are going to today make the best of this man and ask him how much of a questions we want to. But before that, I think the other very interesting video that I'd like to show is about how aware your senses are. It's also because you've studied, ancient yogic traditions and you studied the science of it. So before I show the video, I want to know, when you started studying it, till the time now that you have for so many years practiced it, what was the first change that you noticed in yourself?
What was the first thing I noticed in me when I started training?
Yeah.
No, every time I train, I see a change. I'm so aware of it, like step by step. I'm not in a rush to achieve something. I'm not in a rush to complete something. I'm in the desire to take every step. That is the only difference I see in me. And over the years, I've become more precise. I don't miss a single step. Like, from here to here is awareness. And if you do anything in awareness, like, it makes a change. Yesterday, I was talking to Rudrani, and the conversation was about how do you become aware when you're training. Or in Buddhism, they talk about it. In Zen philosophy, they talk a lot about the fact that eat in awareness, walk in awareness. You've heard this, right?
Yeah, of course.
So what does it mean is, I see people doing, Vidyut sir, aaj maine 10,000 steps kar liye. Watch. 10,000 steps. When somebody says walk in awareness, doesn't mean just do 10,000 steps and your watch has told you 10,000 steps. It means, if this is your regular pace, either you slow down or you make it a little faster. You'll be aware of something. You will be in control of you. When they say breathe in awareness, doesn't mean you start counting it. Everything. How much does it go in? How much does it come out? Do you take it from here? The intercostal muscles. That's called awareness. Jaise main, like, everybody's fit here. Rudrani, like, how many twos do we have? I love this part because I was introduced to this by a poet. It's an unusual thing. जैसे आपकी 2 आंखें हैं, मैं आप सबसे पूछना चाहूँगा, ये अवेयरनेस का ही सिलसिला है. आपकी 2 आंखें हैं. Like, how many twos do we have? This is like my class when I was in school.
We're all thinking we're giving
Nobody
wrong
wants
answers.
to answer.
There are no wrong answers
Like
here,
how
na?
many do you think, Rudrani? दो आंखें हैं? Give me a number like 6. Anybody here?
Actually more.
Who's this one? Not bad. Anybody else? So when we talk about awareness, 8 is not a bad number, sir. So गिन लेते हैं. 2 आंखें. Well done. 2 कान. अरे amazing. 2 हाथ. 2 टांगे. Sorry? Perfect है. 2 eyebrows. 2 nostrils. 2 lips. 2 shoulder. 2 elbow. Kidneys तो हैं ही हैं. 2 wrist. 2 अंगूठे. So this is awareness. The more you know about yourself, the more you will be able to, access those parts of your body. Yeah.
So well explained. Thank you so much. A round of applause for this wonderful gentleman and his empathetic way of looking at things as well. Before I ask further questions, एक वीडियो देखते हैं जहाँ पे इन्होंने अपने ये जो, like I'd say, the practice that he's done for so many years, you clearly see it, and it's astounding. I want that video where he is blindfolded and he is just doing incredible things. Can we please play that video?
Oh, this was recently at a show, and I had picked up this person from the audience, and he was amazing.
He looks petrified. He looks petrified.
And I had requested him not to talk. He kept talking.
You can see him doing all kind of chants. Vidyut, now please watch him. Terrified. Woo! उनके जान में जान आए, but that is incredible. That, I think, is awareness of another level. Thank you so much for the video.
Thank you.
Vidyut, you'll have to tell us how. How?
No, इसे तपस्या बोलते हैं. You got to be aware of everything from the sound to your every ability, the senses. It's training. This is a part of the traditional Kalari Payat, which talks about marma, which is you can heal people with a lot of abilities. This is a small glimpse of it. This is a part of the many yogic kriyas somebody has to do before they call themselves a yogi.
Just incredible. Because he's mentioned Kalari, I must say that Vidyut is, of course, globally representing our country. There's a movie called Street Fighter that has Jason Momoa and a lot of other massive Hollywood actors. In the movie Street Fighter, and our very own Vidyut Jammwal is a part of it. Round of applause for him, please. But thoda sa baat karna to padega. It's, we have to talk about Street Fighter a little bit. Because, I mean, when the announcement came, I'm sure all of us are very excited. But I know that the part that you have in it is also so interesting. All this jo years ki sadhana hai na aapki, it, in some way or the other, it always comes in use. And that is so wonderful. I think you will have to tell us a little more about that.
No, so anybody who's played the game Street Fighter, I hadn't played it when I was watching. I was playing with my body more than the games. But there's a character called Dhalsim. He represents the Indian yogi. And I was fortunate enough to be chosen by these guys. They auditioned me. And I get to fight the top action stars from Roman Reigns to the current champion WWE Cody Rhodes. Then we have Jason Momoa. We've got about 11 stars, and I'm very proud to be representing India in it, yes.
We are very proud of you and so excited to see the film, for sure. Okay, I think I would like to save the last 10-15 minutes for something very interesting. Whenever I've heard of stories also. I've met people who've told me that they've chatted with Vidyut at different points in their lives and had like some 2-3 minutes conversations with you, and they've asked you very pointed questions. And you've given them advice that they said changed their lives, which they call was transformative in a way. They said, oh, you know, we made those changes and we realized our lifestyle changed. So I want to take advantage of the man sitting here. We want to do something fun. We want to pass the mic to the audience and ask anyone. We take in like 4-5 questions. Ask about your own journey. Anything that you wanted to ask about fitness to this man here.
No, I don't understand. What do they have to do?
They get the opportunity to ask you a question. Anything about their own fitness journey, their idea, their myths, whatever. And hopefully you will please, answer them. So let's go. Can you, by the show of hands, tell if you have questions already? Okay, you already have the mic. Hi.
Hi.
Please introduce yourself.
Hi, Vidyut. I'm a very big fan of yours. Thank you for the great and very humble fan moment that I had just now. My question to you would be, being a person and at a phase like a so young age, I have an inspiration and I feel very obliged to have an inspiration like you who is representing India for the martial arts and also giving us the right advice for us at this point. My question is that how do you feel when you represent India for the martial arts and the tradition that we come from? And if we want to go into the fitness journey, what would be your message to have a disciplined life? And how do you want India to be looking forward in terms of our traditional martial arts?
तुम journalist हो? मैं पूछ रहा हूँ.
No, I pursued my journalism.
You'll be a good one for sure.
Thank you.
Your discipline like बहुत subjective चीज है. मैं सच बताऊँ मुझसे अक्सर पूछा जाता है, sir, how do you become disciplined? You need to find your own way. Like there's no method to discipline. Like, for me, because you asked me about me, for me, discipline becomes natural. It's passion. अगर मुझे कुछ सीखना होता है ना, फिर मुझे नींद नहीं आती है. But what I do for that is, when I'm lazy, I remember that I have to go after it. If I've promised myself that I'm going to run 10 kilometers tomorrow, for example, I never break a promise that I made to me. That's for sure. If I promise myself that tomorrow at 8 p.m. I'm going to go and train, even if I'm exhausted, tired, this promise I never break. So I think discipline for me means keeping the promise that I made to me. And I think that's how it should be for everybody. If you've decided you want to do something, nothing should stop you.
Absolutely.
And how does it feel? Journalist Sahab, bahut sahi.
It's very, very much thank you for the absolute pleasure of talking to you and all the best for your street fight.
I wish you all the best too.
Thank you so much. Okay, we already have one. Please go ahead and ask the question. Please introduce yourself.
Good evening, Mr. Jammwal. I'm Meher. I wanted to ask you, you've already summed up discipline pretty well. What I wanted to ask you is, how do you motivate yourself on days when you're not feeling good emotionally? Low points come in everybody's life. So is it mental resilience? How do you motivate yourself when you're feeling demotivated emotionally?
I get your question. A lot of people ask me this question, but I want to ask you this question so that I can really answer what you're asking me. Where does this question emerge from in your head?
I think every month, for example, you tell yourself you want to start on the 1st, maybe your gym membership, और अभी तो सैटरडे संडे है, मंडे से शुरू करते हैं. If the doctor tells you don't have mangoes, let the season get over, then we'll start. So I think you just keep putting yourself, you just keep putting it off, right? And then that's the reason I asked you this question.
To start with, you spoke about stress or being low. मुझे ऐसा लगता है कि ये ना बहुत लोग ऐसा करते हैं कि when they are in stress, they desperately want to get out of stress. When they are low, they desperately want to get like happy. They never try to be in the position they are in. Trust me, if you're stressed and you have the courage to acknowledge it, face it, you'll be surprised stress will leave you. The more you think about it, the more you want to avoid it, no, it's going to stick to you. आप खुश रह के देखिए बहुत देर रह नहीं पाएंगी क्योंकि वो भी चले जाता है. The moment you accept it, so the stress is a different part. Like I see people who are low and they are trying to genuinely be happy by doing certain things and they are still low. In my case, if I'm experiencing an emotion, I live it to the fullest. And the moment I'm aware of the fact that I'm living it to the fullest, it gets over. That is one. And how do you push yourself? Trust you me, the only person who would know to push you is you. For that you need to do self-introspection. मैं हर आदमी की बात कर रहा हूँ. Like the way I do it for me cannot work for you, and the way she does it for herself will never work for you. And what does self-introspection mean? Is you sit down, get a pen and a paper, you see what you want to do in 4 months or 3 months, and like I said, don't break a promise that you made to you. This is what I want to do. Now nothing should stop you. No friends, no mother, no father, no mango season. If you keep a promise that you made to yourself, you are high end of excellence. Does that answer your question?
Yes, it does. Thank you, Mr. Jammwal. Thank you.
Thank you for your question. We unfortunately can take in only 2 more questions. So I'm so sorry. We see one there. Yes, ma'am, please go ahead.
I just met this very amazing lady backstage and she told me she's a cancer survivor. Hats off to you, ma'am.
Thank you.
She's a wonderful foundation called Can Heal as well that works with a lot of survivors.
Yeah, so my question is for them only because I work for the cancer patients and survivor, and we are the one who lose all the strength because we've been through so much of trauma, medication and everything. So one side, people suggest us, do not do any physical activity, you are so weak, oh, if you lift a little heavy weight, you might end up, hurting yourself. So I really want, if you can give one advice for all the cancer patients and survivors, like how can they maintain their physical fitness and the mental fitness?
For the, like मैं specifically cancer patients के लिए नहीं बोल रहा हूँ, ये मैं सबके लिए बोल रहा हूँ. एक तो लोगों की बातें सुनना बंद करना बहुत ज़रूरी है. मैं सच बोल रहा हूँ, जिनकी हम बातें सुन रहे हैं उनको भी कुछ नहीं पता है. पहले तो ये एक्सेप्ट करना ज़रूरी है. Like for the patients you're talking about, you've been one. If you desire something, make sure you like attempt it. Make sure you attempt it. Like I can give you an example of pregnant women. I have a lot of friends and I enjoy being around them because उनका मन करता है ना अचार खाने का, तो वो उनका मन कर रहा है, उनके अंदर से आवाज आ रही है. उनका मन कर रहा है ना गोलगप्पे खाने का, तो उनके अंदर से आ रही है. अब आप बोल नहीं सकते नहीं खाइए, और अगर आ रही है तो एक बार खा लीजिए. Similarly for people, if you desire moving and everybody says don't move, trust you me, you should move. If your mind is telling you, like this is how we initially started, if you know how to listen to yourself, please listen to yourself, because nobody knows better about you than you.
Yeah, so I can say that recently I lift a leg press of 180. So yeah, what you're saying is right.
क्या करेंगी 180 किलो उठा के रे बाबा? But well done. Well done.
Thank you so much, ma'am, for that question. This is the last question of the day. Hi, please introduce yourself.
नमस्ते विद्युत जी, मेरा नाम प्रेरणा मिश्रा है. मैं आंचल दी के साथ ही सोशल वर्क में काम करती हूँ. मेरा बहुत सिंपल सा सवाल है. जब आपने ये रास्ता चुना योग में जाने का, योगिक क्रिया सीखने का, इंडियन मार्शल आर्ट में जाने का, तो सबसे पहले दोस्त और परिवार ही सहयोग देते हैं या फिर रोकते हैं. तो आपका बेसिक स्ट्रेंथ जो था जब आपने डिफरेंट पाथ चूज किया, उस वक्त सबसे ज़्यादा हिम्मत किसने दी?
आप जानना क्या चाहती हैं कि who was the support system? Is that your question?
Yes.
Like, simply the mother. गलतफहमी सबसे ज्यादा माँ को होती है. वो बोलती है तुम हीरो बन सकते हो. आसपास किसी को नहीं लगता है, सबको लगता है तुम लायक नहीं हो उसके. फिर एक दो दोस्त होते हैं जिनको लगता है तुम गारंटी हीरो बन सकते हो. वैसे ही कई लोग होते हैं. There are so many people you can give credit to. Yep, you can't say one person like. बट ये जो पथ जिसकी आप बात कर रहे हैं, जिस राह की आप बात कर रहे हैं, जिस रास्ते की आप बात कर रहे हैं, अधिकतर ये आपको चुनता है कि आप तैयार हैं कि नहीं, उसके लिए उस पर डिपेंड करता है.
क्योंकि फैमिली सबसे पहले रोकती है कि हमारा बेटा सब कुछ छोड़ छाड़ के हिमालय पे न चला जाए या दुनियादारी से दूर ना हो जाए. तो बस इसीलिए मैंने आपसे
दुनियादारी से दूर ना हो जाए. दुनियादारी करके क्या कर रहे हैं लोग? परेशान तो हैं. मतलब
ये बात अगर सबको समझ में आ जाए तो बहुत.
अगर आपको समझ आ गई है तो पहुंच जाओ पहाड़ों पे आप भी. अथ योगा अनुशासनम. नाउ स्टार्ट्स द डिसिप्लिन ऑफ योगा. योगस चित्त वृत्ति निरोधः. अपने दिमाग चित्त के अंदर जितनी भी इम्बैलेंसेस हैं खुद निकालो, अपना असली स्वरूप दिखेगा आपको. तत्र स्थितो यत्नो अभ्यास. वहां लगे रहो, लगे रहो. लोग मानेंगे नहीं कि आपसे हो पाएगा. सतु दीर्घ काल नैरंतर सत्कारा सेवितो दृढ़ भूमि. सतु दीर्घ काल लगे रहो, समय लगेगा, हो सकता नहीं पहुंचो, मगर एक बार जब आप पहुंच जाओगे ना, तो जो आप मेरे से सवाल पूछ रही हैं वही जवाब आप सबको देंगी. बट यू आर अमेजिंग. थैंक यू फॉर दिस क्वेश्चन.
Thank you so much. I wish we could have some more and carry on because बहुत मजा तो आ रहा है. Can we again give a round of applause for everyone in the audience who's asked such wonderful questions and of course this wonderful man. Thank you so much Vidyut for being a part of the Times Network India Health Summit. We're really, really honored to have you here for taking this movement forward and, you know, changing India a little bit day by day and all of that.
मैं जाने से पहले एक बात बोलना चाहूंगा. Will you give me a minute please?
Absolutely.
For all the people who are here now that I'm here. मैं आपको एक बात बोलना चाहूंगा. Women, this is for you. पतले होने की कोशिश मत करिए, खुश होने की कोशिश करिए. मैं सच बोल रहा हूँ. I see happy people more attractive than people trying to lose weight. If you desire to, find the right way. And men, I want to tell you, stop telling women, तुम पतली होगी. अरे छोड़ो यार, तुम बहुत खुश लग रही हो. That's the compliment. Please eat everything you desire. I promise you, food is amazing. Find a trainer who lets you eat everything and makes you work really hard. Thank you.
Maybe have more men like Vidyut Jammwal. Thank you once again, Vidyut. I'll have to come and give you a hug. Thank you so much for doing this. And once again, a round of applause for him.
Thank you, Mr. Jammwal, for
Thank you so much.
inspiring
Thank
us with your journey, your insights. And thank you, Rudrani, for steering such a lovely conversation. I think you've definitely motivated all of us to separate myths from reality and embrace a more conscious approach to fitness and health. And thank you. And Mr. Jammwal, I ask that you remain on stage for just a moment longer. If I could please have Maruti Indoria, Vice President with Times Network Digital and Managing Editor with Times Network Digital, Pooja Sethi, please present Vidyut Jammwal with a special token of appreciation, a felicitation, and this one's incredibly well-deserved. A special award for Vidyut Jammwal, Fitness Icon of the Year, ladies and gentlemen. Huge round of applause. It's only apt. Thank you so much. Thank you so much, Vidyut. A very special conversation, a lot of rich takeaways that are worth remembering. Thank you. All right. Thank you again. It was an absolute treat. And as we get closer to announcing our next set of awards, I want to just take a moment longer to re-acknowledge our sponsors in this effort. You're all familiar with them, but nonetheless, the Times Network India Health Summit and Awards 2025 would simply not be possible without our powered by partner Intas, our co-powered by partners Novartis and All Out, of course, our knowledge partner Dr. MGR Educational and Research Institute, our supporting partner Fit India, our strategic alliance partner Onyx Telecommunications, our wealth partner Nuvama Wealth, and our outdoor partner Heights. And with that, we will quickly move on. And Maruti Indoria, Vice President of Times Network Digital, can I please have you back on stage, sir, to present the next category of awards? All right. Maruthi's quickly approaching the stage. Okay. And as Maruthi approaches the stage, our first set of awards is going to be for a Times Now Health Ranking Survey. That's right. This Times Now Health Ranking Survey will award multi-specialty group of hospitals. And I'll announce the rank one by one and who's deserving of the honor. So with that, as per the Times Now Health Ranking Survey for multi-specialty group of hospitals, rank 1 national was secured by Apollo Hospital. Can we have the Apollo Hospital team on stage to accept the honor, ladies and gentlemen? Congratulations. All right. And rank 2 national. Again, this is for multi-specialty group of hospital as per the Times Now Health Ranking Survey. Rank 2 national goes to Manipal Hospital. Can we have the Manipal Hospital team on stage to accept the honor? All right. And rank 3 national for the Times Now Health Ranking Survey for multi-specialty group of hospital. Rank 3 national was secured by Max Hospital, ladies and gentlemen. Let's have the Max Hospital team on stage to claim the honor. It's our pleasure to felicitate them here at the India Health Summit and Awards 2025. All right. And we'll move on to rank 4 national. This is again according to the Times Now Health Ranking Survey for multi-specialty group of hospital, and it goes to Paras Healthcare. Can we have Paras Healthcare on stage to accept the honor? Congratulations once again to the Paras Healthcare team. Thank you. And this was a bit of a tiebreaker, so we have another winner that's come in at the rank 4 national position. Again, this is as per the Times Now Health Ranking Survey for multi-specialty group of hospital. So the tiebreaker that was also able to secure rank 4 national is Aster Hospital. Can we have Aster Hospital on stage, please? Can we have the team claim the honor? Okay, we'll move on to rank 5 national for the Times Now Health Ranking Survey multi-specialty group of hospital. Rank 5 national was secured by Care Hospital. Can we have the team on stage? Congratulations, sir. And now we'll move on So in the next category, which is India Most Trusted Hair Transplant Experts, Rank 1 National was secured by DHI India. Can we have the DHI India team on stage? Congratulations, sir. And congratulations to the entire DHI India team. All right, and with that, we move on. And this is a highly coveted category for IVF and fertility clinics. And rank 1 in the South region was secured by 49 Fertility Center. Can we have the team on stage to accept the recognition and our felicitation? Yes. And now for our next award. This winner has secured the #1 rank as the emerging hospital in Greater Noida, and it goes to Sharda Care Health City. Can we have the Sharda Care Health City team on stage? Congratulations once again. All right, and our next award is for excellence in quality care, and it goes to Prakash Group of Hospitals. So if we could please have Dr. Mona Singh, Dermatologist Director, Prakash Hospitals and Institutes, and Ayush Chauhan, Executive Director, Prakash Hospitals and Institutes. Congratulations once again, and once again. This is for a highly coveted category, ladies and gentlemen. Congratulations for excellence in quality care to Prakash Group of Hospitals. All right, and now we move on to our next category, ladies and gentlemen. And we have multiple winners in this particular category, which is a pioneer in IVF care and innovation. And the first winner is Anupria Prashant, COO. Can we please have him on stage? Anupria Prashant, pioneer in IVF care and innovation. Congratulations, sir. Huge congratulations to you. All right, and now we'll move on to our next winner. Again, in the same category, pioneer in IVF care and innovation. And this goes to Dr. Ashok Kumar, Managing Director. Can we kindly have him on stage, please? Right. Keep the applause coming, ladies and gentlemen, for your fellow peers and your fellow medical professionals in the community and in the fraternity. And our next winner in this same category, pioneer in IVF care and innovation, goes to Medical Director and Co-Founder, Dr. Durga Rao. Can we please have Dr. Durga Rao on stage to accept the recognition and to accept the honor? And we move on to our next pioneer in IVF care and innovation. And our next pioneer, ladies and gentlemen, is CEO Dr. Somesh Kumar Mittal. Can we kindly have Dr. Somesh Kumar Mittal on stage to accept the recognition and accept the felicitation? All right, we'll move on, ladies and gentlemen. Yes. All right, we'll move on to excellence in IVF care. And for excellence in IVF care, we have multiple winners, the first of which is Dr. Vandana Hegde. She's the Clinical Director and Chief IVF Consultant. Can we please have Dr. Vandana Hegde on stage to accept the honor and recognition? All right, she's quickly approaching the dais. Congratulations, Dr. Vandana. from the entire Times Network team for this recognition. And with that, we move on to our next winner in excellence in IVF care, and that is Dr. Gauri Agarwal, founder and director. Can we have Dr. Gauri Agarwal on stage to accept the honor, please? Okay, we'll move on to our next winner in excellence in IVF care, and the winner is Dr. Rohit Chadda, medical director. Can we kindly please have him on stage? Congratulations once again to Dr. Rohit Chadda. Is he amongst us? Not here, not here. All right. We'll move on to our next winner for excellence in IVF care, and that is Dr. Gunjan Gupta, director and founder. Can we kindly please have them on stage? Congratulations, Dr. Gunjan. All right, and with that, we'll move on. And our next winner is in the same category, Excellence in IVF Care, Dr. Pooja Dheer Bayana, Clinical Director. Is Dr. Pooja amongst us? All right, congratulations, ma'am. We honor you, we salute you. Kindly please do join us on stage to accept the recognition. All right, thank you. And we now move on to our next winner in Excellence in IVF Care. And our next winner for Excellence in IVF Care is Dr. Sonu Takaks. Dr. Sonu Takaks, Director and Senior IVF Consultant. Let's please have Dr. Sonu on stage. Thank you so much. And we now move on to our next winner for Excellence in IVF Care. And she is the Clinical Director and Unit Head. And our winner is Dr. Bhavna Banga. Can we have Dr. Bhavna on stage, please, to accept the recognition? All right, we'll move on to our next winner in Excellence in IVF Care, and the winner is Dr. Ashwini GB. She's a Scientific Director, Consultant in Reproductive Medicine, and Chief Embryologist. Can we please have Dr. Ashwini on stage to accept the honor? And our next winner for Excellence in IVF Care. Okay, our next winner for Excellence in IVF Care is Dr. Parul Agarwal, Director of Fertility in IVF. Let's please have Parul on stage. Dr. Parul, huge congratulations once again. All right. Our next winner is Dr. Rajul Tyagi, Director for Excellence in IVF Care. Is Dr. Rajul Tyagi amongst us? All right, with that, we'll move on to a next category, which is Emerging Regional IVF Chain. And it goes to, the winner is Dr. Jagjit Singh, Executive Director. Can we have Dr. Jagjit Singh on stage, please? All right, with that, we'll move on. Emerging Regional IVF Chain. And in this category, we also have Jagatjeet Singh, co-founder and director. Jagatjeet Singh. Oh. Congratulations, Jagatjeet Singh. With that, we move on to emerging regional IVF chain. And the winner is co-founder and director, Vivek Kohli. Let's kindly please have Vivek Kohli on stage to accept the recognition. And with that, we move on to our next category, which is Pioneer in IVF Care and Innovation. And our first winner in this category is Abhishek Agarwal, CEO. Let's kindly have Abhishek Agarwal on stage as a pioneer in IVF care and innovation. All right. In the same category, we also have Dr. Neeta Jain, CEO and co-founder. Can we kindly have her on stage? Congratulations, Dr. Neeta, on this special recognition for your pioneering work in IVF care and innovation, ma'am. And with that, we'll move on to our next winner in the same category, pioneering in IVF care and innovation. And our next winner in the same category is Dr. Mahalakshmi S., Chairperson, Founder and Scientific Director. If we could please have Dr. Mahalakshmi on stage to accept the recognition. Thank you, ma'am, and congratulations once again. And after that, we'd like to now felicitate Dr. Abel George, who's the chairman of PSRI Institute of Pulmonary, Critical and Sleep Medicine. If Dr. Abel George could please join us on stage to accept the honor and recognition. With that, we'll move on. The next category is Service Excellence in Neurosciences and Mental Health. And the award goes to Dr. Praveen Gupta for Marengo Asia Hospital, Gurugram. He could please join us on stage and accept the honor. All right. And our next category is for Hair Transplant Surgeon of the Year. And the award goes to Dr. Gaurav Garg. Can we please have Dr. Gaurav on stage? Congratulations once again, sir, for your excellent industry firsts in hair transplant surgery. And with that, we move on to our next category, ladies and gentlemen, which is Innovation in Genomics, Diagnostics and Wellness. And our winner in the category of Innovation in Genomics, Diagnostics and Wellness is the award goes to Strand Life Sciences. If we could please have Mr. Arvind of Pachapur on stage to kindly claim the recognition. Congratulations once again, sir, Mr. Arvind. Innovation in Genomics, Diagnostics and Wellness. And we move on to our next category, which is Excellence in Advanced Hair Transplant Techniques and Results. And the winner in this category, ladies and gentlemen, is Satya Skin and Hair Solutions. If we could please have Dr. Shail Gupta and Dr. Ruchi Agarwal approach the stage, and we'd love to felicitate them. Thank you so much. A deeply deserved honor. And with that, we'll move on to Service Excellence in Robotic Orthopedics, Surgery and Joint Replacement. And the winner in this category, ladies and gentlemen, is Dr. Hemant Sharma, Marengo Asia Hospital, Gurugram. We have Dr. Sharma approach the stage. Service Excellence in Robotic Orthopedic Surgery and Joint Replacement. And we move on to our next category, ladies and gentlemen, which is Service Excellence in Pediatrics. And the winner in this category, being felicitated for Service Excellence in Pediatrics, is Dr. Neeraj Kumar. Can we have Dr. Neeraj Kumar on stage, please? Congratulations once again, sir. And with that, we'll move on to Excellence in Home Medical Devices. And the winner is Mr. Manish Thakkar. Can we have Manish Thakkar approach the stage, please, for his groundbreaking work in advancements in home medical devices. All right. Congratulations, sir. We salute you for this honor and this recognition and your contributions to the field. Our next category, ladies and gentlemen, is Young Visionary in Healthcare. And in the category, Young Visionary in Healthcare, our winner is Mr. Rishabh Gupta. Can we have Mr. Rishabh Gupta approach the stage, please? Congratulations, sir, for your groundbreaking work. All right, with that, we move on to our next category, which is Transformational Healthcare Leader. And the winner in this category is Vineet Agarwal, GCOO. Can we kindly please have Vineet Agarwal approach the stage and receive the honor? All right. Congratulations once again to Vineet Agarwal and team for their transformative work in the healthcare industry. And with that, we move on to our next category, which is Innovation in Hairline Design and Aesthetic Craftsmanship. And the award goes to Eugenics Hair Sciences, Dr. Arika Bansal, co-founder and managing director. Let's have the Eugenics Hair Sciences team on stage. Congratulations once again for groundbreaking work in hairline design and aesthetic craftsmanship. And with that, we move on to our next category, which is Innovation and Excellence in Oncology, Precision Genomics, and Dementia Diagnostics. And the winner in this category is OnQuest Laboratories. Can we have Ms. Vandana Vadva approach the stage to receive the honor? Congratulations once again, Ms. Vandana. Innovation and Excellence in Oncology, Precision Genomics, and Dementia Diagnostics. Congratulations to the entire team at OnQuest. And now we move on to our next category, ladies and gentlemen, which is Felicitation for pioneering work in the field of interventional cardiology. And the award goes to Dr. Suraj Hanumant Chavan. Congratulations, Dr. Suraj, for all your groundbreaking work. Once again, ladies and gentlemen, a pioneer in the field of interventional cardiology. And now we move on to pioneer in robotics knee replacement surgery in Punjab. And we'd like to felicitate Dr. Gagandeep Singh Sachdeva. Can we kindly have Dr. Sachdeva on stage? His groundbreaking work, robotics knee replacement surgery across the state of Punjab. And this time for pioneer in robotics knee replacement surgery in the state of Haryana, we welcome Dr. Anurag Agarwal to accept the honor. Congratulations, Dr. Agarwal and team, for all your groundbreaking work. And for the pioneering work in robotics knee replacement surgery in Uttar Pradesh this time around, can we please felicitate Dr. Atul Mishra? If we can have Dr. Atul Mishra please take the stage. Again, this is for pioneering work in robotics knee replacement surgery across the state of Uttar Pradesh. Congratulations, sir. And thank you for being here at the Times Network India Health Summit and Awards 2025. Lovely. And for excellence in gynecology and laparoscopy surgery, this next award, this next felicitation goes to Dr. Rajashri Teshete Basale. Can we please have Dr. Rajashri on stage to kindly accept the honor? All right. Our next category is Excellence in Multi-Specialty Dental and Skin Clinic, Delhi NCR. And the felicitation is for Matrix Dental and Skin Lounge. Can we have the Matrix team on stage, please? This is for Excellence in Multi-Specialty Dental and Skin Clinic, Delhi NCR. Congratulations to the entire Matrix Dental and Skin Lounge team. A huge honor and very well deserved. We now move on to our next category, ladies and gentlemen, which is for Healthcare Innovator of the Year. And for Healthcare Innovator of the Year, it goes to Naveen Nair of Maitra Hospital. Congratulations, sir. Maitra Hospital and team, please do join us on stage in accepting the honor. All right. And our next award and our final award of the evening, I'm told, ladies and gentlemen, is for gynecologist and director, Indira Hospital, Hyderabad, for maestro in gynecology, Indira Gauri. Can we please have Indira Gauri on stage? Thank you, ma'am. All right, and Maruti, I ask that you please felicitate Mohammed Rizvi, who's the founder and chairman of Onyx Telecommunications, one of our partners and our very valued partners in this effort. Mohammed, sir, if we could kindly please do have you on stage. And Maruti, if you could please present, sir, a token of our gratitude. Okay, Mohammed sir, I ask that you please remain on stage for a few moments longer. Right. And sir, if I could please have you approach the dais. I believe you have some remarks to make to our audience. So we'd welcome the opportunity to hear from you. So I ask that you please take the stage.
Hi, good evening, everyone. On behalf of OneXtel Communication Media Private Limited, our division of OneXtel Limited, I extend my heartfelt gratitude to Times Now for associating with us for this initiative, Times Now Health Survey and Conclave. This initiative is not just an event, it is a cause. The health survey will act as a directory of trust and guidance, helping patients and healthcare seekers identify where in their regions they can assess the right treatment at the right time, especially in emergencies and for the specialized care. While working on this initiative and engaging with the Indian medical fraternity, from multi-specialty hospital to single specialty hospital, from super clinic chain to clinic, the key insight what we have realized, every healthcare institution is investing in innovation and technology to deliver the best possible services. Yet, these services are not always easy, accessible, or communicated effectively. As a strategic communication company, our role has been to bridge this gap, to amplify stories, to highlight specialization, to ensure that the information reaches the people who need it most, so that healthcare communication becomes accessible, transparent, and impactful. Today, I would like to take a moment to thank and congratulate all the esteemed speakers, panelists, and sharing such deep medical insights. And all the nominees, this recognition is not just a milestone, but a continuous journey of excellence. We wish you success in carrying this forward. Once again, my sincere thanks to Times Now for this meaningful collaboration. We at OneXtel look forward to working closely with stakeholders to make healthcare communication stronger and more accessible. Thank you and have a pleasant evening. Thanks.
And there's one award that's last but certainly not least. It's for excellence in hair transplant and restoration, and it goes to DHI Medical Group. So if the DHI Medical Group is here amongst us, I ask that you please come on stage. And Maruti Indoria, if we could please have you back on stage, sir, to present the last and final award. Maruti, if you could kindly do the honors. This is for excellence in hair transplant and restoration, and it goes to DHI Medical Group, the last award of the evening. Let's keep the applause coming, ladies and gentlemen, for our industry peers and our fellow medical professionals. All right. To the DHI Medical Group, thank you and for your contributions. And thank you, Maruti, once again. So, ladies and gentlemen, as we draw the curtain, we reflect on the wealth of insights that were shared earlier, from groundbreaking discussions on AI in healthcare to powerful stories of survivorship and resilience, from policy inequity to infrastructure, wellness and preventative care. This summit highlighted the collective vision of building a healthier, fitter and more empowered India. A heartfelt thank you to all of our distinguished speakers, our panelists, our moderators, our special guests who made this day insightful and memorable. Your expertise, your stories and guidance have truly enriched the platform. And on behalf of Times Network, thank you for being a part of this journey. We look forward to welcoming you next year as we continue to celebrate excellence in innovation and impact in Indian healthcare. With that, it's a wrap here at the inaugural get the second edition of the India Health Summit and Awards 2025. Thank you. And I'd really like to acknowledge our entire crew, our technical crew, our console that has kept the entire show going from the afternoon through the evening for recognizing all the pioneers in the healthcare ecosystem pan-India. It takes a lot of hard work. Thank you for being here. Thank you. Thank you once again. Have a lovely